1. Liver cirrhosis is a chronic liver disease characterized by progressive fibrosis and regenerative nodule formation, leading to liver dysfunction, often resulting from chronic alcohol consumption, hepatitis B or C infections, and other chronic liver injuries, contributing to complications like portal hypertension, ascites, hepatic encephalopathy, and increased risk of hepatocellular carcinoma. 2. The diagnosis of liver cirrhosis is often based on clinical features, laboratory tests showing liver dysfunction, imaging studies like ultrasound or CT scans revealing nodular liver surface and altered architecture, and sometimes a liver biopsy confirming histological findings of fibrosis and nodular regeneration, particularly when the etiology is uncertain. 3. Ascites, the accumulation of fluid in the abdominal cavity, is a common complication of liver cirrhosis and results from portal hypertension and hypoalbuminemia, often diagnosed through physical examination, ultrasound confirming fluid presence, and analysis of acidic fluid regarding cell count and albumin concentration to rule out spontaneous bacterial peritonitis and malignant causes. 4. In liver cirrhosis, portal hypertension arises due to increased resistance to portal blood flow through the fibrotic liver, manifesting clinically as splenomegaly, variceal hemorrhage, ascites, and caput medusae, diagnosed through clinical examination, endoscopic findings of varices, and imaging modalities showing dilated portal system vessels. 5. Hepatic encephalopathy is a neuropsychiatric syndrome associated with liver cirrhosis, characterized by a spectrum from subtle cognitive dysfunction to coma, predominantly caused by elevated systemic ammonia levels due to impaired hepatic detoxification, and is often reversible with medical treatment and dietary protein modification. 6. Liver cirrhosis significantly alters pharmacokinetics and pharmacodynamics, resulting in enhanced drug adverse effects or reduced efficacy, necessitating careful drug choice and dosing due to compromised hepatic metabolism and altered plasma protein binding capabilities, requiring particular caution with drugs such as NSAIDs, sedatives, and anticoagulants. 7. Jaundice in liver cirrhosis results from the liver's inability to adequately conjugate and excrete bilirubin due to liver cell dysfunction, leading to elevated levels of unconjugated bilirubin, presenting with yellowish skin and scleral discoloration, dark-colored urine, and pale stools, serving as a marker of advanced liver disease. 8. Variceal hemorrhage is a life-threatening complication of liver cirrhosis caused by rupture of esophageal or gastric varices, a consequence of portal hypertension, presenting with hematemesis or melena, requiring urgent endoscopic assessment and possible intervention alongside pharmacological measures such as vasopressin analogs and prophylactic measures in high-risk patients. 9. Liver cirrhosis increases the risk of hepatorenal syndrome, a functional renal failure associated with portal hypertension and circulatory dysfunction, characterized by marked vasoconstriction of renal vessels leading to reduced glomerular filtration rate, and treated with volume expansion, vasoconstrictors, and ultimately bridging to liver transplantation. 10. Ultrasound elastography is a non-invasive imaging technique used to assess liver stiffness and fibrosis severity in liver cirrhosis, providing a quantitative measure correlated with histopathological fibrosis stage, assisting in monitoring disease progression and guiding clinical decision-making regarding cirrhosis management without the need for repeat liver biopsies. 11. Spider angiomas, small, dilated blood vessels with a central red dot, frequently occur in liver cirrhosis due to hyperestrogenism from impaired estrogen metabolism, serving as a clinical hallmark observed on the upper body, often found alongside palmar erythema, both of which may signify advanced liver disease. 12. Serum to ascites albumin gradient, SAAG, is a diagnostic tool differentiating causes of ascites in patients with liver cirrhosis. A gradient greater than or equal to 1.1 grams per deciliter indicates portal hypertension-related ascites, helping to exclude non-cirrhotic causes such as peritoneal carcinomatosis or tuberculosis. (13) Nutritional deficits are prevalent in liver cirrhosis due to malabsorption, altered metabolism, and poor dietary intake, necessitating nutritional assessment and intervention focusing on ensuring adequate calorie intake, avoiding protein-energy malnutrition, and supplementing vitamins and minerals like zinc and vitamin D to improve clinical outcomes. (14) Thrombocytopenia in liver cirrhosis can stem from splenic sequestration of platelets secondary to portal hypertension or decreased thrombopoietin production by the liver, contributing to increased bleeding risk, and necessitating caution with invasive procedures and potential platelet transfusion prior to surgery. (15) The Child-Pugh score is an assessment tool used to evaluate the prognosis of chronic liver disease, incorporating clinical and laboratory parameters including bilirubin, albumin, prothrombin time, ascites, and hepatic encephalopathy, categorizing cirrhosis severity into classes A, B, or C, which helps guide therapeutic strategies and predict perioperative risk. (16) Alcoholic cirrhosis results from prolonged heavy alcohol intake leading to liver inflammation and scarring, and is often accompanied by steatosis and alcoholic hepatitis, requiring absolute abstinence from alcohol as the primary treatment, which can stabilize or ameliorate liver damage and improve overall prognosis. (17) Liver transplantation is a definitive treatment for end-stage liver cirrhosis, indicated when medical management fails or life-threatening complications ensue, involving replacing the diseased liver with a healthy donor liver, a procedure with careful recipient selection based on criteria such as MELD score predicting post-transplant survival. (18) Metabolic and physiological alterations in liver cirrhosis cause muscle wasting, known as sarcopenia, due to factors like systemic inflammation, hormonal imbalances, and altered amino acid catabolism, necessitating focused nutritional and physical rehabilitation strategies to improve patient mobility, quality of life, and survival outcomes. (19) Hepatopulmonary syndrome is a vascular complication of liver cirrhosis, characterized by hypoxemia due to intrapulmonary vascular dilation and shunting, presenting with dyspnea and platypnea orthodeoxia, requiring diagnosis through contrast-enhanced echocardiography and supplemental oxygen, with definitive treatment through liver transplantation. (20) The MELD, Model for End-Stage Liver Disease, score is an objective prognostic tool used to prioritize liver transplantation candidates based on a formula incorporating bilirubin, INR, and creatinine levels to predict 3-month mortality risk in cirrhotic patients, influencing the allocation of donor livers in liver transplant programs. (21) Non-alcoholic steatohepatitis, NASH, related cirrhosis is increasingly recognized due to the global rise of obesity and metabolic syndrome, presenting initially with fatty liver and progressing to inflammation and fibrosis, necessitating lifestyle modifications, with emerging pharmacological therapies targeting metabolic pathways in ongoing research phases. (22) Portal hypertensive gastropathy is a condition associated with liver cirrhosis, resulting in mucosal changes in the stomach and stomach bleeding due to portal hypertension, identified through endoscopy as mosaic-like patterns and treated with beta blockers to reduce portal pressure and prevent recurrent bleeding. (23) Biliary cirrhosis results from chronic injury and destruction of bile ducts, seen in conditions like primary biliary cholangitis, with subsequent fibrosis and cirrhosis development, presenting with cholestatic jaundice, pruritus, and elevated alkaline phosphatase levels, and treated with ursodeoxycholic acid to slow disease progression. 24. Autoimmune hepatitis can progress to liver cirrhosis if untreated, characterized by necroinflammatory liver damage, presence of autoantibodies, and elevated immunoglobulin G, necessitating immunosuppressive therapy as treatment, typically with corticosteroids and azathioprine to achieve remission and prevent cirrhotic progression. '25. Hepatorenal syndrome type 1 is a rapidly progressive form of renal failure seen in patients with advanced liver cirrhosis, associated with marked renal hypoperfusion and poor prognosis, necessitating urgent supportive measures such as albumin infusion and vasoconstrictors while awaiting liver transplantation as the definitive treatment. '26. Hyperestrogenemia in liver cirrhosis, due to impaired hepatic metabolism leading to elevated estrogen levels, causes clinical signs like gynecomastia, testicular atrophy, and red palms, and may contribute to vascular changes in coagulopathy, necessitating management of underlying liver dysfunction to alleviate these hormonal imbalances. '27. Coagulopathy in liver cirrhosis results from impaired liver synthesis of clotting factors and thrombocytopenia, leading to increased bleeding risks, requiring careful monitoring of coagulation parameters and cautious use of anticoagulants, as well as possible administration of clotting factor concentrates or platelet transfusions in bleeding episodes. '28. Portal vein thrombosis in liver cirrhosis can worsen portal hypertension and is often asymptomatic or presents with abdominal pain and gastrointestinal bleeding, requiring anticoagulation therapy balancing bleeding risks, and possibly interventional procedures like thrombectomy or shunt placement in refractory cases. '29. In liver cirrhosis, small intestinal bacterial overgrowth can occur due to altered gut motility and bile salt deficiency, contributing to further liver damage through bacterial translocation and endotoxemia, managed with a combination of antibiotics, probiotics, and dietary changes to restore balanced gut flora and reduce liver insults. '30. In advanced liver cirrhosis, patients may develop hepatopulmonary syndrome characterized by pulmonary vasodilation leading to hypoxemia and dyspnea, with a diagnosis supported by arterial blood gas analysis and contrast-enhanced echocardiography, managed with oxygen therapy and considering liver transplantation as a definitive cure. '31. Spontaneous bacterial peritonitis, SBP, is a severe and often recurrent infection of acidic fluid in patients with liver cirrhosis, frequently caused by gram-negative bacteria, diagnosed through acidic fluid analysis showing polymorphonuclear leukocytes count greater than 250 cells per cubic millimeter and treated urgently with antibiotics and albumin infusions. '32. Hyperdynamic circulation is a feature of advanced liver cirrhosis, characterized by increased cardiac output, decreased systemic vascular resistance, and compensatory mechanisms involving renin-angiotensin and sympathetic nervous systems, contributing to complications like variceal bleeding and requiring beta blockers for hemodynamic stabilization. '33. Patients with liver cirrhosis may develop a compensatory gastric ulcer due to altered gastric mucosal protection and increased portal pressure affecting gastric blood flow, necessitating regular endoscopic evaluation and preventive measures like proton pump inhibitors or treating Helicobacter pylori infection if present. '34. Hepatic hydrothorax in liver cirrhosis is the accumulation of pleural fluid typically on the right side due to transdiaphragmatic migration of acidic fluid in the presence of diaphragmatic defects, leading to respiratory distress and managed through therapeutic thoracentesis, dietary sodium restriction, and diuretics, with liver transplantation as curative. '35. Changes in dermal collagen composition and metabolism may occur in liver cirrhosis due to alterations in circulating cytokines and growth factors, leading to complications like Dupuytren's contracture, which is recognized by palmar fascia thickening and flexion contractures of fingers, managed conservatively or surgically if functional impairment arises. 36. Liver cirrhosis patients have an increased risk of osteopenia and osteoporosis due to malabsorption of fat-soluble vitamins, specifically vitamin D, and alterations in bone metabolism, necessitating regular bone density screening and calcium and vitamin D supplementation to prevent fractures and maintain bone health. 37. Cutaneous manifestations such as leukonychia, due to hypoalbuminemia, and Terry's nails, characterized by proximal nail whitening, are observed in liver cirrhosis, serving as non-invasive clinical indicators of chronic liver disease severity and necessitating management of underlying liver dysfunction for improvement. 38. Increased levels of cytokines and oxidative stress markers in liver cirrhosis contribute to systemic inflammation, and these are linked to disease progression and suppression of the immune system, which underlines the therapeutic focus on antioxidants and immunomodulatory strategies alongside traditional cirrhosis management. 39. Cholestasis in liver cirrhosis results from impaired bile flow due to bile duct obstruction or failure of bile excretion from hepatocytes, clinically presenting with jaundice, pruritus, and pale stools, and requires addressing the cirrhotic cause, with interventions like ursodeoxycholic acid or stent placement in biliary obstructions. 40. Hepatic artery buffer response, important for maintaining liver perfusion in cirrhosis, is a regulatory mechanism where hepatic artery flow increases to compensate for the reduction in portal flow, but becomes dysregulated in advanced cirrhosis, contributing to further hepatic hypoperfusion and necessitating medical management to optimize circulation. 41. Sepsis-induced acute on chronic liver failure is a condition where liver cirrhosis is exacerbated by systemic inflammation and infection, presenting with hepatic decompensation and multi-organ failure, underscoring the need for rapid identification and aggressive treatment of infections alongside supportive care measures. 42. Splenomegaly in patients with liver cirrhosis develops due to portal hypertension, leading to increased splenic venous pressure and resultant hyperplasia, often resulting in hypersplenism and cytopenias, and may require interventions like splenic embolization or partial splenectomy in severe symptomatic cases. 43. Hepatic stellate cells play a crucial role in cirrhosis pathophysiology, as they transform from quiescent vitamin A fat-storing cells into activated myofibroblasts, producing excessive extracellular matrix proteins leading to fibrosis, which highlights them as therapeutic targets for antifibrotic agents to halt or reverse liver cirrhosis progression. 44. Endoscopic band ligation is a treatment modality for esophageal varices in liver cirrhosis, performed to prevent variceal hemorrhage by placing rubber bands to induce thrombosis and fibrosis of variceal veins, effectively reducing variceal bleeding risk and often complemented by beta blocker therapy for long-term management. 45. Advanced liver cirrhosis impairs hormonal metabolism, leading to endocrine dysfunctions such as hypogonadism, insulin resistance, and feminization in men, necessitating multidisciplinary management including lifestyle modifications and hormonal therapies to mitigate reproductive and metabolic repercussions on patient health. 46. Lipopolysaccharide, LPS, endotoxin from gut-derived bacteria can exacerbate cirrhosis by enhancing systemic inflammation and hepatocyte injury, implicating the gut-liver axis as a target for therapeutic interventions such as probiotic therapy, antibiotics, and nutritional management to restore intestinal barrier function and reduce systemic endotoxemia. 47. Hepatic coagulopathy management in cirrhosis may involve recombinant factor VIIA in cases of significant bleeding, synthesizing coagulative deficiencies in the face of resistant bleeding, highlighting the complexity of balancing hemostasis with thrombosis risk, requiring individualized treatment strategies based on patient bleeding profiles. 48. Liver cirrhosis patients' dysregulated hormonal synthesis leads to mineralocorticoid excess with clinical features like edema, contributing to ascites and complicating diuretic therapy. Although reflecting reduced aldosterone metabolism, careful adjustment of diuretics and monitoring of electrolyte balance remains crucial in management. 49. Anemia in liver cirrhosis arises from multifactorial causes including hypersplenism, gastrointestinal bleeding, and anemia of chronic disease, necessitating diagnostic evaluation to direct management options such as transfusions, iron supplementation, or addressing underlying causes like gastric ulcers or variceal bleeding. Rifaximin is an orally administered, gut-specific antibiotic used in the treatment of recurrent episodes of hepatic encephalopathy and liver cirrhosis. Acting by altering gut flora to reduce ammonia production, it complements lactulose therapy and has a favorable side effect profile due to minimal systemic absorption. 1. Cardiovascular disease, often abbreviated as CVD, encompasses a range of heart and blood vessel disorders, including coronary artery disease, heart failure, and hypertension, which are primarily caused by atherosclerosis, a condition characterized by the buildup of fatty plaques on the arterial walls, leading to compromised blood flow and potential myocardial infarction or stroke. 2. The heart's electrical system controls the rhythm of your heartbeats. Any disruption in the normal conduction pathways can result in arrhythmias, which are abnormal heart rhythms that can range from benign, such as premature ventricular contractions, to life-threatening, such as ventricular fibrillation, requiring prompt medical intervention like defibrillation or antiarrhythmic drugs. 3. Hypertension, or high blood pressure, is termed the silent killer because it often presents without symptoms but leads to significant damage to the cardiovascular system over time, contributing to the hardening of arteries, increased workload on the heart, and eventually leading to complications such as stroke, heart attack, and chronic kidney disease. 4. Atherosclerosis is the progressive buildup of plaques composed of cholesterol, fatty substances, cellular waste products, calcium, and fibrin within the inner lining of the arteries, resulting in narrowed and stiffened arteries, which reduce blood flow and oxygen supply to vital organs, and is a major underlying cause of cardiovascular diseases like coronary artery disease. 5. Heart failure is a chronic condition where the heart muscle becomes weakened and cannot pump blood efficiently to meet the body's needs, often resulting from damage from coronary artery disease, long-standing high blood pressure, or cardiomyopathy, leading to symptoms such as shortness of breath, fatigue, and fluid retention. 6. Angina pectoris is a clinical syndrome characterized by episodes of chest pain or discomfort due to myocardial ischemia, which occurs when the coronary arteries are unable to supply sufficient blood flow to the heart muscle, typically triggered by physical exertion or emotional stress, and is often relieved with rest or nitroglycerin. 7. The Framingham Risk Score is a widely used tool to estimate an individual's 10-year risk of developing coronary heart disease, based on factors such as age, sex, cholesterol levels, blood pressure, smoking status, and the presence of diabetes, thereby guiding clinician decision-making regarding interventions to reduce cardiovascular risk. 8. The gold standard for diagnosing coronary artery disease is coronary angiography, an invasive imaging procedure which involves injecting a contrast dye into the coronary arteries through a catheter, typically inserted via the femoral or radial artery, allowing for direct visualization of any stenosis or blockages that may require treatment such as angioplasty or coronary artery bypass grafting. 9. Statins are a class of lipid-lowering medications that inhibit HMG-CoA reductase, an enzyme involved in cholesterol synthesis in the liver, thereby effectively reducing LDL cholesterol levels in the bloodstream, stabilizing atherosclerotic plaques, and significantly decreasing the risk of major cardiovascular events such as heart attacks and strokes. 10. Echocardiography, a non-invasive imaging technique utilizing ultrasound waves, provides detailed information about the heart's structure and function, enabling clinicians to assess parameters such as ejection fraction, wall motion abnormalities, valve abnormalities, and any presence of pericardial effusions, thus guiding diagnosis and management in cardiovascular conditions. 11. Peripheral artery disease (PAD) is a circulatory problem in which narrowed arteries reduce blood flow to the limbs, usually caused by atherosclerosis, and typical symptoms include cramping, pain, or fatigue in the leg or hip muscles during activity, known as claudication, which often improves with rest, but may require medical management and lifestyle modifications. Myocardial infarction, commonly known as a heart attack, results from the complete blockage of blood flow to a part of the heart muscle, often due to a ruptured atherosclerotic plaque and subsequent blood clot formation, leading to irreversible myocardial injury unless promptly treated, usually with reperfusion therapy such as thrombolysis or percutaneous coronary intervention. 13. The renin-angiotensin-aldosterone system, RAS, plays a critical role in regulating blood pressure and fluid balance, and its overactivity can contribute to the development of hypertension and heart failure, with medications such as ACE inhibitors and angiotensin receptor blockers effectively used to interrupt this pathway and manage these conditions. 14. Cardiac rehabilitation is a medically supervised program designed to improve the cardiovascular health of patients who have experienced a heart attack, heart failure, or undergone heart surgery, encompassing exercise training, education on heart-healthy living, and counseling to reduce stress, thereby significantly enhancing quality of life and reducing recurrence risk. 15. Sudden cardiac death is a catastrophic event caused by the abrupt loss of heart function, often due to ventricular tachyarrhythmias triggered by structural heart diseases or coronary artery disease, and can sometimes be prevented with the use of implantable cardioverter defibrillators in high-risk individuals with known heart conditions. 16. Biomarkers such as troponins are proteins released into the bloodstream during myocardial injury, and their measurement is critical in the early detection and diagnosis of acute coronary syndromes, as elevated levels of cardiac-specific troponins provide a sensitive and specific indication of myocardial infarction, guiding timely therapeutic strategies. 17. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, emphasizes the consumption of fruits, vegetables, whole grains, lean proteins, and low-fat dairy products while reducing salt, red meat, and added sugars, and has been shown to be effective in lowering blood pressure and reducing overall cardiovascular risk when incorporated into daily life. 18. Anomalous coronary arteries, a congenital defect occurring when a coronary artery originates from an improper location, can lead to compromised blood supply, especially under increased cardiac demand, and although often asymptomatic, they can result in myocardial ischemia and sudden cardiac death, requiring surgical correction in symptomatic cases. 19. The ankle brachial index, ABI, is a simple, non-invasive test used to assess the presence of peripheral artery disease, calculated by dividing the systolic blood pressure in the ankle by the systolic blood pressure in the brachial artery, with an ABI of less than 0.9 indicating significant arterial narrowing that warrants further investigation or intervention. 20. Atrial fibrillation is the most common cardiac arrhythmia and is characterized by rapid and irregular beating of the atria, often leading to poor blood flow, increased risk of thromboembolism, and stroke, necessitating management strategies including rate control, rhythm control, and anticoagulation to mitigate associated risks and complications. 21. Lipoprotein A is an independent risk factor for cardiovascular disease, with elevated levels contributing to atherosclerosis and thrombosis due to its pro-inflammatory and pro-atherogenic properties, and although not routinely tested in standard lipid panels, it is considered in patients with premature heart disease or a family history of cardiovascular events. '22. Cardiac catheterization is a diagnostic procedure where a catheter is inserted into a blood vessel and threaded to the heart under fluoroscopic guidance, used to evaluate coronary artery blockages, measure pressures within the heart chambers, and examine cardiac function, often serving as a precursor to interventions like stenting or balloon angioplasty. '23. High-sensitivity C-reactive protein, HSCRP, is an inflammatory biomarker used to assess cardiovascular risk, with elevated levels indicating systemic inflammation and an increased likelihood of atherosclerotic cardiovascular disease, prompting lifestyle changes and possibly pharmacotherapy to reduce inflammation and prevent adverse cardiovascular events. '24. The heart's preload, a concept referring to the ventricular end diastolic volume, influences cardiac output by affecting the degree of myocardial fiber stretch prior to contraction, with conditions such as hypovolemia reducing preload, whereas fluid overloads or valvular disorders may increase it, impacting overall cardiac performance and hemodynamics. '25. Coronary artery bypass grafting, CABG, is a surgical procedure employed to restore adequate blood flow to the heart by bypassing blocked coronary arteries using a graft, typically harvested from the saphenous vein or internal mammary artery, improving symptoms of angina and reducing the risk of myocardial infarction in patients with severe coronary artery disease. '26. The cardiac conduction system comprises specialized tissue that controls the heart's rhythmic beating, beginning at the sinoatrial node, the natural pacemaker, transmitting impulses through the atrioventricular node, bundle of His and Purkinje fibers, ensuring coordinated contraction of the atria and ventricles necessary for efficient blood pumping. '27. Erectile dysfunction, though primarily a sexual health issue, often serves as an early indicator of cardiovascular disease, as endothelial dysfunction affecting blood vessel health impairs vasodilatory responses, mirroring similar changes in coronary circulation, thus warranting cardiovascular evaluation in patients presenting with this condition. '28. Lipid profile testing measures the levels of various types of cholesterol and triglycerides in the blood, including HDL, LDL, and total cholesterol, providing valuable information regarding an individual's risk for atherosclerosis and cardiovascular disease, and guiding treatment plans to achieve target lipid levels through dietary, lifestyle, and pharmacologic means. '29. The heart's afterload refers to the resistance the left ventricle must overcome during systole to eject blood, heavily influenced by systemic vascular resistance and arterial pressure, with conditions such as hypertension significantly increasing afterload, contributing to left ventricular hypertrophy and ultimately impairing overall cardiac efficiency. '30. Hypertrophic cardiomyopathy is a genetic condition characterized by abnormal thickening of the heart muscle, often affecting the septum between the ventricles, leading to impaired diastolic function, potentially causing outflow obstruction, arrhythmias, or sudden cardiac death, with management focusing on symptom control and risk reduction via medication or surgery. '31. Carotid artery disease, involving the narrowing or blockage of the major arteries in the neck caused by atherosclerosis, poses a significant risk for transient ischemic attacks, TIAs, or strokes due to reduced cerebral perfusion or embolization of plaque material to the brain, necessitating management with antiplatelet therapy, lifestyle modifications, and sometimes surgical intervention like carotid endarterectomy or stenting. '32. Aortic stenosis is a condition characterized by the narrowing of the aortic valve opening, limiting blood flow from the left ventricle into the aorta, often due to age-related calcification or congenital bicuspid valve deformities, leading to symptoms such as chest pain, syncope, or heart failure, and typically managed with valve replacement surgery when severe. 3.3. Cardiac magnetic resonance imaging (MRI) is a non-invasive diagnostic tool that uses powerful magnets and radio waves to create detailed images of the heart, allowing for precise evaluation of cardiac structure, function, tissue characterization, and assessment of myocardial scarring or fibrosis, often employed in the diagnosis of cardiomyopathies, congenital abnormalities, or post-infarct recovery assessment. 34. Kawasaki disease, primarily affecting children under 5 years old, is an acute, self-limited vasculitis that can lead to coronary artery aneurysms if untreated, presenting with symptoms such as prolonged fever, rash, conjunctivitis, and swollen lymph nodes, and is typically managed with early intravenous immunoglobulin and aspirin therapy to prevent cardiac complications. 35. Venous thromboembolism (VTE) refers to the formation of blood clots in the venous system, manifesting as deep vein thrombosis (DVT) or pulmonary embolism (PE), posing significant cardiovascular risk due to potential embolization to the lungs, and typically managed through anticoagulation therapy such as heparin or warfarin to prevent complications or recurrence. 36. Rheumatic heart disease, a consequence of rheumatic fever following untreated group A streptococcal infections, leads to chronic damage of cardiac valves, particularly the mitral and aortic valves, causing stenosis or regurgitation, resulting in heart failure over time, and is preventable through prompt antibiotic treatment of streptococcal infections and prophylaxis in those with a history of rheumatic fever. 37. Cocaine use exerts significant cardiovascular consequences due to potent stimulation of the sympathetic nervous system, resulting in increased heart rate, blood pressure, and risk of myocardial ischemia or infarction, arrhythmias, and sudden cardiac death even in young users, emphasizing the need for recognition and management of substance use in patients with cardiovascular presentations. 38. Pericarditis is the inflammation of the pericardium, the double-layered sac surrounding the heart, and can present with sharp chest pain, pericardial friction rub, and ECG changes such as diffuse street segment elevation, managed with anti-inflammatory treatments and monitoring for complications like pericardial effusion or constrictive pericarditis, which may require surgical intervention. 39. Beta blockers, a class of medications that reduce heart rate and myocardial oxygen demand, are commonly used in the management of various cardiovascular conditions including hypertension, ischemic heart disease, and heart failure, and have a secondary role in reducing the risk of sudden cardiac death in patients with heart failure or post-myocardial infarction. 40. Mitral valve prolapse (MVP) is a disorder involving the improper closure of the valve between the left atrium and left ventricle due to redundant or elongated valve leaflets, often causing regurgitation of blood into the atrium, with a majority of cases being asymptomatic but some presenting with palpitations or atypical chest pain, managed through regular monitoring and symptomatic treatment. 41. Diabetic cardiomyopathy is a distinct form of heart disease in diabetes patients, not directly related to other cardiovascular conditions, characterized by myocardial dysfunction due to chronic hyperglycemia, leading to fibrosis, left ventricular hypertrophy, and ultimately heart failure, emphasizing the importance of strict glycemic control and heart failure risk factor management in diabetic populations. 42. Electrophysiological studies, EPS, are invasive procedures used to diagnose and evaluate arrhythmias by recording electrical activity and mapping conduction pathways in the heart, guiding treatment decisions for complex cases of recurrent arrhythmias, often leading to therapeutic interventions like catheter ablation to correct abnormal rhythm sources. 43. Endothelial dysfunction is an early marker of vascular disease wherein the inner lining of blood vessels fails to regulate vascular tone, coagulation, and inflammation effectively, often triggered by risk factors like smoking, insulin resistance, hypertension, and hyperlipidemia, and plays a critical role in the pathogenesis of atherosclerosis and related cardiovascular events. _44. Valvular heart disease comprises abnormalities of one or more heart valves leading to stenosis, where the valve doesn't open fully, or regurgitation, where it doesn't close completely, often progressing due to degenerative changes, rheumatic heart disease, or infective endocarditis, potentially necessitating medical management or surgical repair, replacement to restore normal hemodynamics. _45. Metabolic syndrome is a cluster of conditions including abdominal obesity, dyslipidemia, hypertension, and insulin resistance, significantly increasing the risk for cardiovascular diseases and type 2 diabetes, necessitating comprehensive lifestyle interventions and possibly pharmacotherapy to reduce these risk factors and prevent associated cardiovascular outcomes. _46. The heart's systolic function is the ability of the ventricles to contract and generate enough pressure to eject blood into the circulation, commonly assessed by left ventricular ejection fraction, LVEF, during imaging studies, with reduced systolic function often indicating heart failure with reduced ejection fraction, HFrEF, and requiring targeted therapeutic strategies to improve cardiac performance. _47. Unstable angina, a form of acute coronary syndrome, is characterized by new or worsening chest pain that occurs at rest or with minimal exertion, indicative of acute myocardial ischemia due to transient reduction in coronary blood flow, requiring urgent medical attention and treatment with anticoagulants, antiplatelets, and possibly coronary revascularization to stabilize the condition. _48. The coronary calcium score, obtained via non-invasive CT scanning, quantifies the extent of calcified plaque in coronary arteries and serves as a predictive marker for future cardiovascular events, aiding in risk stratification and the decision to implement preventive strategies for patients with intermediate risk of atherosclerotic cardiovascular disease. _49. The vagus nerve plays a pivotal role in modulating heart rate through the parasympathetic nervous system, promoting a decrease in heart rate and blood pressure, thus providing a counterbalance to the sympathetic system, with vagal maneuvers or vagus nerve stimulators being utilized in clinical settings to manage certain tachyarrhythmias by enhancing parasympathetic tone. _50. Cardiogenic shock is a critical condition marked by inadequate cardiac output to meet metabolic demands, typically resulting from extensive myocardial infarction or decompensated heart failure, leading to severe hypotension, organ hypoperfusion, and metabolic acidosis, necessitating prompt recognition and aggressive medical interventions such as inotropes, mechanical circulatory support, or revascularization to restore hemodynamic stability. _1. Bronchial asthma is a chronic inflammatory disease of the airways characterized by reversible airway obstruction due to bronchial hyperreactivity, leading to episodes of wheezing, breathlessness, chest tightness, and coughing, which vary in frequency and severity. _2. The pathophysiology of bronchial asthma involves a complex interaction between genetic predisposition and environmental factors that result in airway inflammation, leading to bronchoconstriction, increased mucus production, and airway remodeling over time. _3. Environmental triggers for bronchial asthma include allergens such as pollen, dust mites, and pet dander, as well as irritants like tobacco smoke, air pollution, and strong odors, which can exacerbate symptoms and lead to acute asthma attacks. _4. Asthma symptoms can be worse at night or early in the morning, which is a phenomenon known as nocturnal asthma, and is thought to be related to circadian variations in bronchial tone and lung function. 5. Spirometry is a crucial diagnostic tool for asthma, assessing lung function by measuring the volume and speed of air that can be inhaled and exhaled, helping to confirm the reversibility of airway obstruction. 6. In asthma management, peak flow meters are used for monitoring disease progression and controlling symptoms by measuring the highest speed of expiration across various asthma conditions and treatments. 7. The role of eosinophils in asthma pathophysiology is significant as these white blood cells contribute to inflammation, airway hyperreactivity, and tissue damage when activated during the allergic response. 8. Inhaled corticosteroids are considered the first-line treatment for persistent asthma, as they effectively reduce airway inflammation, decrease mucus production, and improve overall lung function when used regularly. 9. Acute asthma exacerbations are often managed with short-acting beta agonists, like albuterol, which act quickly to relax the muscles around the airways, providing prompt relief from acute wheezing and breathlessness. 10. Long-acting beta agonists, LABAs, can be used in combination with inhaled corticosteroids for better control of moderate to severe persistent asthma, providing prolonged bronchodilation lasting up to 12 hours. 11. Asthma action plans are personalized written guidelines developed for patients that include directions on medication usage, identification of symptom exacerbations, and emergency contact information for effective self-management. 12. The hygiene hypothesis suggests that a lack of early childhood exposure to infectious agents, symbiotic microorganisms, and parasites may increase susceptibility to allergic diseases, including asthma, due to an underdeveloped immune system. 13. Leukotriene receptor antagonists, such as montelukast, offer an alternative or adjunctive treatment option for asthma by blocking the effects of leukotrienes, which are inflammatory chemicals that contribute to bronchoconstriction and airway inflammation. 14. The autonomic nervous system plays a critical role in respiratory function, with sympathetic nerves promoting bronchodilation and parasympathetic nerves contributing to bronchoconstriction, affecting airway tone and reactivity in asthma. 15. The role of genetic factors in asthma development is significant, with variations in genes like ADAM33, ORMDL3, and IL-13 being associated with susceptibility to asthma and influencing the severity and course of the disease. 16. Exercise-induced bronchoconstriction, a condition associated with asthma, causes temporary narrowing of the airways during or after physical activity, resulting in shortness of breath, wheezing, and chest tightness, often mitigated by pre-exercise inhalation of a short-acting beta agonist. 17. Omalizumab, a monoclonal anti-IgE antibody, is used in the management of severe allergic asthma by binding to IgE and preventing it from attaching to mast cells and basophils, reducing allergic inflammation and asthma symptoms. 18. Asthma control tests, ACT, are self-administered questionnaires used to assess the control of asthma symptoms over the past 4 weeks, helping healthcare providers make informed decisions regarding treatment adjustments. 19. Airway remodeling in asthma refers to structural changes in the bronchial walls, including subepithelial fibrosis, smooth muscle hypertrophy, and angiogenesis, which contribute to fixed airway obstruction and progressive decline in lung function. 20. An increased understanding of the role of Th2 cells and associated cytokines like IL-4, IL-5, and IL-13 has been instrumental in the development of targeted biologic therapies for asthma, which aim to reduce inflammation and improve clinical outcomes. 21. The asthma-COPD overlap syndrome, ACOS, denotes the coexistence of features from both asthma and chronic obstructive pulmonary disease, COPD, requiring unique strategies for diagnosis and management to address the complex pathophysiology present in affected individuals. 22. Bronchial thermoplasty is a novel, non-pharmacological intervention for severe asthma, involving controlled thermal energy application to the airway walls to reduce excess smooth muscle mass, thereby decreasing bronchoconstriction and improving asthma control. 23. The fractional exhaled nitric oxide (FeNO) test is an emerging non-invasive method for assessing airway inflammation through the measurement of nitric oxide levels in exhaled breath, providing valuable information for asthma diagnosis and management. 24. Aspergillus contributes to the exacerbation of asthma symptoms in cases of allergic bronchopulmonary aspergillosis, ABPA, an exaggerated immune response to the fungus, leading to airway inflammation, mucus plugging, and potential lung damage. 25. Hormonal changes during menstruation, pregnancy, and menopause can affect asthma severity and control, with potential fluctuations in symptoms related to changes in estrogen and progesterone levels affecting airway reactivity. 26. Vocal cord dysfunction frequently mimics asthma, characterized by paradoxical vocal cord motion causing stridor and dyspnea, with distinct treatment approaches focusing on speech therapy and breathing exercises to address the issue. 27. Occupational asthma results from exposure to specific allergens or irritants in the workplace, necessitating a thorough history and identification of potential triggers for appropriate management and prevention strategies, including workplace modifications. 28. In asthma, the Dutch hypothesis proposes a heterogeneity of the disease involving different phenotypes with varying underlying causes, leading to personalized approaches in diagnosis, treatment, and management of each specific asthma phenotype. 29. Global Initiative for Asthma (GINA) guidelines provide evidence-based recommendations for asthma management, emphasizing a stepwise approach, regular assessment, and the importance of non-pharmacological interventions alongside medication use. 30. The psychological impact of asthma can be considerable, with anxiety and depression being common comorbidities, affecting treatment adherence and quality of life, highlighting the importance of addressing mental health in comprehensive asthma care. 31. The identification of specific asthma phenotypes, such as allergic, non-allergic, eosinophilic, and neutrophilic asthma, guides personalized treatment and management decisions, tailoring therapies according to underlying mechanisms and patient characteristics. 32. The role of the microbiome in asthma is a growing area of research, with studies suggesting that alterations in gut and airway bacterial composition may influence immune responses and play a role in the development and exacerbation of asthma. 3. Cold air is a common trigger for asthma symptoms, leading to bronchoconstriction by increasing airway hyperreactivity in susceptible individuals, with pre-exposure inhalation of beta agonists often recommended for prevention. 34. Aspirin-exacerbated respiratory disease, AERD, is characterized by asthma, nasal polyps, and aspirin intolerance, with typical management involving avoidance of nonsteroidal anti-inflammatory drugs, NSAIDs, and potential aspirin desensitization under medical supervision. 35. Smoking cessation is a critical component of asthma management, as tobacco smoke exposure can exacerbate symptoms, reduce treatment effectiveness, and increase the risk of respiratory infections and further lung damage. 36. Vitamin D deficiency has been associated with poor asthma control, increased airway inflammation, and heightened risk of exacerbations, suggesting that vitamin D supplementation may be beneficial in certain patients with asthma. 37. Advanced imaging techniques, such as high-resolution computed tomography, HRCT, offer detailed visualization of airway structures, aiding in the assessment of airway remodeling, mucus plugging, and differential diagnosis in complicated asthma cases. 38. The airway hyperresponsiveness in asthma to nonspecific stimuli, such as methacholine or histamine, is often evaluated through provocation tests, helping to confirm diagnosis and assess the severity of the disease. 39. Asthma-related education interventions focus on patient empowerment, providing essential knowledge about disease management, medication adherence, recognition of exacerbation signs, and trigger avoidance strategies to improve clinical outcomes. 40. The assessment of exacerbation risk in asthma includes evaluating factors such as previous hospitalizations, frequent emergency visits, high SAVA use, and poor symptom control, guiding decisions on treatment intensification and preventive strategies. 41. Nutrition and dietary factors, including a high intake of antioxidants, omega-3 fatty acids, and a diet rich in fruits and vegetables, have been associated with reduced inflammation and improved asthma control. 42. The burden of asthma in the elderly population involves unique challenges, given the presence of comorbid conditions, age-related physiological changes, and potential polypharmacy that can complicate diagnosis and management. 43. Innovative drug delivery systems, such as breath-actuated nebulizers and dry powder inhalers, aim to improve medication adherence and effectiveness, addressing issues related to incorrect inhalation technique commonly seen in asthma patients. 44. Epithelial barrier dysfunction plays a key role in asthma pathogenesis by allowing allergen penetration that triggers immune responses and inflammation. Ongoing research is exploring therapeutic strategies aimed at restoring epithelial integrity. 45. The use of biomarkers, such as periostin and blood eosinophil count, is becoming increasingly important in identifying specific asthma endotypes, leading to more targeted approaches in the treatment and management of complex cases. 46. Non-pharmacological interventions, including allergen avoidance, environmental control measures, and respiratory muscle training, form an essential part of a comprehensive asthma management plan, supporting optimal clinical outcomes. 47. Psychosocial support, including counseling and peer support groups, can significantly impact asthma management by addressing emotional and social factors that influence patient adherence and overall disease control. 48. Traditional allergy testing through skin prick tests and specific IgE antibody testing assists in identifying relevant allergens, guiding targeted allergen avoidance strategies, and planning immunotherapy for asthma associated with allergic sensitization. 49. Environmental health interventions that reduce exposure to indoor pollutants, such as improved ventilation, use of air purifiers, and removal of carpeting, play a crucial role in reducing asthma symptoms and preventing exacerbations. 50. The development of digital health technologies, like mobile applications and wearable sensors, provides new avenues for real-time monitoring, patient engagement, and personalized management of asthma, improving overall disease control and patient outcomes. 1. Esophageal cancer primarily arises from the squamous cells lining the esophagus or from glandular cells in Barrett's esophagus, with adenocarcinoma more prevalent in Western countries, resulting from a chronic cycle of gastroesophageal reflux disease inducing metaplastic changes. Two. Diagnosing esophageal cancer often involves endoscopic ultrasonography combined with biopsy, aiming to accurately determine the tumor's depth and the involvement of surrounding lymph nodes, critical for effective staging and treatment planning. 3. The correlation between tobacco use and esophageal squamous cell carcinoma has been strongly established, with carcinogens within tobacco triggering genetic mutations that disrupt normal cellular machinery, promoting malignant transformation and proliferation. Four. Treatment modalities for esophageal cancer include neoadjuvant chemoradiotherapy, which seeks to downsize tumors before surgical resection, improving resection success rates and potentially enhancing overall survival. 5. Advances in molecular biology have illuminated the role of receptor tyrosine kinases such as HER2 in esophageal adenocarcinoma, paving the way for targeted therapies aimed at these aberrant signaling pathways to curb cancer progression. 6. Esophageal cancer symptoms often present late in the disease course, with progressive dysphagia being the most prominent sign, initially for solids and then liquids, as the esophageal lumen narrows due to tumor growth. 7. The prognosis for esophageal cancer remains grave, with a 5-year survival rate generally under 20%, heavily influenced by early-stage detection and the availability of comprehensive multimodal treatment strategies. 8. A significant advancement in the prevention of esophageal adenocarcinoma is the successful management of Barrett's esophagus with proton pump inhibitors or endoscopic ablative therapies, reducing dysplasia progression to invasive carcinoma. 9. Histopathological examination of resected esophageal cancer tissue often reveals key characteristics such as poorly differentiated cells in squamous cell carcinoma or glandular formation in adenocarcinoma that assist in confirming the cancer subtype. 10. Radiation therapy in esophageal cancer can be delivered via external beam methods or brachytherapy, targeting cancer cells while sparing the surrounding healthy tissue, thus managing symptoms such as pain and dysphagia effectively. 11. In the burgeoning field of immunotherapy for esophageal cancer, the use of checkpoint inhibitors targeting PD-1 and PD-L1 pathways has shown promise, leading to immune system engagement against tumor cells and eliciting durable responses. 12. Intriguingly, preventive measures against esophageal adenocarcinoma include rigorous lifestyle modification, like adopting a Mediterranean diet rich in fruits, vegetables, and omega-3 fatty acids, which may yield a protective anti-inflammatory benefit. 13. The phenomenon of field cancerization, where the entire esophageal mucosa exhibits precancerous changes, underscores the need for regular surveillance endoscopies in high-risk populations to catch potential malignancies at an actionable stage. 14. Endoscopic therapies, such as mucosal resection or submucosal dissection, have revolutionized the management of superficial esophageal cancer, offering a less invasive approach with lower complication rates compared to traditional esophagectomy. 15. Genomic studies have identified recurring mutations and amplifications in genes like TP53 and cyclin D1 in esophageal cancer, driving oncogenic pathways and presenting novel targets for future therapeutic interventions. 16. While squamous cell carcinoma of the esophagus has long been linked with nitrosamine-rich diets, ongoing epidemiological studies suggest that reducing such dietary components could contribute to a lower incidence of this cancer subtype. For patients unable to tolerate surgery, definitive chemoradiotherapy remains a mainstay treatment for esophageal cancer, providing a non-operative cure potential while addressing both the local and systemic nature of the disease. The role of minimally invasive esophagectomy in treating esophageal cancer is being increasingly recognized, offering comparable long-term outcomes to open procedures, with the potential for reduced post-operative morbidity and quicker recovery. Emerging liquid biopsy techniques, such as the detection of circulating tumor DNA, hold promise for the non-invasive monitoring of esophageal cancer progression in response to treatment, allowing for more personalized therapy adjustments. An exploration of microRNA profiles in esophageal cancer has revealed their significant involvement in tumorigenesis and metastasis, suggesting that these small non-coding RNAs could serve as biomarkers for earlier detection and novel therapeutic targets. 21. Despite chemotherapy being a cornerstone in treating locally advanced and metastatic esophageal cancer, resistance often develops through various mechanisms, including drug efflux pump expression and DNA repair pathway enhancement. As alcohol consumption is a known risk factor for esophageal squamous cell carcinoma, public health initiatives focusing on reducing alcohol intake are essential components of comprehensive cancer prevention strategies. In esophageal cancer, the intricate relationship between chronic inflammation and cancer development is highlighted by the molecular interplay between inflammatory cytokines and the nitrogen monofluoride Kb pathway, orchestrating a supportive microenvironment for tumor growth. The development of organoids derived from esophageal cancer tissues presents a promising tool for personalized medicine, enabling drug testing and response prediction tailored to the patient's unique tumor biology. Pioneering research into the esophageal cancer microbiome indicates that an altered bacterial composition might contribute to carcinogenesis, opening avenues for novel diagnostic markers and treatment adjuncts targeting microbial imbalances. Nutritional challenges in esophageal cancer patients necessitate multidisciplinary care, with dietitians playing a critical role in ensuring adequate nutritional intake and managing cachexia, crucial for maintaining strength during aggressive treatment regimens. The feasibility and efficacy of natural compounds, such as curcumin, are being evaluated in the context of esophageal cancer, postulating that their anti-inflammatory and apoptotic properties might harbor therapeutic significance when used alongside conventional treatments. Integration of artificial intelligence in the analysis of endoscopic images is revolutionizing esophageal cancer diagnosis, enhancing the accuracy and speed of detecting lesions that might be missed by the human eye alone. Factors such as obesity and metabolic syndrome contribute to the risk of esophageal adenocarcinoma through chronic inflammation and insulin resistance, signifying an intersection of metabolic health and cancer prevention strategies. Studies on the epidemiology of esophageal cancer highlight a higher prevalence among males compared to females, with research exploring the mechanisms linked to hormones and environmental exposure differences responsible for this disparity. 31. Multidisciplinary tumor boards for esophageal cancer encourage collaboration among specialists, ensuring that each patient receives a comprehensive treatment plan optimized for both local control and systemic disease. 32. Vocal cord paralysis is a lesser-known complication of advanced esophageal cancer, arising from invasion or compression of the recurrent laryngeal nerve, which may necessitate speech therapy or surgical intervention to restore voice function. 3.3. An examination of disparities in esophageal cancer care reveals that socioeconomic factors significantly influence both access to early detection and advanced treatment options, necessitating policy reforms aimed at equitable healthcare delivery. 34. Recent trials focusing on the de-escalation of post-esophagectomy adjuvant therapy explore whether reduced treatment intensity can still deliver survival benefits, minimizing the burden of treatment-related toxicity. 35. Notably, the TREFTS classification describes distinct anatomical and pathological characteristics of esophageal cancer, enabling a nuanced approach to understanding the disease's diverse presentations and informing surgical technique refinement. 36. Cirrhosis and chronic liver disease, through mechanisms involving portal hypertension and esophageal varices, can complicate the management of esophageal cancer, leading to increased treatment complexity and necessitating coordinated care. 37. The utilization of PET-CT imaging in staging esophageal cancer allows for sensitive detection of distant metastasis, providing critical information that impacts the treatment strategy and overall prognostic considerations. 38. Comparative studies analyzing the outcomes of robotic-assisted versus traditional open esophagectomy reveal potential advantages in reducing surgical trauma and postoperative complications, while ensuring oncological efficacy. 39. Emerging research into pro-inflammatory cytokines, such as IL-6, reveals their influential role in creating a tumor-permissive environment in esophageal cancer, highlighting potential therapeutic targets in inflammatory modulation. 40. An understanding of lymphatic spread patterns in esophageal cancer assists in precise staging and tailoring surgical and radiation fields, thereby potentially improving disease control and patient outcomes. 41. Cutting-edge advancements in photodynamic therapy for esophageal cancer harness the power of light-activated drugs, providing a focused approach to tumor ablation, particularly for palliative care where conventional options prove challenging. 42. Calcium channel blockers, typically used for cardiovascular conditions, are under investigation for their potential to modulate cancer cell growth and apoptosis in esophageal cancer, suggesting a possible repurposing as adjunctive therapy. 43. The adoption of patient-reported outcome measures in clinical trials for esophageal cancer underscores the importance of capturing the patient perspective in assessing treatment impact, thus enhancing care models focused on quality of life. 44. In-depth studies on esophageal cancer cell lines have revealed insights into their genetic heterogeneity, emphasizing the necessity for personalized therapeutic approaches that account for tumor-specific mutational landscapes. 45. The complex interplay between host immunity and tumor evasion in esophageal cancer emphasizes the critical role of the immune microenvironment, propelling research into immune-modulating therapies that can recalibrate this balance. 46. Colloidal gold nanoparticles are being explored for enhanced imaging and targeted drug delivery in esophageal cancer, capitalizing on their size, biodistribution, and ability to conjugate with molecular agents. 47. The impact of postoperative complications on long-term survival in esophageal cancer patients indicates that reducing surgical morbidity is integral to improving overall outcomes, necessitating refined techniques and perioperative care. A notable preventive measure for esophageal cancer includes the avoidance of scalding hot beverages known to damage the esophageal lining, potentially contributing to corrosive esophagitis and facilitating carcinogenic processes. 49. The integration of palliative care early in the treatment of esophageal cancer addresses complex symptom management, psychological support, and advanced care planning, ensuring comprehensive care beyond tumor-focused treatments. 50. Surveillance strategies for individuals with familial Barrett's esophagus syndromes highlight the importance of genetic counseling and regular monitoring processes in intercepting esophageal cancer at its nascent stage, offering improved prognostic prospects. 1. Fatty liver disease, also known as hepatic steatosis, is characterized by the accumulation of excess fat in the liver cells, and it can progress without showing any specific symptoms, making the early diagnosis reliant on blood tests that detect elevated liver enzymes, typically aspartate aminotransferase, AST, and alanine aminotransferase, ALT. 2. Non-alcoholic fatty liver disease, NAFLD, is the most common cause of chronic liver disease worldwide, affecting approximately 25% of the global population, and is strongly associated with obesity, insulin resistance, and metabolic syndrome, encompassing a complex interplay between genetic and environmental factors. The gold standard for diagnosing non-alcoholic steatohepatitis, NASH, a more severe form of fatty liver disease, is a liver biopsy, which allows for the assessment of liver cell ballooning, inflammation, and fibrosis, although non-invasive imaging modalities like transient elastography are increasingly used to evaluate the severity of fibrosis non-surgically. 4. Lifestyle modification remains the cornerstone of managing fatty liver disease, with sustained weight loss of 5 to 10% of total body weight shown to significantly reduce liver fat and improve serum liver enzymes, while a Mediterranean diet rich in fruits, vegetables, whole grains, and healthy fats has favorable outcomes for liver health. 5. The pathophysiology of NAFLD involves an imbalance between lipid acquisition and lipid removal pathways within the liver, where excessive caloric intake, increased free fatty acid delivery from adipose tissue, and de novo lipogenesis contribute to steatosis, with subsequent oxidative stress and inflammation perpetuating liver injury. 6. Insulin resistance is a key feature in the development of fatty liver disease, as it leads to increased lipolysis in adipose tissue, excessive free fatty acid influx into the liver, and perturbation of lipid metabolism, exacerbating hepatic steatosis and contributing to the progression of liver inflammation and fibrosis in NASH. 7. Statins, cholesterol-lowering medications, have been shown to be safe and potentially beneficial in patients with NAFLD, as they not only help manage dyslipidemia but may also have hepatoprotective effects, reducing liver fibrosis risk and improving overall cardiovascular health, which is critical given the heightened cardiovascular risk in this population. 8. Advanced imaging techniques such as magnetic resonance imaging, MRI, and controlled attenuation parameter, CAP technology provide non-invasive means to quantitatively assess liver fat content and degree of fibrosis, thereby aiding in the differentiation of simple steatosis from NASH and allowing for better risk stratification and management. 9. The gut-liver axis plays a significant role in the pathogenesis of NAFLD, where dysbiosis or an imbalance in gut microbiota can lead to increased intestinal permeability, facilitating the translocation of bacterial endotoxins that trigger hepatic inflammation and promote fatty liver progression through toll-like receptor activation. 10. Vitamin E supplementation at a dose of 800 IU per day has been shown to improve liver histology in non-diabetic adults with biopsy-proven NASH, aiding in reducing inflammation and hepatocyte ballooning, highlighting the therapeutic potential of antioxidants in the management of this condition while also considering potential safety concerns with long-term use. 11. Emerging evidence suggests that coffee consumption, specifically due to the presence of polyphenols and caffeine, is inversely associated with the risk of progression to advanced liver fibrosis or cirrhosis in people with NAFLD, as it exerts anti-inflammatory and antifibrotic effects, although moderation in consumption and concurrent lifestyle modifications remain crucial. 12. Pharmacological options for NAFLD and NASH are limited, but pioglitazone, a thiazolidinedione, has been found to improve liver histology by enhancing insulin sensitivity, reducing liver fat content, and ameliorating inflammatory parameters, although the potential for weight gain and fluid retention necessitates vigilant monitoring in patients receiving this therapy. 13. The presence of metabolic comorbidities such as type 2 diabetes mellitus and dyslipidemia not only complicates the management of NAFLD but also exacerbates liver disease progression, highlighting the necessity for an integrated treatment approach that addresses metabolic risk factors alongside lifestyle and dietary interventions to optimize liver health outcomes. 14. Oxidative stress is a crucial mechanism in the pathogenesis of NAFLD and NASH, arising from excessive reactive oxygen species production that results in lipid peroxidation, mitochondrial dysfunction, and hepatocellular injury, thereby advancing the inflammatory processes and fibrotic changes in the liver that characterize progressive liver disease. 15. The use of omega-3 polyunsaturated fatty acids, PUFAs, from sources like fish oil has been studied in NAFLD, with evidence indicating that they can reduce liver fat content and improve serum lipid profiles, offering a dietary supplement option for patients seeking additional therapeutic measures to complement lifestyle modifications and dietary adjustments. 16. Bile acids, traditionally known for their role in lipid digestion, are increasingly recognized as metabolic regulators in NAFLD pathophysiology, influencing pathways like cholesterol homeostasis and glucose metabolism while acting as signaling molecules that modulate hepatic inflammation and fibrosis, thus presenting novel therapeutic targets through farnesoid X receptor, FXR, and other nuclear receptors. 17. Genetic predispositions such as polymorphisms in the PNPLA3, TM6SF2, and MBOAT7 genes significantly influence the susceptibility to and severity of NAFLD by affecting hepatic lipid metabolism, triglyceride secretion, and inflammatory responses, underscoring the importance of genetic counseling and personalized medical approaches in managing this disease. 18. Fibrosis stage is the most crucial predictor of adverse clinical outcomes in NAFLD, including liver-related and overall mortality, underscoring the importance of early identification and stratification of fibrosis risk using non-invasive scores and imaging modalities that allow for prompt intervention and monitoring of disease progression. 19. Bariatric surgery, particularly procedures like gastric bypass and sleeve gastrectomy, has shown substantial benefits in resolving or improving steatosis, NASH, and fibrosis among individuals with morbid obesity and NAFLD, with weight loss and metabolic improvements being major contributors to these positive outcomes in liver health. 20. Recent studies have highlighted the role of lipotoxicity in NAFLD pathogenesis, where the accumulation of toxic lipid species such as free fatty acids and ceramides within hepatocytes triggers endoplasmic reticulum stress, apoptosis, and inflammation, providing insight into potential therapeutic avenues aimed at modulating lipid pathways to combat liver disease progression. 21. Exosomes, nanoscale extracellular vesicles, have emerged as potential biomarkers for NAFLD and NASH due to their role in intercellular communication and the transport of lipids and proteins that contribute to inflammation and fibrosis, with ongoing research exploring their utility in non-invasive diagnosis and monitoring of treatment efficacy. Hepatic stellate cells, which reside in the space of DISI, play a pivotal role in the fibrogenic response to liver injury by undergoing activation and transforming into myofibroblast-like cells that produce excessive extracellular matrix components, leading to liver fibrosis, a key target for antifibrotich therapies in NAFLD. 23. Hepatokines, liver-derived hormones such as phetuin A, have been implicated in the crosstalk between liver and other organs like adipose tissue and muscle, influencing insulin resistance and metabolic homeostasis, with alterations in their secretion patterns contributing to the pathophysiology of NAFLD and highlighting potential therapeutic targets for intervention. 24. The role of fructose consumption, often in the form of high fructose corn syrup found in sweetened beverages, is particularly concerning in the context of NAFLD, as it stimulates de novo lipogenesis, contributes to insulin resistance, and exacerbates hepatic steatosis, underscoring the need for dietary recommendations that limit fructose intake to support liver health. 25. Autophagy, a cellular degradation process, is impaired in NAFLD, leading to defective hepatic lipid clearance and mitochondrial dysfunction, thus exacerbating liver damage. Therapeutic strategies that aim to restore or enhance autophagic flux could potentially ameliorate steatosis and liver injury in this condition. 26. Endoscopic ultrasound and liver biopsy remain essential tools for ruling out other causes of liver disease and assessing NAFLD severity, although non-invasive modalities like the FibroScan and MR Elastography are increasingly preferred for regular monitoring due to their ability to evaluate liver stiffness effectively and comfortably. 27. Angiotensin II, a peptide hormone, has been implicated in hepatic steatosis and fibrosis through its pro-inflammatory and pro-fibrotich actions within the liver, where angiotensin receptor blockers, ARBs, often used in managing hypertension, might offer ancillary benefits in attenuating liver fibrosis in patients with NAFLD. 28. The prevalence of lean NAFLD, where individuals with normal body mass index present with fatty liver disease, poses unique diagnostic and therapeutic challenges, as it suggests the influence of genetic and metabolic anomalies beyond obesity, necessitating tailored interventions that address these underlying pathophysiological mechanisms. The evolution of NASH involves a two-hit hypothesis where the initial accumulation of hepatic fat sensitizes the liver to subsequent insults, such as oxidative stress and inflammatory cytokines, that promote hepatocellular damage and fibrosis, although recent insights suggest more complex multi-hit pathways involving genetic and environmental factors. Impaired hepatic lipid export due to dysfunctions in very low-density lipoprotein, VLDL, secretion contributes to steatosis in NAFLD, highlighting the need for understanding molecular mechanisms governing lipid transport and exploring interventions that ameliorate hepatic lipid export pathways to counteract fatty liver progression. The link between hypothyroidism and NAFLD is supported by the role of thyroid hormones in regulating basal metabolic rate and lipid homeostasis, where hypothyroidism leads to hyperlipidemia and hepatic lipid accumulation, suggesting that optimizing thyroid function could offer therapeutic benefits for patients with concurrent NAFLD. 32. Monitoring liver fibrosis progression in NAFLD patients can be enhanced with serum biomarkers such as cytokeratin 18 fragments and advanced glycation end products, which reflect ongoing hepatocellular apoptosis and fibrotic activity, respectively, providing additional tools for clinicians in the management and prognosis of liver disease. 3. Sleep apnea has been identified as an independent risk factor for NAFLD, likely due to the recurrent hypoxemia associated with obstructive sleep apnea, which induces oxidative stress and inflammation in the liver, suggesting that managing sleep disorders is an important aspect of comprehensive care for patients with fatty liver disease. 34. Choline, an essential nutrient involved in lipid metabolism, plays a key role in the prevention of fatty liver by facilitating the export of triglycerides from the liver and reducing steatosis, with choline deficiency linked to increased liver fat accumulation, indicating potential benefits from dietary choline supplementation in NAFLD management. 35. The use of biguanides like metformin, commonly prescribed for type 2 diabetes, has been investigated in NAFLD management due to its insulin-sensitizing properties. Although its impact on liver histology is limited, it remains valuable in managing metabolic parameters associated with NAFLD and potentially altering disease trajectory. 36. Liver fibrosis progression in NAFLD can be influenced by sex hormones, with postmenopausal women experiencing a higher risk due to changes in estrogen levels that impact inflammatory and fibrotic pathways, emphasizing the importance of considering hormonal factors in the assessment and management of liver disease in women. 37. Methionine and choline deficient (MCD) diets used in experimental models to induce steatohepatitis highlight the essential roles of these nutrients in liver health, where deficiencies lead to hepatic lipid imbalance and inflammation, reinforcing the significance of nutritional adequacy in the prevention and treatment of NAFLD. 38. Higher levels of reactive aldehydes produced during lipid peroxidation, such as melandialdehyde, are biomarkers for oxidative stress and liver damage in NAFLD, indicating the potential utility of monitoring these reactive aldehydes for assessing liver injury severity and response to antioxidant therapies. 39. Hepatic encephalopathy, though more commonly associated with cirrhosis, can also be a complication in advanced NAFLD, where the liver's decreased ability to detoxify ammonia and other neurotoxins leads to neuropsychiatric disturbances, necessitating careful management to prevent progression to severe neurological impairment. 40. The impact of gut-derived serotonin on liver metabolism is increasingly recognized in NAFLD pathophysiology, where serotonin excess is linked to enhanced lipid synthesis and hepatic steatosis, suggesting that regulating serotonin levels could become a future therapeutic approach in managing NAFLD and its progression. 41. Crosstalk between adipose tissue and the liver through adipokines like adiponectin and leptin significantly influences the pathogenesis of NAFLD, where decreased adiponectin levels are associated with increased hepatic inflammation and insulin resistance, pointing to the potential of therapeutic strategies that modulate adipokine pathways. 42. Hepatic insulin signaling alterations due to inflammatory cytokines like TNF-alpha play a crucial role in the onset of insulin resistance and lipid metabolism dysregulation in NAFLD, offering targets for anti-inflammatory treatments aimed at reversing metabolic derangements and ameliorating liver disease progression. 43. Based on epidemiological data, Hispanic individuals exhibit a higher prevalence and greater severity of NAFLD compared to other ethnic groups, likely driven by genetic factors such as higher frequencies of the PNPLA3 polymorphism, underscoring the need for ethnicity-specific research and treatment strategies. 44. Hepatocellular carcinoma, HCC, can develop in the context of NAFLD-related cirrhosis, indicating the importance of regular surveillance among high-risk individuals. as NAFLD is increasingly recognized as a risk factor for HCC development, even in the absence of cirrhosis, necessitating vigilant monitoring and early detection strategies. (45) A compromised unfolded protein response, UPR, due to excessive endoplasmic reticulum stress in hepatocytes is seen in NAFLD, resulting in impaired protein folding and aggravated cellular stress, presenting opportunities for pharmacological interventions aimed at restoring ER function and ameliorating hepatic insults. (46) Left untreated, NAFLD can progress to cirrhosis, characterized by irreversible scarring of the liver, which may lead to liver failure or necessitate transplantation, emphasizing the importance of early detection, lifestyle intervention, and targeted therapies to prevent severe outcomes and preserve liver function. (47) The endocannabinoid system, with its lipid signaling molecules, plays a role in energy homeostasis and liver lipid metabolism, where overactivation in NAFLD can promote steatosis and inflammation, presenting cannabinoid receptor antagonism as a potential therapeutic approach for mitigating liver disease progression. (48) Weight discrimination and psychological stress linked to obesity can exacerbate NAFLD via stress-induced hormonal dysregulation and subsequent worsened metabolic profiles, highlighting the importance of addressing psychological factors as part of a comprehensive treatment plan for fatty liver disease. (49) Constella, or linaclotide, used in gastroenterology for irritable bowel syndrome, is being investigated for its potential benefits in NAFLD due to its effects on reducing visceral hypersensitivity, which may indirectly influence systemic inflammation and liver health through gut-mediated mechanisms. (50) In NAFLD, systemic inflammation is driven by pro-inflammatory signals such as interleukin-6, IL-6, which contribute to insulin resistance and hepatic inflammation. Thus, targeted anti-inflammatory strategies could potentially attenuate both systemic metabolic dysfunction and local hepatic injury. (1) Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. (2) The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. (3) Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. (4) The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. (5) Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. (6) The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. Seven, the utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. 8. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. 9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. 10. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. 11. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. 12. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. 13. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. 14. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. 15. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. 16. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. 17. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. 18. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. 19. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. 20. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. 21. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. 22. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. 23. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. 24. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. 25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. 26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. 27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided surgery using 5-ALA, have enhanced the precision of tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. 28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. 29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. 30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. 31. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. 32. Unveiling the potential of chimeric antigen receptor (CAR) T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. 3.3. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. 34. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. 35. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. Innovative surgical techniques in skull-base tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. 45. Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. 47. The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. 48. Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. 49. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. 50. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. Leukemia is a type of cancer that affects the blood and bone marrow, characterized by an overproduction of abnormal white blood cells which impede the production of normal blood cells, including red blood cells, white blood cells, and platelets, leading to symptoms such as fatigue, frequent infections, and easy bruising or bleeding due to the bone marrow's compromised function. 2. Acute lymphoblastic leukemia, ALL, primarily affects children and adolescents, and it develops rapidly with immature lymphocytes proliferating uncontrollably, requiring timely diagnosis and aggressive treatment through chemotherapy regimens like the Berlin-Frankfurt-Munster (BFM) protocol, which can achieve remission in many patients. 3. Chronic myeloid leukemia, CML, is driven by a specific genetic abnormality, the Philadelphia chromosome, which results from a translocation between chromosomes 9 and 22, creating the BCR-ABL fusion gene that leads to excessive production of myeloid cells. Targeted therapies such as tyrosine kinase inhibitors have significantly improved patient prognosis. 4. In leukemia, the bone marrow biopsy is a critical diagnostic tool that provides histological insights by displaying increased cellularity with the presence of immature and abnormal white blood cells, contributing to a definitive diagnosis when supplemented with immunophenotyping and cytogenetic analysis. 5. Leukemia symptoms often present as nonspecific and can include fatigue, pallor, fever, recurrent infections, unexplained weight loss, and swelling of lymph nodes, where chronic forms tend to develop more slowly, whereas acute forms progress swiftly and can manifest as severe symptoms in a short period. 6. Acute myeloid leukemia, AML, is characterized by the rapid proliferation of myeloid progenitor cells that accumulate in the bone marrow and blood, leading to anemia, thrombocytopenia, and infections. Treatments include intensive chemotherapy, hematopoietic stem cell transplantation, and emerging targeted therapies. 7. Chronic lymphocytic leukemia, KIA, is often found in adults over 60 and is marked by the clonal expansion of small, mature-appearing lymphocytes, which can lead to immune dysfunction. It is monitored through regular blood tests, with treatment options including watchful waiting, chemotherapy, and monoclonal antibodies like rituximab. 8. Leukemia's pathophysiology often involves multiple genetic mutations and chromosomal abnormalities, which disrupt normal cellular processes such as differentiation and apoptosis, leading to clonal proliferation and accumulation of leukemic cells that displace healthy cells within the bone marrow. 9. Anemia in leukemia is caused by the replacement of normal bone marrow cells with leukemic cells, which disrupts erythropoiesis, leading to decreased hemoglobin levels, fatigue, and pale appearance. Managing anemia often involves red blood cell transfusions and treatment of the underlying leukemia. 10. Leukemia can cause thrombocytopenia, a condition marked by low platelet counts, due to the bone marrow's inability to produce adequate platelets. This results in an increased risk of bleeding and bruising, and may be managed with platelet transfusions and addressing the primary disease. 11. Immunophenotyping through flow cytometry is crucial in leukemia diagnostics as it allows for the identification of specific cell surface antigens that differentiate between various leukemia subtypes, enabling tailored therapeutic approaches based on the leukemic cell's lineage and maturation stage. 12. In leukemia, splenomegaly can occur as the leukemia cells infiltrate and expand the spleen, potentially causing abdominal discomfort and increased destruction of blood cells, which can be assessed clinically and through imaging techniques like ultrasound or CT scan for management purposes. 13. The Philadelphia chromosome is a critical marker in leukemia, especially chronic myeloid leukemia, where it results from a reciprocal translocation leading to a fusion protein with tyrosine kinase activity that drives uncontrolled cell proliferation. This is a target for specific tyrosine kinase inhibitors like imatinib. 14. Leukemia-associated lymphadenopathy presents as swollen, non-tender lymph nodes which are often detected during a physical examination. Their presence, especially when being atypically located or persisting, warrants further investigation including blood work and imaging to rule out malignancy. 15. In pediatric leukemia, especially acute lymphoblastic leukemia, central nervous system involvement can occur, necessitating prophylactic intrathecal chemotherapy to prevent or treat CNS disease, as evaluation of cerebrospinal fluid through lumbar puncture can detect leukemic infiltration. 16. Minimal residual disease, MRD, in leukemia refers to the presence of leukemic cells that remain after treatment and are not detectable by conventional microscopy. Using sensitive molecular techniques for MRD detection can help predict relapse, guide post-remission therapy decisions, and improve outcomes. 17. Bone pain in leukemia is frequently reported due to the expansion of leukemic cells within the bone marrow cavities, which increases pressure and stimulates nerve endings, and diagnosing it involves correlating clinical findings with imaging studies to differentiate it from other potential causes. 18. The incidence of secondary leukemias, which are leukemias developing after previous chemotherapy or radiation for other cancers, is on the rise with common types including therapy-related myeloid neoplasms, marked by poor prognosis, requiring complex management decisions balancing treatment efficacy and toxicity. 19. Leukostasis is a complication seen in acute leukemias with very high white blood cell counts, resulting in impaired blood flow and increased risk of microvascular occlusion, presenting clinically with symptoms like respiratory distress and neurologic deficits, often managed with leukapheresis and cytoreductive therapy. 20. Leukemia treatment-related fatigue is a prevalent and debilitating symptom that affects quality of life, often resulting from both the disease itself and the intensive chemotherapy regimens, necessitating comprehensive management strategies including psychosocial support and physical rehabilitation. 21. Genetic predispositions to leukemia include several familial syndromes such as Li-Fraumeni syndrome and Fanconi anemia, which have mutations in genes responsible for DNA repair and tumor suppression, highlighting the importance of genetic counseling and surveillance for early detection in high-risk families. 22. In elderly patients with leukemia, traditional aggressive treatments might be contraindicated due to comorbidities and frailty, leading to an emphasis on supportive care measures and exploring participation in clinical trials for novel agents, tailored to improve quality of life and functional status. 23. Hematopoietic stem cell transplantation remains a potentially curative option for leukemia, especially for high-risk or relapsed cases, involving a complex process where the patient's existing bone marrow is replaced with healthy donor stem cells, with careful consideration of donor matching and graft versus host disease. 24. Targeted therapies in leukemia have transformed treatment paradigms by selectively inhibiting specific molecular pathways involved in leukemogenesis, such as FLT3 inhibitors in acute myeloid leukemia, allowing for precision medicine approaches with improved efficacy and reduced systemic toxicity. 25. In leukemia, circulating blasts can be identified on peripheral blood smears, providing crucial initial diagnostic information. The presence of blasts, especially in the absence of infection or inflammation, often triggers further investigation with bone marrow analysis to confirm a leukemia diagnosis. 26. Monoclonal antibody therapies, like rituximab and alemtuzumab, have emerged as effective treatment options for certain leukemias by targeting specific antigens on leukemic cells, facilitating immune-mediated destruction with the benefit of minimal off-target effects and integration into combination regimens. 27. Leukemia's impact on the liver includes potential infiltration by leukemic cells leading to hepatomegaly, which can be detected clinically and confirmed through imaging or biopsy, necessitating careful management due to potential complications such as liver dysfunction and systemic organ involvement. 28. The cytogenetic profile of leukemic cells provides prognostic information and guides treatment choices, with abnormalities such as T8, 21, INV, 16, and T15, 17 in acute myeloid leukemia associating with different risk stratifications and responses to various therapeutic strategies. 29. Psychological support is a vital component of leukemia care, addressing the emotional and mental health needs of patients and their families as they navigate diagnosis, treatment, and survivorship, often involving multidisciplinary teams of counselors, social workers, and support groups. 30. Hyperleukocytosis in leukemia, with extremely elevated white blood cell counts, poses life-threatening risks such as leukostasis and tumor lysis syndrome, requiring urgent intervention with hydration, allopurinol, and emergent leukoreduction techniques to prevent end organ damage. 31. The role of the tumor microenvironment in leukemia progression is critical, as interactions between leukemic and stromal cells can promote survival and resistance to therapy, suggesting that targeting the microenvironment alongside leukemic cells could enhance treatment efficacy. 32. Pseudohyperkalemia can occur in leukemia due to increased white blood cell counts, causing cell lysis during blood specimen collection and falsely elevated potassium levels, necessitating careful interpretation of laboratory data and consideration of alternative blood draw techniques. 33. 3.3. The use of chimeric antigen receptor (CAR) T-cell therapy represents a groundbreaking advance in leukemia treatment, particularly for refractory B-cell malignancies, involving engineering patient-derived T-cells to recognize and destroy specific cancer cells, offering promising remission and survival rates. (34) The differential diagnosis of thrombocytosis in leukemia involves assessing for reactive causes, primary myeloproliferative disorders, or leukemic infiltration, affecting treatment strategies ranging from addressing underlying conditions to targeting excess platelet production. (35) Leukemia can cause renal impairment through direct leukemic infiltration, hyperuricemia due to high cell turnover, or nephrotoxicity from chemotherapy, requiring vigilant renal function monitoring and early intervention to mitigate potential renal damage. (36) The genetics of acute promyelocytic leukemia involves a characteristic translocation, T1517, leading to the PML-RARA fusion protein, which impairs cell differentiation. Targeted treatment with all-trans-retinoic acid, ATRA, and arsenic trioxide can induce remission by promoting differentiation of leukemic cells. (37) Monitoring for treatment response and potential relapse in leukemia often involves serial complete blood counts and marrow assessments, where molecular techniques to quantify minimal residual disease help refine treatment adjustments and prognostication, guiding decisions about ongoing therapies. (38) Cardiovascular risks in leukemia patients can be amplified by treatment regimens, with anthracycline-induced cardiotoxicity being a concern requiring baseline and follow-up cardiac monitoring, with careful balancing of chemotherapy efficacy against potential long-term cardiovascular impacts. (39) Tumor lysis syndrome is a potentially fatal consequence of treating high-burden leukemias, causing rapid cell lysis and metabolic derangements. Early identification and aggressive management with hydration, electrolyte monitoring, and medications like rasburicase are crucial to prevent morbidity and mortality. (40) Leukemia can lead to immune system dysfunction due to the proliferation of abnormal white blood cells and impaired hematopoiesis, increasing susceptibility to infections, necessitating prophylactic measures, vigilant monitoring for infectious complications, and timely intervention with antimicrobials. (41) In leukemia, identifying specific symptom clusters like B symptoms, fever, night sweats, and weight loss can help classify disease severity and guide prognosis, where their presence is often associated with more aggressive or advanced disease necessitating prompt medical attention. (42) The contributions of myelodysplastic syndromes to leukemia development lie in the potential for progression to secondary acute myeloid leukemia, characterized by ineffective hematopoiesis and chromosomal abnormalities, mandating surveillance and timely intervention to curb progression. (43) Leukemia cutis refers to the infiltration of leukemic cells into the skin, presenting as papules, nodules, or plaques, and serves as an indicator of systemic disease, requiring dermatologic and oncologic evaluation for comprehensive management strategies to address both cutaneous and systemic involvement. (44) The advent of integrative medicine approaches in leukemia care emphasizes the incorporation of complementary therapies such as acupuncture, nutritional counseling, and stress management techniques to support well-being and enhance the quality of life alongside conventional medical treatments. (45) The interplay between leukemia and the central nervous system extends beyond direct infiltration, with paraneoplastic syndromes and chemotherapeutic neurotoxicity posing additional clinical challenges, highlighting the need for neuro-oncological expertise in managing neurological aspects of care. (46) The role of the patient's microbiome in leukemia is an emerging area of research, with potential influences on chemotherapy toxicity and immune responses suggesting that microbiome modulating strategies could offer novel adjunctive treatments to enhance therapeutic efficacy and patient outcomes. 47. Leukemia-related hypercalcemia is uncommon but can occur due to osteolytic activity or ectopic production of parathyroid hormone-related peptide, manifesting with neuromuscular symptoms and necessitating swift evaluation and treatment to restore normal calcium levels and prevent complications. 48. Steroid therapy is frequently utilized in leukemia management, particularly in lymphoid leukemias, to induce apoptosis and reduce the leukemic cell burden. However, its long-term use requires careful balance with potential adverse effects such as immunosuppression and glucocorticoid resistance. 49. Advances in liquid biopsy techniques for leukemia provide a non-invasive means to detect circulating tumor DNA or leukemic cells, offering insights into disease monitoring, molecular characterization, and early detection of relapse, aligning with precision medicine goals for personalized patient care. 50. Leukemia is linked to occupational and environmental exposures, such as benzene and ionizing radiation, underscores the significance of preventive measures and regulatory policies to reduce population-level risk factors, aiming to mitigate the incidence of environmentally induced leukemias. 1. Esophageal cancer primarily arises from the squamous cells lining the esophagus or from glandular cells in Barrett's esophagus, with adenocarcinoma more prevalent in Western countries, resulting from a chronic cycle of gastroesophageal reflux disease inducing metaplastic changes. 2. Diagnosing esophageal cancer often involves endoscopic ultrasonography combined with biopsy, aiming to accurately determine the tumor's depth and the involvement of surrounding lymph nodes, critical for effective staging and treatment planning. 3. The correlation between tobacco use and esophageal squamous cell carcinoma has been strongly established, with carcinogens within tobacco triggering genetic mutations that disrupt normal cellular machinery, promoting malignant transformation and proliferation. 4. Treatment modalities for esophageal cancer include neoadjuvant chemoradiotherapy, which seeks to downsize tumors before surgical resection, improving resection success rates and potentially enhancing overall survival. 5. Advances in molecular biology have illuminated the role of receptor tyrosine kinases such as HER2 in esophageal adenocarcinoma, paving the way for targeted therapies aimed at these aberrant signaling pathways to curb cancer progression. 6. Esophageal cancer symptoms often present late in the disease course, with progressive dysphagia being the most prominent sign, initially for solids and then liquids, as the esophageal lumen narrows due to tumor growth. 7. The prognosis for esophageal cancer remains grave, with a 5-year survival rate generally under 20%, heavily influenced by early-stage detection and the availability of comprehensive multimodal treatment strategies. 8. A significant advancement in the prevention of esophageal adenocarcinoma is the successful management of Barrett's esophagus with proton pump inhibitors or endoscopic ablative therapies, reducing dysplasia progression to invasive carcinoma. 9. Histopathological examination of resected esophageal cancer tissue often reveals key characteristics such as poorly differentiated cells in squamous cell carcinoma or glandular formation in adenocarcinoma that assist in confirming the cancer subtype. 10. Radiation therapy in esophageal cancer can be delivered via external beam methods or brachytherapy, targeting cancer cells while sparing the surrounding healthy tissue, thus managing symptoms such as pain and dysphagia effectively. 11. In the burgeoning field of immunotherapy for esophageal cancer, the use of checkpoint inhibitors targeting PD-1 and PD-L1 pathways has shown promise, leading to immune system engagement against tumor cells and eliciting durable responses. Intriguingly, preventive measures against esophageal adenocarcinoma include rigorous lifestyle modification, like adopting a Mediterranean diet rich in fruits, vegetables, and omega-3 fatty acids, which may yield a protective anti-inflammatory benefit. 13. The phenomenon of field cancerization, where the entire esophageal mucosa exhibits precancerous changes, underscores the need for regular surveillance endoscopies in high-risk populations to catch potential malignancies at an actionable stage. 14. Endoscopic therapies, such as mucosal resection or submucosal dissection, have revolutionized the management of superficial esophageal cancer, offering a less invasive approach with lower complication rates compared to traditional esophagectomy. 15. Genomic studies have identified recurring mutations and amplifications in genes like TP53 and cyclin D1 in esophageal cancer, driving oncogenic pathways and presenting novel targets for future therapeutic interventions. 16. While squamous cell carcinoma of the esophagus has long been linked with nitrosamine-rich diets, ongoing epidemiological studies suggest that reducing such dietary components could contribute to a lower incidence of this cancer subtype. 17. For patients unable to tolerate surgery, definitive chemoradiotherapy remains a mainstay treatment for esophageal cancer, providing a non-operative cure potential while addressing both the local and systemic nature of the disease. 18. The role of minimally invasive esophagectomy in treating esophageal cancer is being increasingly recognized, offering comparable long-term outcomes to open procedures, with the potential for reduced post-operative morbidity and quicker recovery. 19. Emerging liquid biopsy techniques, such as the detection of circulating tumor DNA, hold promise for the non-invasive monitoring of esophageal cancer progression in response to treatment, allowing for more personalized therapy adjustments. 20. An exploration of microRNA profiles in esophageal cancer has revealed their significant involvement in tumorigenesis and metastasis, suggesting that these small non-coding RNAs could serve as biomarkers for earlier detection and novel therapeutic targets. 21. Despite chemotherapy being a cornerstone in treating locally advanced and metastatic esophageal cancer, resistance often develops through various mechanisms, including drug efflux pump expression and DNA repair pathway enhancement. 22. As alcohol consumption is a known risk factor for esophageal squamous cell carcinoma, public health initiatives focusing on reducing alcohol intake are essential components of comprehensive cancer prevention strategies. 23. In esophageal cancer, the intricate relationship between chronic inflammation and cancer development is highlighted by the molecular interplay between inflammatory cytokines and the nitrogen monofluoride Kb pathway, orchestrating a supportive microenvironment for tumor growth. 24. The development of organoids derived from esophageal cancer tissues presents a promising tool for personalized medicine, enabling drug testing and response prediction tailored to the patient's unique tumor biology. 25. Pioneering research into the esophageal cancer microbiome indicates that an altered bacterial composition might contribute to carcinogenesis, opening avenues for novel diagnostic markers and treatment adjuncts targeting microbial imbalances. 26. Nutritional challenges in esophageal cancer patients necessitate multidisciplinary care, with dietitians playing a critical role in ensuring adequate nutritional intake and managing cachexia, crucial for maintaining strength during aggressive treatment regimens. '27. The feasibility and efficacy of natural compounds, such as curcumin, are being evaluated in the context of esophageal cancer, postulating that their anti-inflammatory and apoptotic properties might harbor therapeutic significance when used alongside conventional treatments. 28. Integration of artificial intelligence in the analysis of endoscopic images is revolutionizing esophageal cancer diagnosis, enhancing the accuracy and speed of detecting lesions that might be missed by the human eye alone. 29. Factors such as obesity and metabolic syndrome contribute to the risk of esophageal adenocarcinoma through chronic inflammation and insulin resistance, signifying an intersection of metabolic health and cancer prevention strategies. '30. Studies on the epidemiology of esophageal cancer highlight a higher prevalence among males compared to females, with research exploring the mechanisms linked to hormones and environmental exposure differences responsible for this disparity. '31. Multidisciplinary tumor boards for esophageal cancer encourage collaboration among specialists, ensuring that each patient receives a comprehensive treatment plan optimized for both local control and systemic disease. '32. Vocal cord paralysis is a lesser-known complication of advanced esophageal cancer, arising from invasion or compression of the recurrent laryngeal nerve, which may necessitate speech therapy or surgical intervention to restore voice function. '33. An examination of disparities in esophageal cancer care reveals that socioeconomic factors significantly influence both access to early detection and advanced treatment options, necessitating policy reforms aimed at equitable healthcare delivery. '34. Recent trials focusing on the de-escalation of post-esophagectomy adjuvant therapy explore whether reduced treatment intensity can still deliver survival benefits, minimizing the burden of treatment-related toxicity. '35. Notably, the TREPS classification describes distinct anatomical and pathological characteristics of esophageal cancer, enabling a nuanced approach to understanding the disease's diverse presentations and informing surgical technique refinement. '36. Cirrhosis and chronic liver disease, through mechanisms involving portal hypertension and esophageal varices, can complicate the management of esophageal cancer, leading to increased treatment complexity and necessitating coordinated care. '37. The utilization of PET-CT imaging in staging esophageal cancer allows for sensitive detection of distant metastasis, providing critical information that impacts the treatment strategy and overall prognostic considerations. '38. Comparative studies analyzing the outcomes of robotic-assisted versus traditional open esophagectomy reveal potential advantages in reducing surgical trauma and postoperative complications, while ensuring oncological efficacy. '39. Emerging research into pro-inflammatory cytokines, such as IL-6, reveals their influential role in creating a tumor-permissive environment in esophageal cancer, highlighting potential therapeutic targets in inflammatory modulation. '40. An understanding of lymphatic spread patterns in esophageal cancer assists in precise staging and tailoring surgical and radiation fields, thereby potentially improving disease control and patient outcomes. '41. Cutting-edge advancements in photodynamic therapy for esophageal cancer harness the power of light-activated drugs, providing a focused approach to tumor ablation, particularly for palliative care where conventional options prove challenging. 42. Calcium channel blockers, typically used for cardiovascular conditions, are under investigation for their potential to modulate cancer cell growth and apoptosis in esophageal cancer, suggesting a possible repurposing as adjunctive therapy. 43. The adoption of patient-reported outcome measures in clinical trials for esophageal cancer underscores the importance of capturing the patient perspective in assessing treatment impact, thus enhancing care models focused on quality of life. 44. In-depth studies on esophageal cancer cell lines have revealed insights into their genetic heterogeneity, emphasizing the necessity for personalized therapeutic approaches that account for tumor-specific mutational landscapes. 45. The complex interplay between host immunity and tumor evasion in esophageal cancer emphasizes the critical role of the immune microenvironment, propelling research into immune-modulating therapies that can recalibrate this balance. 46. Colloidal gold nanoparticles are being explored for enhanced imaging and targeted drug delivery in esophageal cancer, capitalizing on their size, biodistribution, and ability to conjugate with molecular agents. 47. The impact of postoperative complications on long-term survival in esophageal cancer patients indicates that reducing surgical morbidity is integral to improving overall outcomes, necessitating refined techniques and perioperative care. 48. A notable preventive measure for esophageal cancer includes the avoidance of scalding hot beverages known to damage the esophageal lining, potentially contributing to corrosive esophagitis and facilitating carcinogenic processes. 49. The integration of palliative care early in the treatment of esophageal cancer addresses complex symptom management, psychological support, and advanced care planning, ensuring comprehensive care beyond tumor-focused treatments. Surveillance strategies for individuals with familial Barrett's esophagus syndromes highlight the importance of genetic counseling and regular monitoring processes in intercepting esophageal cancer at its nascent stage, offering improved prognostic prospects. 1. Prostate cancer, most frequently diagnosed in men over 65, often begins its insidious course when normal prostate cells mutate their DNA, leading to uncontrolled growth influenced by male hormones like testosterone, creating a local lesion that can sometimes remain asymptomatic for years until peripheral nerves are affected, causing characteristic lower back pain or radical changes in urinary patterns. 2. The prostate-specific antigen, PSA, test, although controversial due to its potential for false positives, remains a crucial tool in the early detection of prostate cancer, with elevated levels suggesting the need for further investigative procedures such as a digital rectal exam, DRE, or magnetic resonance imaging, MRI, to visualize suspect areas within the gland. 3. One innovative area in prostate cancer treatment is the use of high-intensity focused ultrasound, HIFU, which precisely targets cancerous tissues via sound waves, thereby minimizing damage to surrounding healthy tissues, an advantage that is especially palpable in situations where traditional radiation therapy would pose a higher risk to neighboring structures. 4. In understanding the pathophysiology of prostate cancer, it's crucial to recognize the role of genetic alterations, such as PTEN loss or TMPRSS2-ERG fusion, which can drive aggressive phenotypes and underlie castration-resistant pathways, often necessitating the subsequent use of androgen receptor pathway inhibitors like enzalutamide. 5. The concept of active surveillance in prostate cancer acknowledges that many tumors grow so slowly that immediate treatment might be unnecessary. Thus, the patient undergoes regular monitoring for any indication of progression, often reserved for those with low-risk profiles to avoid the morbidities associated with premature intervention. 6. Multiparametric MRI has revolutionized the diagnostic landscape of prostate cancer, providing detailed images that not only help in defining the tumor's size and extent, but also direct targeted biopsies, offering greater accuracy over traditional random biopsy approaches, especially in distinguishing significant cancers from indolent ones. 7. The genetic landscape of prostate cancer is varied, with tumors often exhibiting a stable genome compared to other malignancies, yet exhibiting mutations in BRCA1 and BRCA2 genes that confer heightened aggressiveness and poorer outcomes, necessitating careful consideration of family history in the clinical context. 8. Prostate cancer pathophysiology can involve transitions from androgen-dependent to androgen-independent states, a conundrum that complicates treatment, enhancing the importance of novel therapies like PARP inhibitors, which exploit DNA repair vulnerabilities specific to cancer cells, thereby increasing the sensitivity of the tumors to subsequent therapies. 9. Proton beam therapy offers a cutting-edge approach for treating prostate cancer, using proton particles that deposit most of their energy directly in the tumor, sparing surrounding tissues with remarkable precision and reducing common side effects like urinary or bowel dysfunction compared to more conventional photon-based radiotherapy. 10. Understanding prostate cancer metastasis requires an appreciation for the molecular changes that allow tumor cells to detach and traverse bodily systems, particularly the lymphatic pathways leading to nearby lymph nodes and bones, where they establish secondary growths, often necessitating systemic treatment modalities beyond localized therapy. 11. The Gleason scoring system remains a cornerstone in predicting prostate cancer behavior, assigning a score based on glandular patterns observed under a microscope, where higher scores indicate a greater degree of aberration, aiding in tailoring management strategies to individual patient risk levels. 12. Androgen deprivation therapy, ADT, has long been a mainstay in the management of advanced prostate cancer, aiming to reduce circulating testosterone through either surgical orchiectomy or pharmaceutical agents such as GnRH agonists, which ultimately starve the cancer of its growth-promoting hormones. 13. Immunotherapy, such as the use of Sipuleucel T, represents a novel frontier in prostate cancer treatment, whereby a patient's immune cells are engineered to recognize and combat prostate cancer cells, offering a personalized approach that can extend survival in select patients with advanced disease. 14. There is growing evidence that the microbiome, particularly within the gut, may play an influential role in prostate cancer development and progression, with certain microbial compositions potentially modulating systemic inflammation and hormonal balances that encourage or suppress oncogenic pathways. 15. Radioligand therapy, targeting prostate-specific membrane antigen, PSMA, provides a promising avenue for metastatic prostate cancer, leveraging radioactive isotopes bound to molecules that selectively attach to cancer cells, delivering lethal doses of radiation while sparing healthy tissue to a greater extent than traditional methods. 16. Transperineal prostate biopsy, performed under ultrasound guidance, minimizes infection risk compared to transrectal approaches, and provides more comprehensive sampling of the prostate, enhancing diagnostic precision especially in previously biopsied individuals with persistently elevated PSA levels. 17. Obesity has been implicated in the pathogenesis of more aggressive prostate cancer forms, potentially due to increased levels of inflammatory cytokines and insulin-like growth factors, which may promote tumor growth, highlighting the importance of lifestyle interventions as adjuncts in the prevention and management of prostate cancer. 18. The influence of dietary patterns on prostate cancer risk and progression has gained attention, with studies suggesting that diets rich in tomatoes, due to their lycopene content, and polyphenol-rich foods like green tea, may confer protective effects through their antioxidant and anti-inflammatory properties. Focal therapy, including cryoablation and laser thermal therapy, targets prostate cancer lesions with precision, potentially offering a middle ground between active surveillance and radical treatments, aiming to eradicate cancerous tissues while preserving prostate function and patient quality of life. 20. Circulating tumor cells, CTCs, and DNA, ctDNA, are emerging biomarkers in the blood that may offer real-time insights into prostate cancer dynamics, potentially guiding treatment decisions and prognostication by reflecting tumor burden and molecular changes in response to therapy. 21. Radiotherapy advancements now permit hypofractionated regimens for prostate cancer, where higher doses per session shorten treatment duration, maintaining efficacy while offering greater convenience and reducing time spent by patients undergoing therapy, demonstrating comparable side effect profiles to conventional schedules. 22. The phenomenon of neuroendocrine differentiation in prostate cancer, often occurring in the setting of advanced, treatment-resistant disease, represents a shift in tumor phenotype, where cells acquire neuroendocrine-like features that are less reliant on androgen receptors, complicating therapeutic approaches, and often indicating a poorer prognosis. 23. Dietary supplementation with vitamin D has been investigated for its potential role in reducing prostate cancer risk and progression, given that this nutrient is thought to influence cellular differentiation and proliferation. Yet evidence remains mixed, warranting further study to elucidate its impact fully. 24. Magnetic resonance imaging ultrasound (MRI-US) fusion biopsy technology allows for the precise targeting of suspicious areas within the prostate identified on MRI, providing increased accuracy over traditional biopsy techniques, potentially reducing the number of necessary samples and improving cancer detection rates. 25. The advent of genomic profiling in prostate cancer has facilitated the identification of actionable mutations, enabling targeted therapies such as those aimed at the PI3K, AKT, mTOR pathway, which are currently being explored in clinical trials to determine their efficacy in improving outcomes in certain genetic subpopulations. 26. Early-stage prostate cancer may be asymptomatic, but as the disease progresses, symptoms such as difficulty urinating, blood in urine or semen, and erectile dysfunction can develop, emphasizing the importance of regular screening and early intervention to mitigate the impact on quality of life. 27. Hormone-refractory prostate cancer, also known as castration-resistant prostate cancer, CRPC, occurs when the disease progresses despite androgen deprivation, necessitating the use of additional therapies such as chemotherapy with docetaxel or cabazitaxel, which target rapidly dividing cancer cells through distinct cytotoxic mechanisms. 28. The relationship between chronic inflammation and prostate cancer has been a focal point in research, with inflammatory conditions potentially leading to genetic mutations over time, thus providing a fertile ground for cancer development, encouraging explorations into anti-inflammatory compounds as preventive measures. 29. Prostate cancer risk is significantly augmented by family history, with men having a first-degree relative diagnosed with prostate cancer being about twice as likely to develop the disease themselves, suggesting a substantial genetic component that could inform personalized screening strategies. 30. The use of 5-alpha reductase inhibitors in prostate cancer prevention is predicated on their ability to block the conversion of testosterone to dihydrotestosterone, a potent androgen that drives prostatic growth, though these medications are typically reserved for specific cases due to potential side effects. 31. The complexity of the tumor microenvironment in prostate cancer, including interactions between cancer cells, stromal cells, and extracellular matrix components, plays a crucial role in disease progression, influencing tumor growth, resistance to treatment, and metastatic potential, thus providing a rich target for novel therapeutic strategies. 32. Bone-targeted therapies such as bisphosphonates and denosumab play a pivotal role in managing bone metastasis in prostate cancer, working to reduce skeletal-related events by inhibiting osteoclast-mediated bone resorption, thereby enhancing patient quality of life and potentially extending survival. 3. Epidural spinal cord compression is a critical complication of metastatic prostate cancer that requires immediate medical intervention, often involving steroids, radiotherapy, or surgery to alleviate pressure on the spinal cord, thus preventing irreversible neurological damage and preserving functional status. 34. Prostate cancer staging with radiolabeled tracers like choline, or more recently PSMA, in positron emission tomography (PET) scanning, significantly improves detection of both local and distant metastasis, providing a comprehensive picture of disease burden that informs subsequent treatment planning. 35. Contemporary surgical techniques, such as robotic-assisted laparoscopic prostatectomy, have revolutionized prostate cancer surgery by offering enhanced dexterity and visualization, thereby improving outcomes related to oncological control, continence, and erectile function compared to traditional open procedures. 36. Chemoprevention trials in prostate cancer are exploring the use of dietary agents such as soy isoflavones and selenium, hypothesized to exert protective effects through modulation of hormonal and inflammatory pathways, though findings to date remain inconclusive and warrant further investigation. 37. Prostate cancer cell dormancy represents a significant clinical challenge, as disseminated tumor cells may remain quiescent for years before reactivation, complicating treatment strategies and necessitating ongoing research into the triggers of dormancy and potential interventions to eliminate dormant cells. 38. In the landscape of personalized medicine, molecular subtyping of prostate cancer is becoming increasingly important, with classification systems identifying distinct subsets of the disease based on genetic and molecular signatures, which can guide targeted therapeutic interventions and prognostic assessments. 39. The impact of psychosocial factors on prostate cancer outcomes is profound, with stress, depression, and lack of social support been associated with poorer survival, reinforcing the importance of holistic approaches that incorporate mental health and well-being support alongside traditional clinical care. 40. The risk stratification of prostate cancer recurrence post-treatment is enhanced by tools such as the Cancer of the Prostate Risk Assessment (CAPRA) score, which evaluates pre- and post-treatment variables to predict the likelihood of biochemical recurrence, thereby informing ongoing patient monitoring and management decisions. 41. In the exploration of resistance mechanisms, prostate cancer research has unveiled the role of aberrant CRIP signaling and DNA repair processes in conferring treatment resistance, emphasizing the need for combination regimens targeting multiple pathways to delay or overcome resistance in advanced cases. 42. The role of somatic mutations in genes such as SPOP, FOXA1, and CHD1 is being elucidated in the context of prostate cancer, with these mutations associated with specific clinicopathological features and treatment responses, offering the potential for enriched patient stratification in clinical trials. 43. In the realm of advanced imaging, 3D histological reconstruction from biopsy samples provides a deeper insight into the spatial arrangement of cancerous tissues within the prostate, offering potential improvements in understanding tumor biology and enhancing the precision of treatment planning. 44. Genetic counseling and testing for hereditary prostate cancer syndromes, particularly in families with BRCA mutations, are crucial components of risk assessment and management, enabling tailored screening protocols and consideration of prophylactic measures in high-risk individuals. The use of metabolism-targeted therapies, such as inhibitors of fatty acid synthase or those impacting mitochondrial function, represents a burgeoning frontier in prostate cancer treatment, aiming to exploit the metabolic adaptations that cancer cells undergo to support rapid proliferation. 46. Tracking therapeutic responses in prostate cancer through advanced biomarkers, such as changes in circulating microRNA profiles, provides a non-invasive tool to monitor disease dynamics in real time, enabling adjustments to therapeutic regimens in response to detected changes. 47. In assessing and managing the side effects of prostate cancer treatments, integrative approaches combining conventional medical treatment with complementary methods such as acupuncture or yoga may offer relief from therapy-related symptoms, such as fatigue and anxiety, enhancing overall quality of life. 48. Ongoing research into the prostate cancer stem cell hypothesis suggests that tumorigenesis may be driven by a subset of stem-like cells capable of self-renewal and resistance to conventional therapies, presenting a profound challenge but also a potentially transformative target in the quest for more effective long-term treatments. 49. In the journey of a patient with prostate cancer, survivorship programs play an essential role in addressing long-term health outcomes, focusing on lifestyle modifications, routine health screenings, and psychological support as part of an integrated approach to life beyond cancer. Advancements in cryobiopsy for prostate cancer allow for the preservation of tissue architecture and viability for extensive histopathological analyses, providing critical insights into tumor heterogeneity and molecular characterizations that guide personalized treatment plans and novel research directions. 1. Gastric cancer, commonly known as stomach cancer, predominantly occurs in the stomach's lining and is most frequently found in the farthest section of the stomach, posing a significant health problem worldwide due to its relatively late presentation and poor prognosis. 2. The pathophysiology of gastric cancer is intricate, involving multifactorial processes such as the transformation of normal gastric epithelial cells into cancer cells driven by genetic mutations, epigenetic alterations, and environmental influences, including diet and infection with Helicobacter pylori. 3. One of the most significant risk factors for developing gastric cancer is chronic infection with Helicobacter pylori, a bacterium that leads to chronic inflammation and, in some cases, can contribute to the development of precancerous lesions and eventually gastric malignancy. 4. Gastric cancer often presents asymptomatically in its early stages, making early detection challenging, with common symptoms including unexplained weight loss, abdominal pain, early satiety, dysphagia, and symptoms of upper gastrointestinal bleeding like hematemesis or melena only appearing in more advanced stages. 5. The diagnosis of gastric cancer requires a combination of upper gastrointestinal endoscopy, which allows direct visualization and biopsy of suspicious lesions, combined with histopathological examination for confirmation and staging purposes, often enhanced by imaging studies like CT scans for assessment of local and distant spread. 6. Treatment of gastric cancer is multidisciplinary and may involve surgical resection, which provides the best chance for cure in early-stage disease, alongside chemotherapy, radiotherapy, or targeted therapy, chosen based on the cancer's stage, location, and molecular characteristics, as well as patient factors. 7. Molecular profiling of gastric tumors can reveal distinct subtypes, such as the Epstein-Barr virus-associated type or the microsatellite instability high group, each having unique prognostic and therapeutic implications that guide personalized treatment strategies in modern oncology practice. 8. Early gastric cancer, confined to the mucosa or submucosa regardless of lymph node involvement, offers the potential for curative treatment through endoscopic resection techniques in select cases, emphasizing the importance of early diagnosis and intervention in improving patient outcomes. 9. Advanced gastric cancer, which has penetrated beyond the gastric wall into surrounding structures or metastasized to distant organs, often necessitates palliative approaches focusing on symptom management and quality of life improvement, given limited curative options. 10. Risk reduction strategies for gastric cancer include dietary modifications such as increasing fruit and vegetable intake, reducing consumption of smoked or pickled foods, and eliminating tobacco and alcohol use, alongside eradicating Helicobacter pylori infection when detected. 11. The Laurin classification divides gastric cancer into intestinal and diffuse types. The intestinal type is often associated with environmental factors and better prognosis, whereas the diffuse type is more likely linked to hereditary syndromes and poses a worse prognosis. 12. Hereditary diffuse gastric cancer, HDGC syndrome, caused by mutations in the CDH1 gene, is a genetic condition that dramatically increases the risk of developing gastric cancer at an early age, often necessitating prophylactic gastrectomy in affected individuals. 13. Gastric cancer survival rates vary significantly depending on the stage at diagnosis, with localized cancer having the highest 5-year survival rate, while metastatic disease is associated with a much poorer prognosis, underscoring the importance of early detection. 14. Peritoneal carcinomatosis is a common metastatic pattern of gastric cancer, whereby cancer cells disseminate within the peritoneal cavity, often leading to complications such as ascites and intestinal obstruction, and posing significant challenges in management. 15. Signet ring cell carcinoma is a histological variant of gastric cancer characterized by cells containing mucin-filled vacuoles that displace the nucleus, often associated with diffuse-type cancer, and is linked with a more aggressive clinical course and poorer prognosis. 16. The role of Helicobacter pylori in gastric carcinogenesis is well documented, with the infection leading to chronic gastritis, which can progress to atrophic gastritis, intestinal metaplasia, dysplasia, and eventually carcinoma, especially in genetically predisposed individuals. 17. A positive family history is a recognized risk factor for gastric cancer, suggesting a hereditary component in certain individuals, thus warranting consideration for genetic counseling and surveillance in at-risk families to facilitate early detection and management. 18. Helicobacter pylori eradication has been shown to reduce the incidence of gastric cancer in high-risk populations when implemented effectively, highlighting the importance of public health interventions focused on screening and treatment of this bacterial infection. 19. Nutritional factors play a significant role in gastric cancer risk, with high salt intake and consumption of smoked foods increasing the risk, while diets rich in fresh fruits, vegetables, and antioxidants are believed to confer a protective effect against the development of gastric malignancies. 20. Helicobacter pylori infection's role in gastric cancer has led to the development of serological and urea breath tests for its detection, forming the basis of case-finding strategies in endemic areas to help reduce gastric cancer incidence through early intervention. 21. Gastric cancer can also metastasize to distant organs like the liver, lungs, and bones, with such hematogenous spread indicating an advanced stage of the disease that typically requires systemic chemotherapy and palliative care approaches. 22. Various genetic mutations, such as those found in the APC, TP53, and KRAS genes, are associated with the development of gastric cancer, emphasizing the growing importance of genetic testing and personalized medicine approaches in the management of this disease. 23. Prognostic factors for gastric cancer include tumor stage, lymph node involvement, histological grade, and subtype, with these factors playing a crucial role in guiding treatment decisions and predicting patient outcomes. 24. Advanced imaging techniques, such as endoscopic ultrasound, EUS, are invaluable in the staging of gastric cancer by assessing the depth of tumor invasion and evaluating regional lymph nodes, aiding in planning appropriate treatment strategies. 25. Palliative care in gastric cancer focuses on symptom management, including control of pain, nausea, and nutritional support, ensuring patient comfort and quality of life in those with advanced disease where curative treatment is not feasible. 26. Trastuzumab, a monoclonal antibody targeting the HER2 receptor, is used in the treatment of HER2-positive advanced gastric cancer, offering a targeted therapeutic option that has improved outcomes for patients with this specific molecular subtype of the disease. 27. Minimally invasive surgical techniques, such as laparoscopic gastrectomy, are increasingly employed in the treatment of early-stage gastric cancer, offering benefits in terms of reduced postoperative pain, faster recovery, and improved cosmetic outcomes. 28. Gastric cancer screening programs have been implemented in some high-incidence countries, utilizing tools such as endoscopy and serological biomarkers to detect early-stage disease, which is crucial for improving survival rates through timely intervention. 29. The role of chronic atrophic gastritis as a precursor to gastric cancer is well established, with long-standing inflammation leading to mucosal atrophy, intestinal metaplasia, and dysplasia, representing critical steps in gastric carcinogenesis. 30. For patients with localized advanced gastric cancer, neoadjuvant chemotherapy can be administered before surgery to reduce tumor size and improve resectability, often enhancing survival outcomes compared to surgery alone. 31. The use of single-agent or combination chemotherapy remains a cornerstone in managing metastatic gastric cancer, with regimens including drugs like fluorouracil, cisplatin, and irinotecan aimed at controlling disease progression and extending survival. 32. Gastric cancer exhibits marked geographic variation in incidence, being more prevalent in East Asian countries compared to Western nations, reflecting differences in environmental risk factors, dietary habits, and genetic predispositions. 3. Gastric cancer can lead to paraneoplastic syndromes, such as acanthosis nigricans, where darkened, velvety skin patches appear, often serving as an early indicator of an underlying malignancy that warrants further diagnostic evaluation. 34. Nutritional management is pivotal in the care of patients with gastric cancer, particularly those undergoing treatment, as maintaining adequate nutritional status helps mitigate treatment-related side effects and supports recovery and overall well-being. 35. Emerging immunotherapies, such as checkpoint inhibitors, are being explored in gastric cancer treatment, offering promising avenues to harness the immune system's power to recognize and destroy cancer cells, potentially improving outcomes in select patient populations. 36. The diffuse type gastric cancer, characterized by poorly cohesive, invasive growth, often presents at a more advanced stage and is associated with a poorer prognosis, posing challenges in management due to its aggressive nature and resistance to conventional therapies. 37. Understanding the molecular mechanisms of gastric cancer has paved the way for novel targeted therapies, focusing on specific pathways altered in cancer cells, such as angiogenesis, cell proliferation, and survival pathways, providing new hope for personalized treatment. 38. The presence of lymphovascular invasion in gastric cancer specimens is a critical prognostic indicator, associated with an increased risk of metastasis, and underscores the importance of thorough pathological examination in guiding clinical decision-making. 39. The development and validation of molecular biomarkers for gastric cancer are crucial in enhancing diagnostic accuracy, treatment selection, and prognosis stratification, ultimately leading to more tailored patient care and improved outcomes. 40. Gastric cancer can disrupt normal gastric function, leading to complications like gastric outlet obstruction and bleeding, which require prompt intervention, ranging from endoscopic procedures to surgical bypass, depending on the situation's severity. 41. Polyps, such as hyperplastic or adenomatous polyps, can be precursors to gastric cancer, particularly when they undergo dysplastic changes, necessitating regular surveillance and removal when found during endoscopic evaluations. 42. Anemia, often due to chronic blood loss from the tumor or nutritional deficiencies, is a common finding in gastric cancer patients, requiring comprehensive evaluation and management to ensure optimal patient care and quality of life. 43. The staging system for gastric cancer, such as the TNM classification, is vital in determining the extent of disease spread, guiding treatment approaches, and providing prognostic information to patients and healthcare providers. 44. The pathogenesis of intestinal-type gastric cancer often involves a sequence of histological changes starting with chronic gastritis, progressing to atrophic gastritis, then intestinal metaplasia, followed by dysplasia, and ultimately culminating in carcinoma. 45. Genetic testing for hereditary cancer syndromes, such as Lynch syndrome, is recommended for individuals with a strong family history of gastric cancer, enabling risk assessment and informing surveillance and management strategies. 46. Post-immune response to Helicobacter pylori infection plays a role in gastric cancer development, with genetic and environmental factors influencing the level of inflammation and subsequent progression to malignancy in susceptible individuals. 47. The survival advantage of gastric cancer patients treated with adjuvant chemoradiotherapy post-gastrectomy has been demonstrated in several clinical trials, highlighting the importance of a multimodal approach in managing resectable disease. 48. Proximal gastric cancer, affecting the upper part of the stomach near the esophagus, is increasingly recognized, requiring distinct surgical approaches like total or proximal gastrectomy, often combined with esophageal resection, to achieve oncological clearance. 49. Psychological support is essential for gastric cancer patients, given the emotional and physical challenges of the disease and its treatment, ensuring holistic care that addresses both medical and mental health needs for optimal patient outcomes. 50. The role of circulating tumor DNA, ctDNA, as a non-invasive biomarker in gastric cancer is being investigated, offering potential for early detection, monitoring treatment response, and detecting minimal residual disease, paving the way for more personalized treatment approaches. 1. Hepatocellular carcinoma, HCC, is the most common primary liver cancer, accounting for more than 75% of liver cancer cases worldwide, and its development is often associated with chronic liver diseases such as hepatitis B, hepatitis C, and cirrhosis due to non-alcoholic fatty liver disease, NAFLD. 2. The pathophysiology of hepatocellular carcinoma involves a multi-step process of carcinogenesis in which chronic hepatic inflammation and fibrosis lead to genetic alterations, including activation of oncogenes and inactivation of tumor suppressor genes, contributing to malignant transformation of hepatocytes. 3. Early detection of hepatocellular carcinoma significantly improves treatment outcomes, and current guidelines recommend regular screening with ultrasound every 6 months for high-risk individuals, including those with cirrhosis, chronic hepatitis B, or a family history of HCC. 4. Staging of hepatocellular carcinoma often utilizes the Barcelona Clinic Liver Cancer (BCLC) staging system, which considers tumor size, number of nodules, vascular invasion, liver function, and overall performance status to guide treatment decisions. 5. Surgical resection is considered a potentially curative treatment for hepatocellular carcinoma in patients with preserved liver function and early-stage disease, particularly when there is a single tumor without vascular invasion. 6. Liver transplantation offers the best long-term survival benefit for patients with hepatocellular carcinoma who meet the Milan criteria. Single tumor is less than or equal to 5 cm or up to 3 nodules each is less than or equal to 3 cm, as it addresses both the cancer and the underlying liver disease. 7. Transarterial chemoembolization (TACE) is a locoregional therapy used in intermediate-stage hepatocellular carcinoma to deliver chemotherapy directly to the liver tumor and block its blood supply, aiming to induce tumor necrosis while sparing healthy liver tissue. 8. Sorafenib, a multikinase inhibitor, became the first systemic targeted therapy approved for advanced hepatocellular carcinoma, improving survival by inhibiting tumor cell proliferation and angiogenesis, though its use is associated with side effects such as hand-foot skin reaction and hypertension. 9. The emergence of immunotherapy agents like nivolumab and pembrolizumab, which are checkpoint inhibitors targeting PD-1, PD-L1 pathways, has provided new hope for the treatment of advanced hepatocellular carcinoma by enhancing the immune system's ability to recognize and attack cancer cells. 10. Hepatocellular carcinoma often presents asymptomatically in its early stages, but when symptoms do occur, they may include right upper quadrant abdominal pain, unexplained weight loss, jaundice, or palpable abdominal mass, often indicating advanced disease. 11. Radiofrequency ablation (RFA) is a minimally invasive treatment option for small hepatocellular carcinoma tumors, where high-frequency electric currents generate heat to destroy cancer cells, making it suitable for patients not eligible for surgery. 12. The risk factors for developing hepatocellular carcinoma are multifactorial, including chronic liver diseases such as hepatitis B and C infection, alcohol abuse, obesity, and aflatoxin exposure, with hepatocarcinogens promoting genetic mutations and cellular proliferation. 13. In hepatocellular carcinoma, alpha-fetoprotein (AFP) is a tumor marker that can aid in diagnosis when elevated, but it lacks specificity as levels may rise in other liver conditions, and a normal AFP does not rule out HCC. 14. Fibrolamellar carcinoma, a rare variant of hepatocellular carcinoma, predominantly affects young adults who do not have underlying liver disease and is characterized by distinctive histological features, such as lamellar fibrosis and large polygonal tumor cells. 15. Hepatocellular carcinoma commonly metastasizes to the lungs, bones, and lymph nodes, with distant spread occurring more frequently in advanced stages, complicating treatment and worsening prognosis. 16. Age-standardized incidence rates of hepatocellular carcinoma are particularly high in regions with endemic hepatitis B infection, such as East Asia and Sub-Saharan Africa, underscoring the importance of vaccination and antiviral therapies in reducing disease burden. 17. Microwave ablation, MWA, is an alternative locoregional therapy for treating hepatocellular carcinoma, employing microwaves to generate heat and induce tumor cell death, often preferred for larger or deeper liver tumors compared to RFA. 18. For patients with early-stage hepatocellular carcinoma who are not surgical candidates, stereotactic body radiotherapy, SBRT, offers a non-invasive treatment option by delivering high-dose radiation precisely to tumors, minimizing damage to surrounding tissues. 19. The role of surveillance in patients with cirrhosis is crucial, as early detection of hepatocellular carcinoma through regular imaging studies and biomarker testing can lead to earlier intervention and potentially curative treatment options. 20. Liver biopsy for hepatocellular carcinoma diagnosis is not routinely performed due to risks such as bleeding and tumor seeding, but may be indicated when imaging and clinical findings are inconclusive or atypical. 21. Genetic and molecular profiling of hepatocellular carcinoma is becoming increasingly important for identifying potential therapeutic targets, understanding tumor heterogeneity, and developing personalized treatment strategies. 22. Recent advancements in the management of hepatocellular carcinoma include the combination of immune checkpoint inhibitors with anti-angiogenic agents, such as the atezolizumab-bevacizumab regimen, which has shown improved progression-free survival and overall survival in clinical trials. 23. Hepatocellular carcinoma survival rates depend heavily on stage of diagnosis, with localized tumors having a better prognosis. However, overall 5-year survival remains low, emphasizing the need for early detection and innovative treatments. 24. Hepatic artery infusion chemotherapy, HAC, is a specialized technique used to deliver high concentrations of chemotherapeutic agents directly to the liver for treating advanced hepatocellular carcinoma, allowing higher drug exposure with reduced systemic toxicity. 25. The role of microRNAs and other non-coding RNAs in hepatocellular carcinoma pathogenesis is an active area of research, as these molecules can regulate gene expression and potentially serve as biomarkers or therapeutic targets. 26. In some cases, hepatocellular carcinoma may arise from non-cirrhotic livers, particularly in the context of hepatitis B infection or metabolic syndromes, challenging the traditional association between HCC and underlying cirrhosis. 27. Lenvatinib, another oral multikinase inhibitor used for first-line treatment of advanced unresectable hepatocellular carcinoma, targets multiple growth factor receptors involved in tumor angiogenesis and proliferation, offering an alternative to sorafenib. 28. Recent studies suggest metformin, a common antidiabetic drug, may reduce the risk of hepatocellular carcinoma in patients with type 2 diabetes by inhibiting cancer cell growth pathways and improving liver function, although further research is needed for definitive conclusions. 29. Alcohol-related liver disease is a significant risk factor for hepatocellular carcinoma, and abstinence from alcohol can lead to improvements in liver function, potentially reducing the risk of developing HCC in susceptible individuals. 30. 30. Pathological examination of hepatocellular carcinoma typically reveals a trabecular pattern of tumor cells, often arranged in thick cords, and may exhibit varying degrees of differentiation, necrosis, and cellular atypia. 31. The use of contrast-enhanced imaging techniques, such as CT or MRI, is pivotal in diagnosing hepatocellular carcinoma, as these modalities can demonstrate the characteristic arterial phase hyperenhancement followed by portal venous or delayed phase washout. 32. Hepatocellular carcinoma may have a viral etiology in over 50% of cases, with hepatitis B virus, HBV, and hepatitis C virus, HCV, infections conferring a significantly increased risk due to their ability to cause chronic liver inflammation and cirrhosis. 3. Advanced hepatocellular carcinoma can present with paraneoplastic syndromes, such as hypercalcemia or hypoglycemia, that arise from substances secreted by the tumor or metabolic derangements, complicating management and influencing prognosis. 34. The role of stem cells in the development and progression of hepatocellular carcinoma is being explored, with evidence suggesting cancer stem cells may contribute to treatment resistance, recurrence, and metastasis, posing challenges for long-term disease control. 35. The development of liquid biopsies for hepatocellular carcinoma, which detect circulating tumor DNA or other biomarkers in the blood, offers promise for non-invasive diagnosis, monitoring of treatment response, and detection of minimal residual disease. 36. For inoperable hepatocellular carcinoma, conventional systemic chemotherapy has limited effectiveness and is often reserved for patients without access to targeted therapies or in clinical trial settings due to significant side effects and modest survival benefits. 37. Resection of large hepatocellular carcinoma tumors involves careful consideration of liver reserves and vascular anatomy to minimize the risk of postoperative liver failure and improve the chances of long-term disease-free survival. 38. Multidisciplinary team (MDT) meetings are essential in the management of hepatocellular carcinoma, enabling collaboration between hepatologists, oncologists, surgeons, radiologists, and pathologists to tailor treatment strategies to individual patient needs. 39. Innovations in hepatocellular carcinoma research include exploration of epigenetic modifications, such as DNA methylation and histone acetylation changes, which may provide insights into new therapeutic targets and prognostic indicators. 40. The role of hepatic resection in patients with multinodular hepatocellular carcinoma remains controversial, as it requires careful selection based on tumor burden, liver function, and the potential for achieving negative surgical margins. 41. Alternative therapies, such as herbal remedies, are used by some patients with hepatocellular carcinoma, but evidence supporting their effectiveness and safety is limited, highlighting the need for coordinated care and open communication with healthcare providers. 42. The use of antiviral therapy in patients with hepatitis B-related hepatocellular carcinoma is crucial, as it can suppress viral replication, stabilize liver function, and potentially reduce tumor progression or recurrence post-treatment. 43. The presence of portal vein thrombosis in hepatocellular carcinoma patients is a poor prognostic indicator, often signifying advanced disease, complicating management, and limiting the options for curative treatment. 44. Adhesion molecule expression in hepatocellular carcinoma cells influences their invasive potential, with proteins such as E-cadherin playing a role in epithelial mesenchymal transition and subsequent metastatic spread. 45. The concept of tumor microenvironment in hepatocellular carcinoma involves interactions between cancer cells, immune cells, stromal cells, and extracellular matrix components, all of which can influence tumor growth, immune evasion, and treatment response. '46. Establishing effective hepatocellular carcinoma prevention and control programs requires addressing modifiable risk factors, providing access to antiviral therapies and vaccines, and promoting lifestyle changes to reduce the incidence of chronic liver diseases. '47. Recent advancements in bioinformatics and computational modeling are aiding in the understanding of hepatocellular carcinoma biology, identifying potential drug targets, and developing predictive models for treatment response and disease progression. '48. Fibrosis progression in chronic liver diseases is a major risk factor for hepatocellular carcinoma, and novel antifibrotic agents are being investigated in clinical trials, aiming to slow or reverse fibrosis and thereby reduce the incidence of HCC. '49. Radiologic assessment of treatment response in hepatocellular carcinoma, particularly following locoregional or systemic therapies, is often performed using modified RECIST criteria, which consider changes in viable tumor contrast enhancement rather than just size. '50. The study of gut microbiota and its influence on liver health and disease progression, including hepatocellular carcinoma, is a growing field, as alterations in gut bacterial composition may affect liver inflammation, metabolism, and cancer risk. '1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. '2. Understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. '3. The diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. '4. Medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. '5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. '6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. '7. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. '8. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. 9. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. 11. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. 24. The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. '25. Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. '26. The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. '27. Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. '28. The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. '29. Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. '30. Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. '31. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. '32. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. '33. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. '34. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. '35. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. '36. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. '37. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. '38. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. '39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. 40. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. 41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. 42. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. 43. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. 44. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. 45. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. 46. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. 47. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. 48. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. 49. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. 50. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. 1. Cardiac arrhythmia refers to any disruption in the heart's normal rhythm, commonly resulting from chaotic electrical impulses within the heart muscle, which can lead to various symptoms such as palpitations, dizziness, syncope, or in severe cases, sudden cardiac death, emphasizing the importance of comprehensive cardiovascular examination and electrocardiogram (ECG) evaluation as part of the diagnostic process. 2. The pathophysiology of cardiac arrhythmias often involves alterations in ion channel function, which can be attributed to genetic mutations, myocardial ischemia, or structural heart changes, leading to the development of conditions like atrial fibrillation, ventricular tachycardia, and other conduction disorders that necessitate tailored therapeutic strategies to mitigate risks and manage symptoms. 3. Atrial fibrillation, the most prevalent form of cardiac arrhythmia, is characterized by rapid, irregular beating of the atrial chambers and can increase the risk of stroke and heart failure, making anticoagulation therapy an essential component of management alongside rate control medications like beta blockers or calcium channel blockers to improve patient outcomes. 4. Ventricular fibrillation is a life-threatening cardiac arrhythmia caused by disorganized electrical activity in the ventricles, leading to cardiac arrest if not promptly treated with immediate defibrillation and advanced cardiac life support measures, underscoring the critical need for emergency response and intervention. 5. The diagnostic approach for cardiac arrhythmias often involves Holter monitoring or event monitors, which provide continuous ECG recordings over 24 hours or longer, enabling clinicians to capture transient episodes of arrhythmia, correlating them with symptoms and aiding in the accurate identification of both the type and cause of arrhythmia. 6. Supraventricular tachycardia, SVT, is a common arrhythmia originating above the ventricles, characterized by an abnormally fast heartbeat, often exceeding 150 beats per minute, which can be managed acutely with vagal maneuvers, adenosine, or, in recurrent cases, catheter ablation, highlighting the importance of individualized patient care. 7. Long QT syndrome is a potentially dangerous arrhythmia disorder that prolongs ventricular repolarization, predisposing individuals to torsades de pointes, a form of polymorphic ventricular tachycardia, necessitating regular monitoring, avoidance of QT prolonging medications, and possibly the use of beta blockers or implantable cardioverter defibrillators, ICDs, in high-risk patients. 8. Bradycardia is an arrhythmic condition defined by a heart rate of fewer than 60 beats per minute, which can be physiological or pathological, requiring thorough assessment to determine if management with pacemaker implantation is required to prevent symptoms like fatigue, dizziness, or syncope associated with insufficient cardiac output. 9. Wolff-Parkinson-White syndrome is an arrhythmia condition caused by an accessory pathway that allows electrical impulses to bypass the heart's normal conduction system, leading to episodes of tachycardia that can be effectively treated with catheter ablation to prevent recurrence and improve quality of life. 10. Premature ventricular contractions, PVCs, are early heartbeats originating in the ventricles, and while often benign, frequent PVCs should be evaluated with an electrocardiogram and echocardiogram to rule out underlying structural heart disease. Beta blockers may be considered if symptomatic or if there is an associated cardiomyopathy. 11. Carotid sinus hypersensitivity, a cause of bradyarrhythmia, results from exaggerated response to stimulation of the carotid sinus, leading to episodes of syncope or presyncope that can impact quality of life and require head-up tilt testing for diagnosis, with dual-chamber pacemaker implantation being an effective treatment for recurrent symptomatic cases. 12. The ventricular tachycardia storm, characterized by frequent episodes of ventricular tachycardia requiring repeated interventions within a short period, is a critical arrhythmic emergency demanding aggressive treatment, including antiarrhythmic drugs, catheter ablation, and in some cases, sympathetic blockade, highlighting the importance of prompt therapy to prevent cardiomyopathy. 13. Sinus tachycardia, a common arrhythmic condition where the heart rate exceeds 100 beats per minute, can result from physiological responses to exercise or stress, but requires assessment to exclude underlying cardiac or systemic pathology, with management focusing on treating the root causes, reducing anxiety, and avoiding stimulants. 14. Atrioventricular nodal reentrant tachycardia, AVNRT, is a type of reentrant supraventricular tachycardia that can cause palpitations and lightheadedness, often diagnosed through characteristic ECG findings and effectively managed with the use of adenosine, rate-controlling medications, or radiofrequency catheter ablation for definitive treatment. 15. Atrial flutter, an arrhythmia characterized by a rapid and regular atrial rate, typically presents with a sawtooth pattern on ECG and can lead to rapid ventricular responses, necessitating rate control or rhythm control strategies similar to those used in atrial fibrillation, including electrical cardioversion, antiarrhythmic drugs, and potentially catheter ablation. 16. The Brugada syndrome is an inherited arrhythmic disorder with a distinct ECG pattern predisposing individuals to sudden cardiac death, particularly at rest or during sleep, where risk stratification is critical, and patients may benefit from ICD implantation to prevent life-threatening arrhythmic events despite being often asymptomatic. 17. Junctional rhythm refers to an arrhythmic condition where the heart's electrical activity originates in or near the atrioventricular node, leading to slower heart rates and occasionally retrograde atrial conduction, necessitating evaluation for causes such as digitalis toxicity or intrinsic conduction system disease with management tailored to the underlying etiology. (18) The multifocal atrial tachycardia, typically associated with underlying lung disease or metabolic disturbances, presents as an irregular rhythm with at least 3 different P-wave morphologies on ECG, requiring a multifaceted approach to treatment that includes correction of underlying conditions and the cautious use of rate-controlling agents. (19) Antiarrhythmic drugs play a pivotal role in the management of various arrhythmias, classified into different classes based on their electrophysiological properties, necessitating careful selection and monitoring due to potential proarrhythmic effects and interactions with other medications, emphasizing their use in conjunction with non-pharmacological methods when appropriate. 20. AV block, or atrioventricular block, is a type of heart block where the electrical conduction between the atria and ventricles is impaired, which can range from first-degree blocks with delayed conduction to third-degree blocks with complete dissociation, requiring pacemaker intervention in symptomatic high-grade blocks to maintain adequate hemodynamic stability. 21. Sick sinus syndrome, involving dysfunction of the sinus node, can result in episodes of bradycardia, sinus arrest, or alternating bradycardia-tachycardia syndrome, with symptomatic patients often requiring the implantation of a permanent pacemaker to alleviate symptoms and improve heart rate responses during daily activities. 22. Catecholaminergic polymorphic ventricular tachycardia is an inherited condition where adrenergic stress can trigger life-threatening arrhythmias in structurally normal hearts, mandating a combination of lifestyle modifications, beta blockers for arrhythmia prevention, and ICDs for high-risk patients to prevent sudden cardiac events during emotional or physical stress. 23. Digoxin, a cardiac glycoside used in the management of certain arrhythmias and heart failure, works by increasing vagal tone and improving heart contractility. However, it demands careful dose adjustment and monitoring to avoid toxicity characterized by gastrointestinal disturbances, visual changes, and potentially life-threatening arrhythmias due to its narrow therapeutic window. 24. Transvenous pacemaker insertion is a standard intervention for symptomatic bradyarrhythmias, involving the placement of pacing electrodes through the venous system to the heart, providing reliable electrical stimulation to correct slow heart rates, with advancements in technology offering options for dual-chamber or even leadless pacemakers tailored to patient-specific needs. 25. Idiopathic ventricular fibrillation refers to VF occurring in the absence of identifiable structural heart disease or known trigger factors, necessitating comprehensive evaluation to exclude reversible causes or genetic predispositions, with ICD therapy often being the cornerstone of prevention against recurrence and sudden cardiac death. 26. The tilt table test is a diagnostic tool used to evaluate unexplained episodes of syncope or presyncope, designed to provoke symptoms through postural changes, allowing assessment of autonomic function and vasoactive responses, with results guiding treatment options like lifestyle changes, medical therapies, or pacemaker implantation, particularly in neurally mediated syncope. 27. Atrial tachycardia, resulting from an abnormal focus of impulse generation outside the sinus node, often appears as regular narrow complex tachycardia on ECG, and management may involve pharmacological agents like calcium channel blockers or beta blockers and consider non-pharmacological approaches like catheter ablation for long-term control. 28. Amiodarone is a broad-spectrum antiarrhythmic agent effective against a wide range of arrhythmias, including atrial fibrillation and ventricular tachycardia, although its use may be limited by side effects such as thyroid dysfunction, pulmonary fibrosis, and liver toxicity, demanding vigilant long-term monitoring and consideration of risk-benefit balance. AVRT, or atrioventricular reciprocating tachycardia, commonly results from an accessory pathway like in Wolff-Parkinson-White syndrome, presenting on ECG with delta waves, and treatment options include vagal maneuvers, pharmacological interventions, or catheter ablation to sever the accessory pathway for definitive resolution of the arrhythmia. 30. The Maze procedure, a surgical intervention for atrial fibrillation, involves creating a series of strategically placed incisions or ablations in the atria to disrupt reentrant circuits and restore sinus rhythm, typically reserved for patients undergoing cardiac surgery. For other indications or those who have failed catheter-based therapies. 31. Beta blockers, often used in the management of various arrhythmias, work by blocking beta-adrenergic receptors, reducing heart rate, and decreasing myocardial oxygen demand, proving effective in rate control for atrial fibrillation and preventing recurrent ventricular arrhythmias, with the selection of specific agents guided by patient comorbidities and cardiovascular risk. 32. Lown-Ganon-Levine syndrome is characterized by a short PR interval without the presence of delta waves on the ECG, resulting from accelerated atrioventricular conduction, with management focusing on symptom alleviation through the use of medications like verapamil or catheter ablation, tailored to individual patient presentation and pathway determination. 3. Electrolyte imbalances, such as hypokalemia and hypomagnesemia, are common reversible causes of arrhythmias, leading to increased cardiac excitability and the risk of ventricular tachyarrhythmias, necessitating prompt correction of deficiencies through oral or intravenous supplementation alongside continuous cardiac monitoring for patients at risk. 34. The physiological basis of reentry arrhythmias, a frequent mechanism in conditions like atrial flutter and ventricular tachycardia, involves the presence of anatomical or functional circuit pathways that allow a reentrant current of electrical activity, perpetuating tachycardia, and is typically managed through targeted ablation therapy to interrupt these circuits. 35. Sinus node dysfunction is often implicated in nocturnal bradycardia, resulting from an interplay of autonomic factors and sleep-disordered breathing, highlighting the importance of assessing for conditions like obstructive sleep apnea, which may exacerbate this arrhythmia, with therapeutic approaches including positive airway pressure therapy and pacemaker considerations for persistent symptoms. 36. In atrial fibrillation management, novel oral anticoagulants, NOACs, play a key role in stroke prevention, offering alternatives to traditional warfarin therapy free from frequent INR monitoring, with choices of dabigatran, rivaroxaban, apixaban, or edoxaban being driven by patient renal function, bleeding risks, and individual patient preferences. 37. Familial atrial fibrillation, a heritable form of arrhythmia, highlights the role of genetic predisposition in arrhythmogenesis, necessitating genetic counseling and consideration of vigilance in family members, with treatment strategies paralleling those of sporadic atrial fibrillation, emphasizing the balance of rate versus rhythm control approaches. 38. The implantable cardioverter defibrillator, ICD, remains a cornerstone in preventing sudden cardiac death in high-risk population segments like those with ischemic cardiomyopathy or inherited channelopathies, capable of delivering life-saving shocks or antitachycardia pacing to terminate ventricular tachyarrhythmias and restore sinus rhythm. 39. Premature atrial contractions, PACs, frequent ectopic beats originating in the atria, are usually benign but can serve as a precursor to more significant arrhythmias like atrial fibrillation, with lifestyle modifications being advised if symptomatic and consideration of beta blockers or calcium channel blockers for suppression. The vagal maneuvers, simple physical techniques aimed at stimulating the vagus nerve, can induce reflexive slowing of heart rate, proving advantageous in terminating reentrant arrhythmias like supraventricular tachycardia, and should be included in initial therapeutic instruction for patients at risk of acute episodes alongside medical therapies. 41. QT interval prolongation, an ECG finding indicative of delayed cardiac repolarization, poses a significant arrhythmia risk for developing torsades de pointes, requiring careful evaluation and avoidance of QT prolonging substances, with therapeutic correction focusing on withdrawal of offending agents, electrolyte repletion, or use of specific antiarrhythmics. 42. The Holter monitor, a portable device providing continuous ECG recording over a day or more, plays a vital role in uncovering paroxysmal arrhythmias difficult to detect with standard examinations, guiding diagnosis and therapeutic decisions by correlating symptomatic episodes with underlying cardiac rhythm abnormalities. 43. Dopamine receptor agonists, sometimes involved in the management of Parkinson's disease or prolactinomas, carry the potential for inducing arrhythmic events through disturbance of sympathetic and parasympathetic balance, underscoring the need for baseline cardiac assessment and ongoing ECG monitoring to prevent adverse cardiac outcomes. 44. Accessory pathways in the heart predispose to arrhythmias by allowing electrical impulses to bypass normal conduction, creating scenarios like Wolff-Parkinson-White syndrome, with catheter ablation offering definitive management by selectively destroying the pathway, leading to permanent resolution and prevention of recurrence. 45. Recurrence of atrial fibrillation post-cardioversion is common and often necessitates the use of antiarrhythmic medications for rhythm maintenance, underscoring the need for consideration of rate control, lifestyle interventions, and assessment of secondary causes to sustain sinus rhythm and improve patient quality of life. 46. Ventricular premature beats, VPBs, or extrasystoles are isolated electrical impulses originating in the ventricles, commonly detected on routine ECGs, and while often benign, warrant evaluation for possible underlying heart disease in symptomatic patients or those with frequent VPBs, utilizing treatment strategies like beta blockers if deemed necessary. 47. The electrophysiological study, EPS, serves as a diagnostic tool for elucidating complex arrhythmia mechanisms, guiding therapeutic interventions by mapping cardiac electrical activity, and determining the exact location of aberrant pathways, forming a basis for decisions regarding catheter ablation or device therapy in refractory cases. 48. Respiratory sinus arrhythmia, a benign variation of heart rate with breathing, reflects the normal interaction between the respiratory cycle and the parasympathetic nervous system, often more pronounced in younger individuals and athletes, representing a physiological, non-pathological finding with no need for clinical intervention. 49. QRS widening on ECG signifies impaired conduction through the ventricles, seen commonly in bundle branch blocks, electrolyte imbalances, or drug effects, requiring assessment to determine if chronic or acute changes necessitate further cardiac workup, with specific treatment guided by underlying etiology and associated symptoms. 50. The Has-Bled score is a clinical tool used to estimate bleeding risk in patients with atrial fibrillation undergoing anticoagulation therapy, aiding in individualized risk assessment and optimization of therapeutic strategies, balancing the benefits of stroke mitigation against the potential for major bleeding complications. 1. Hepatitis C, a viral infection primarily affecting the liver, is caused by the hepatitis C virus, HCV, and can progress silently over decades, leading to chronic liver disease in approximately 50 to 80% of infected individuals due to the virus's ability to evade immune detection and establish a persistent infection. 2. The hepatitis C virus is predominantly transmitted through blood-to-blood contact, with intravenous drug use being the most common route, and despite substantial reductions in transmission rates thanks to blood screening, unsafe medical practices in some parts of the world remain a significant risk factor for new infections. 3. Diagnosis of hepatitis C involves both serological and molecular tests, where an initial enzyme immunoassay detects antibodies to the virus, followed by a confirmatory PCR test to measure the viral load and assess if the infection is active and requires treatment intervention. 4. Chronic hepatitis C infection can lead to complications such as cirrhosis and hepatocellular carcinoma due to ongoing liver inflammation and fibrosis, making regular screening and monitoring essential for those at risk or diagnosed, to ensure timely intervention and reduce the risk of severe liver damage. 5. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering over 90% cure rates with oral medications that target different stages of the viral life cycle, providing shorter, more effective treatment courses with fewer side effects compared to older interferon-based therapies. 6. Hepatitis C exhibits 6 different genotypes, with genotype 1 being the most prevalent worldwide, and identifying the genotype is crucial in the tailoring of antiviral treatment plans that consider genotype-specific efficacy, optimizing therapeutic outcomes for the patient. 7. The liver injury from hepatitis C is characterized by immune-mediated mechanisms where the virus persists within hepatocytes, evading immunity and creating an inflammatory state that drives progressive liver damage and potential fibrosis, ultimately affecting liver function and health. 8. Liver fibrosis staging is essential in managing hepatitis C, where non-invasive tests like elastography can assess liver stiffness, reducing the need for liver biopsies and helping to guide treatment decisions and predict progression to more severe liver disease, such as cirrhosis. 9. Hepatitis C is not only a liver disease but also has systemic implications, with extrahepatic manifestations including type 2 diabetes, glomerulonephritis, and lymphoma, affecting multiple organ systems and significantly impacting the quality of life and prognosis of affected patients. 10. The natural history of chronic hepatitis C infection varies greatly among individuals, with factors such as host genetics, viral genotype, and environmental influences like alcohol consumption playing critical roles in disease progression and liver damage severity over time. 11. Horizontal transmission of hepatitis C can occur through sexual contact, though it is less efficient than other routes, making it essential for patients and partners to take preventative measures, especially those with high-risk behaviors that increase exposure likelihood. 12. Effective public health strategies for hepatitis C control focus on harm reduction methods like needle exchange programs, safe blood supply practices, and awareness campaigns that aim to reduce transmission and promote early detection and treatment in high-risk populations. 13. Hepatitis C infection can lead to an alteration in liver enzyme levels, commonly presenting as elevated aminotransferases on routine laboratory tests, which can trigger further investigation into the viral status when considered in conjunction with appropriate clinical risk factors. 14. The introduction of universal hepatitis C screening guidelines for adults born between 1945 and 1965 significantly enhanced early detection of chronic infections within this cohort, who are believed to be at higher risk due to past healthcare practices that may have exposed them to the virus. 15. While there is currently no vaccine for hepatitis C, ongoing research is focused on developing strategies to induce robust immune responses capable of protective immunity, with the hope of one day preventing HCV infections and reducing the global burden of this liver disease. In patients with chronic hepatitis C, co-infections with other blood-borne viruses, such as HIV or hepatitis B, can exacerbate liver injury, complicating management, and necessitating careful coordination of treatment regimens to address the interplay between these infections. 17. Reinfection with hepatitis C is a concern, particularly in high-risk populations, as past infection or clearance does not confer immunity, underlining the importance of continuous preventive efforts even after successful treatment, to avoid relapse or new infections. 18. Steatosis, or fatty liver, is a common histological feature in chronic hepatitis C, particularly with genotype 3 infections, and contributes to liver injury and progression of fibrosis by increasing hepatic inflammation and oxidative stress within the liver tissue. 19. Autoimmune phenomena are associated with hepatitis C, as the virus can trigger immune dysregulation, leading to conditions such as mixed cryoglobulinemia, which presents with a triad of purpura, arthralgia, and weakness, requiring integrated management strategies. 20. Despite universal precautions, occupational exposure to hepatitis C remains a calculated risk for healthcare workers, especially in situations involving needle stick injuries or direct contact with blood, highlighting the importance of post-exposure protocols and early intervention. 21. FibroScan is a valuable non-invasive diagnostic tool in hepatitis C management, using transient elastography to provide an accurate measure of liver stiffness, facilitating the assessment of fibrosis without the need for invasive biopsies, which can be costly and painful. 22. In hepatitis C patients, alcohol consumption accelerates liver damage, promoting fibrosis and increasing the risk of cirrhosis, making abstinence from alcohol a critical recommendation for lifestyle modification to prevent complications and improve treatment outcomes. 23. Hepatitis C and pregnancy require special attention, as vertical transmission rates during childbirth are approximately 5%, with risk enhanced by high viral loads, necessitating strategies to minimize this transmission risk and ensure prompt evaluation of newborns. 24. Chronic hepatitis C has been linked to neurocognitive dysfunction, affecting memory, concentration, and mood, a condition known as hepatic encephalopathy, which can occur even in the absence of cirrhosis, impacting daily function and quality of life for patients. 25. Combination therapies for hepatitis C that utilize multiple direct-acting antiviral agents are designed to prevent viral resistance by targeting different viral proteins, ensuring a higher barrier to resistance and increasing the likelihood of treatment success. 26. The presence of hepatitis C antibodies in laboratory tests indicates exposure to the virus, but confirmatory RNA testing is required to distinguish between past, resolved infections and active infections that necessitate treatment to prevent liver damage. 27. The discovery of the hepatitis C virus in the late 1980s, a triumph of molecular biology, closed a historical gap in understanding non-A, non-B hepatitis, catalyzing research and development of diagnostics, treatment options, and a clearer understanding of transmission. 28. Chronic hepatitis C impacts glucose metabolism, increasing the risk of insulin resistance and development of type 2 diabetes, which contributes to liver fibrosis and further complicates the management of liver disease in affected individuals. 29. The common fibrosis 4, FIB4, score, calculated from routine lab data such as age, liver enzymes, and platelet count, serves as a useful and widely accessible tool for assessing liver fibrosis in hepatitis C infected individuals, guiding clinical decision-making. Hepatitis C co-infection with HIV poses unique challenges, as both viruses share transmission pathways and exacerbate one another's effects on liver disease progression, requiring a cohesive treatment approach to address both infections effectively. Successful eradication of hepatitis C with antiviral therapy has been shown to reduce the incidence of liver-related complications and improve survival rates, underscoring the importance of achieving a sustained virologic response as the primary goal of treatment. Hepatitis C-associated mixed cryoglobulinemia can manifest as vasculitis, impacting the skin, kidneys, and peripheral nerves, driven by immune complexes and necessitating treatment that addresses both the viral cause and symptomatic relief of vasculitic symptoms. Identifying liver histopathology, such as lymphoid aggregates or bile duct injury alongside steatosis and inflammation, helps refine the diagnosis of hepatitis C and its staging, offering critical insights into the degree of liver damage and guiding therapeutic strategies. Hepatitis C genotype 3 confers an increased risk of hepatic steatosis and faster progression to cirrhosis compared to other genotypes, leading to tailored treatment regimens and vigilant monitoring for this subgroup to prevent rapid liver deterioration. The global distribution of hepatitis C genotypes reflects historical and geographical patterns of human migration and behavior, influencing research strategies that focus on region-specific genotypic prevalence to optimize treatment efficacy and accessibility. The advent of DAAs has changed the landscape of hepatitis C epidemiology, allowing for treatment plans that accommodate diverse populations with varying healthcare access, aiming to eliminate diagnostic and therapeutic disparities and reduce the overall disease burden. In hepatitis C, advanced liver fibrosis correlates with increased risk of hepatocellular carcinoma, warranting surveillance strategies that include regular imaging and laboratory assessments post-therapy to catch any malignancy early and manage it effectively. Host genetic factors, such as polymorphisms in the IL-2AB gene, influence treatment response and spontaneous clearance rates of hepatitis C, providing personalized risk assessment and therapy customization that predict patient-specific therapeutic outcomes. Chronic hepatitis C has complex effects on lipid metabolism, often resulting in dyslipidemia, which may contribute to cardiovascular risk profiles and necessitate a comprehensive approach to managing not only liver health but also associated systemic comorbidities. Hepatitis C-related hepatic inflammation and fibrosis may be modulated by certain cytokines, such as TGF-beta, which promotes fibroblast activation and scar formation in the liver, offering potential targets for antifibrotic therapies under exploration. Socioeconomic factors significantly impact hepatitis C outcomes, as populations with limited healthcare access or education may experience delayed diagnoses and inconsistent treatment adherence, challenging public health efforts to control and eliminate the virus. The hepatitis C virus's ability to mutate rapidly aids its evasion of host immune responses, contributing to chronic infection and highlighting the need for multifaceted therapeutic approaches that target multiple viral elements to achieve sustained clearance. While liver transplantation may be necessary for end-stage liver disease resulting from hepatitis C, recurrence of the virus in the new liver is common without successful viral clearance pre or post-transplantation, informing the timing and strategies of antiviral regimens. Understanding the natural reservoirs and evolutionary origins of hepatitis C involves studying related hepativiruses in non-human primates, which may offer insights into viral transmission dynamics and inform future approaches to vaccine development and public health strategies. The role of cellular apoptosis in hepatitis C-related liver injury involves both hepatocyte and immune cell pathways, emphasizing a complex interplay where therapeutic strategies aim to limit cell death and preserve liver health by mitigating ongoing immune-driven damage. Hepatitis C can mediate changes in the gut-liver axis, impacting microbiome balance and cytokine release that contribute to systemic inflammation, necessitating strategies that consider gut health in the holistic management of chronic liver diseases. Advances in biomarkers for hepatitis C have facilitated the classification of liver disease severity and response to treatment, enhancing patient management by allowing more personalized approaches to therapy based on dynamic, accessible, and non-invasive measurements. With hepatitis C eradication being achievable in many patients, follow-up care remains pivotal to ensuring long-term health, as previously infected individuals may still face residual risks of liver disease complications or comorbid conditions that require ongoing monitoring. The psychosocial aspects of living with hepatitis C include stigma and mental health challenges, underscoring the necessity of comprehensive care models that incorporate psychological support alongside medical treatment to support patient resilience and enhance quality of life. The development of pangenotypic antivirals for hepatitis C has brought forth a new era of simplified treatment regimens that transcend genotypic boundaries, offering therapy options with wide-ranging efficacy across all genotypes and reducing the barriers to successful viral eradication. Colon cancer, also known as colorectal cancer, is characterized by malignant growths that arise in the lining of the large intestine, initiated by genetic mutations and environmental factors, progressing in a multi-step sequence from benign polyps to invasive cancer, and is heavily influenced by lifestyle factors such as diet and physical activity. The clinical presentation of colon cancer commonly includes symptoms like rectal bleeding, changes in bowel habits such as diarrhea or constipation, unintended weight loss, and persistent abdominal discomfort, though early-stage colon cancer is often asymptomatic, highlighting the importance of regular screening for early detection. One vital innovation in colon cancer screening is the fecal immunochemical test, FIT, a non-invasive test that detects hidden blood and stool using antibodies specific to human hemoglobin, offering a highly sensitive option for annual screening that enhances early detection and reduces mortality significantly. The pathophysiology of colon cancer is deeply rooted in the adenoma-carcinoma sequence, where benign adenomatous polyps undergo genetic alterations, such as APC, KRAS, and P53 mutations, leading to dysplastic changes in progression to carcinoma, underscoring the importance of polypectomy in interrupting this sequence. Surgical resection remains the cornerstone of curative treatment for localized colon cancer, with the extent of surgery tailored to the cancer's location and stage. Minimally invasive techniques like laparoscopic or robotic surgery are increasingly used for their benefits in reducing postoperative recovery time and complications. Adjuvant chemotherapy, particularly with fluoropyrimidine such as 5-fluorouracil in combination with oxaliplatin, is indicated for stage 3 colon cancer following surgery to eliminate microscopic remnants of cancer cells, decreasing recurrence risk and improving survival outcomes, although it is generally not recommended in stage 1 cases. Seven. Recent breakthroughs in genetic testing have unveiled the role of mismatch repair, MMR, gene mutations and microsatellite instability, MSI, in colon cancer, leading to the implementation of universal MSI testing in patients with newly diagnosed colon cancer to guide immunotherapy decisions. 8. Targeted therapies have revolutionized the management of metastatic colon cancer, particularly monoclonal antibodies like bevacizumab, which inhibits vascular endothelial growth factor, VEGF, and thus tumor angiogenesis, and cetuximab, which targets the epidermal growth factor receptor, EGFR, depending on the tumor's ROS mutation status. 9. Immunotherapy has emerged as a pivotal treatment strategy for mismatch repair deficient colon cancer, particularly using immune checkpoint inhibitors such as pembrolizumab, which enhance the host immune response against tumor cells and are primarily useful in patients with metastatic and unresectable disease. 10. Colonoscopy is the gold standard in colon cancer screening, allowing for direct visualization and removal of precancerous polyps, and while sedation is typically employed to enhance patient comfort, advances such as virtual colonoscopy using CT imaging are being explored for those who cannot undergo conventional techniques. A groundbreaking approach in the prevention of colon cancer involves the use of aspirin, which has been shown through studies such as the CAP, Colorectal Adenoma Carcinoma Prevention Program, trials, to reduce adenoma formation and consequently, cancer incidence in individuals with hereditary cancer syndromes. Surveillance colonoscopy protocols post-polypectomy or cancer resection are critical and are tailored based on the initial findings, such as polyp number, size, and histological characteristics, to monitor for new polyp formation or recurrence of cancer, showing the dynamic nature of the surveillance landscape. 13. A lesser-known presentation of colon cancer is the occurrence of paraneoplastic syndromes, where the cancer produces substances leading to remote effects such as Trousseau syndrome, characterized by unexplained venous thrombosis, emphasizing the need to consider malignancy in atypical clinical presentations. 14. Genetic syndromes such as Lynch syndrome, hereditary non-polyposis colorectal cancer, characterized by germline mutations in MMR genes, predispose individuals to early-onset colon cancer, stressing the importance of genetic counseling and testing for at-risk families to implement appropriate surveillance strategies. Emerging data suggests the pivotal role of the gut microbiome in colon cancer development, where dysbiosis and the presence of certain bacterial species such as Fusobacterium nucleatum can enhance tumorigenesis by creating a pro-inflammatory environment, offering potential new avenues for prevention and treatment. 16. A unique manifestation of advanced colon cancer is the formation of malignant bowel obstruction, where the tumor obstructs intestinal flow, requiring urgent intervention that may involve surgical resection, endoscopic stenting, or decompression via nasogastric tubes to alleviate symptoms and improve patient quality of life. 17. Tumor markers such as carcinoembryonic antigen, C, play a critical role in monitoring colon cancer treatment response and recurrence, especially in metastatic cases, although their nonspecific nature makes them less valuable for initial diagnosis, highlighting the nuance in biomarker utilization. 18. A significant innovation in personalized medicine for colon cancer involves the use of circulating tumor DNA, ctDNA, as a non-invasive biomarker that has shown promise in identifying minimal residual disease, guiding adjuvant therapy decisions, and providing real-time insights into tumor dynamics and resistance mechanisms. (19) Occupational risk factors for colon cancer, such as sedentary work environments and prolonged sitting, have been identified as contributing to increased risk, emphasizing the need for public health interventions that encourage regular physical activity as a preventive measure alongside dietary modifications. (20) In a novel approach to colon cancer treatment, radiofrequency ablation and cryoablation are being used selectively to target and destroy hepatic metastasis, demonstrating the expansion of local ablative technologies and providing additional options for patients with limited metastatic disease. (21) Advances in imaging, such as diffusion-weighted MRI, have improved the preoperative assessment of colon cancer by offering superior soft tissue contrast, enabling more accurate staging and involvement of surrounding structures, which directly influences surgical planning and prognostication. (22) Recognizing the impact of diet and nutrition on colon cancer, studies indicate that high fiber intake, along with diets rich in fruits, vegetables, and whole grains, contributes to a lower risk of cancer development through mechanisms involving fecal bulk increase and reduction of intestinal transit time. (23) Quality of life assessments are integral to the management of colon cancer, where tools like the EORTC-QLQC30 questionnaire are employed to evaluate the patient's well-being and functional status, ensuring holistic care that extends beyond mere survival to encompass physical, emotional, and social health. (24) Colon cancer incidence has demonstrated a concerning rise in younger adults, under the age of 50, attributed to a combination of lifestyle factors and genetic predispositions, prompting a re-evaluation of screening guidelines to potentially lower the age at which screening initiates for average-risk individuals. (25) The role of inflammation in colon cancer is highlighted by conditions such as ulcerative colitis and Crohn's disease, where chronic inflammation induces dysplastic changes, necessitating a rigorous surveillance program and prophylactic colectomy considerations to mitigate cancer risk in these high-risk populations. (26) Epigenetic alterations, such as DNA methylation and histone modification, contribute significantly to colon cancer pathogenesis by silencing tumor suppressor genes, representing potential targets for novel therapeutic interventions aimed at reversing these changes to restore normal cellular function. (27) Herbal medicines and dietary supplements are being explored for their potential chemopreventive properties in colon cancer, with compounds like curcumin and resveratrol showing promising results in preclinical models, although clinical validation is required to confirm their efficacy and safety. (28) Disparities in colon cancer outcomes have been observed among different racial and socioeconomic groups, likely due to variations in access to healthcare, screening, and treatment options, highlighting the urgent need for equitable health policies and targeted interventions to bridge these gaps. (29) Integrated care models involving multidisciplinary teams have become a cornerstone in colon cancer treatment, ensuring that patients receive coordinated and comprehensive care that spans surgical, medical, and supportive services, optimizing treatment outcomes and patient satisfaction. (30) The ability of colon cancer to metastasize to distant organs such as the liver and lungs chiefly stems from its adaptation to evade immune surveillance and spread through the lymphatic and vascular systems, presenting a major challenge that necessitates systemic therapy alongside local control measures. 31. Increasing evidence suggests that vitamin D, owing to its role in cell growth regulation and immune function, may play a protective role in preventing colon cancer, with ongoing research assessing its supplementation as a potential intervention to reduce cancer risk in deficiency states. 32. Patients with colon cancer have shown improved prognostic outcomes with regular follow-up and implementation of survivorship care plans, which include adherence to surveillance protocols, healthy lifestyle adoption, and management of long-term treatment effects, according to guidelines from oncology societies. 3. Advanced genomic profiling techniques, such as next-generation sequencing, have unveiled the complex mutational landscape of colon cancer, identifying actionable mutations and resistance mechanisms, paving the way for precision oncology strategies tailored to each patient's unique tumor profile. 34. The implementation of enhanced recovery after surgery, ERAS, protocols in colon cancer surgery has been instrumental in reducing hospital stay lengths and postoperative complications by emphasizing early mobilization, optimal nutrition, and multimodal analgesia, reflecting a shift towards patient-centered surgical pathways. 35. Lynch syndrome-associated colon cancers typically manifest a distinct pathological phenotype, characterized by poor differentiation, lymphocytic infiltration, and mucin production, contributing to differential prognosis and therapy response compared to sporadic colon cancers, underscoring the importance of molecular classification. 36. Circulating microRNAs, small non-coding RNA molecules, are emerging as promising biomarkers for early detection, prognosis, and monitoring therapeutic response in colon cancer, with their stability in bodily fluids enabling non-invasive testing advancements that could significantly transform current diagnostic practices. 37. An intriguing area of research is the role of ferroptosis, a type of programmed cell death characterized by iron-dependent lipid peroxidation, in colon cancer, offering a potential target for novel treatments aimed at inducing cancer cell death through this unique pathway. 38. The risk of metachronous colon cancer necessitates vigilant surveillance in patients with a history of colon cancer resection, as the development of new primary cancers in the remaining intestine remains a possibility, and adherence to tailored follow-up schedules is essential for early detection and intervention. 39. Nutrigenomics, the study of gene-diet interactions, is gaining traction in colon cancer research, where genetic variants may affect individual responses to dietary components, potentially informing personalized dietary recommendations that could mitigate cancer risk or progression. 40. Radiotherapy, although not a primary treatment for colon cancer due to the radiosensitivity of surrounding tissues, can be utilized in specific scenarios such as in cases of local recurrence or for palliation of symptoms, particularly when surgery and chemotherapy are not feasible options. 41. Bowel function and quality of life after colon cancer surgery are significant concerns, with some patients experiencing altered bowel habits and fecal incontinence, necessitating preoperative counseling, pelvic floor rehabilitation, and dietary interventions to address these complications effectively. 42. The discovery of cell-free DNA, released from apoptotic or necrotic tumor cells into the bloodstream, has garnered attention as an invaluable tool for non-invasive surveillance and early detection of recurrence in colon cancer patients undergoing surveillance post-treatment. 43. Advances in three-dimensional, 3D, printing technologies have found applications in colon cancer surgical planning, allowing for the creation of patient-specific anatomical models that aid in complex resection strategies, enhancing preoperative assessment and intraoperative guidance. 44. A novel therapeutic avenue being investigated involves monoclonal antibodies targeting claudins, a family of proteins overexpressed in colon cancer that contribute to tumor invasiveness and heterogeneity, showing potential in preclinical studies for slowing disease progression and enhancing standard treatment. 45. Colon cancer prevention initiatives have increasingly targeted modifiable risk factors such as obesity, which is associated with chronic inflammation and insulin resistance, with interventions promoting healthy weight management showing promise in reducing incidence rates and improving overall population health outcomes. 46. Emotional and psychological support for colon cancer patients, often overshadowed by the focus on physical treatment, plays a vital role in comprehensive care, as demonstrated in studies highlighting improved treatment adherence and quality of life when mental health resources are integrated into oncology care pathways. 47. Explorations into the role of long non-coding RNAs, LNCRNAs, in colon cancer have revealed their influence on gene expression regulation and tumor progression, offering a rich target landscape for potential therapeutic interventions aimed at modulating these non-coding regions to impede cancer development. 48. Prehabilitation programs, focused on optimizing physical and nutritional status before colon cancer surgery, have emerged as an innovative approach to improve postoperative outcomes, reducing complications, and enhancing recovery times, in line with trends towards enhancing patient resilience. 49. Colon cancer survival outcomes have been positively impacted by the adoption of sentinel lymph node mapping, a surgical technique initially used in other malignancies, which aids in precise staging and the determination of lymph node involvement, aiding in treatment decision-making and prognostication. 50. Recent advances in organoid technology, allowing cultivation of patient-derived tumor cells in 3D cultures, have provided a powerful platform for personalized medicine in colon cancer, enabling drug testing, genetic studies, and understanding resistance mechanisms on patient-specific tumor models. 1. Non-alcoholic fatty liver disease, NAFLD, the hepatic manifestation of metabolic syndrome, is characterized by excessive fat accumulation in liver cells, often due to insulin resistance, and is the most common cause of chronic liver disease worldwide, affecting nearly 1 billion individuals and potentially leading to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, or hepatocellular carcinoma if left unchecked over the years. 2. The pathophysiology of fatty liver disease involves a two-hit hypothesis where the first hit is the accumulation of triglycerides in the hepatocytes, creating a state vulnerable to lipotoxicity, and the second hit involves oxidative stress, cytokines, and mitochondrial dysfunction that progress hepatic inflammation and fibrosis, emphasizing the complexity and multifactorial nature of this condition. 3. Magnetic resonance imaging, MRI, proton density fat fraction, PDFF, is emerging as a non-invasive gold standard for quantifying hepatic steatosis in NAFLD, providing a comprehensive assessment of liver fat content that is more precise than ultrasound and CT and lacking the invasiveness and risks associated with liver biopsy, thus contributing to better disease management and monitoring of therapeutic responses. 4. The primary treatment approach for non-alcoholic fatty liver disease focuses on lifestyle interventions, primarily weight loss through dietary modifications and increased physical activity, with evidence showing that a modest reduction of 5 to 10% in body weight can significantly reduce liver fat, ameliorate inflammation and fibrosis, and improve overall liver function, often reversing fatty liver changes. 5. The use of vitamin E as a therapeutic agent in non-alcoholic steatohepatitis has gained traction due to its antioxidant properties, with studies demonstrating that high-dose vitamin E supplementation can improve liver histology, reduce hepatic inflammation, and increase indices of liver function in non-diabetic NASH patients, although caution is advised regarding long-term use and potential cardiovascular risks. In NAFLD, the liver enzyme alanine aminotransferase (ALT) is often elevated. However, normal ALT levels do not exclude the presence of significant liver damage, emphasizing the importance of considering a full panel of liver function tests alongside imaging techniques and histological assessment when diagnosing and monitoring this stealthy and often silent hepatic condition. 7. Advances in our understanding of gut-liver axis dysregulation in NAFLD have highlighted the role of dysbiosis and intestinal permeability in promoting hepatic fat accumulation and inflammation, pointing to the therapeutic potential of probiotics, prebiotics, and fecal microbiota transplantation in modulating gut microbiota composition and function as a novel avenue for treatment. 8. Insulin resistance is a crucial player in the pathogenesis of non-alcoholic fatty liver disease, where excessive lipolysis and increased free fatty acid influx into the liver, driven by hyperinsulinemia, play a pivotal role in hepatic fat deposition, reinforcing the interconnectivity between metabolic disturbances and liver health, and supporting the utilization of insulin-sensitizing agents like metformin in some patient populations. 9. Hepatocyte apoptosis, mediated by pathways involving endoplasmic reticulum stress and death receptor activation, is a significant contributor to liver injury and progression in NAFLD, suggesting that agents targeting these apoptotic pathways could offer novel therapeutic benefits by interrupting this self-perpetuating cycle of liver cell death and fibrogenesis. 10. Detection of genetic polymorphisms such as in the PNPLA3 gene highlights a genetic predisposition that significantly influences individual susceptibility to fatty liver disease in its progression, thus directing research towards personalized medicine approaches where genetic screening could inform risk assessment, prognosis, and tailored therapeutic strategies. 11. Bariatric surgery, particularly Roux-en-Y gastric bypass, has emerged as a highly effective treatment for morbidly obese patients with NAFLD, resulting in substantial and sustained weight loss, resolution of hepatic steatosis, and regression of fibrosis, positioning it as a viable option in severe cases where conservative management has failed and the risk of progression is high. 12. The mitochondrial dysfunction observed in NAFLD stems from impaired oxidative phosphorylation and an increase in reactive oxygen species, which contribute to steatosis, cellular damage, and fibrosis, indicating a potential therapeutic role for agents aimed at enhancing mitochondrial function and protecting against oxidative stress in the treatment landscape. 13. Obstructive sleep apnea, OSA, has been identified as a contributing factor to the progression of NAFLD through mechanisms involving intermittent hypoxia and sympathetic activation, making the treatment of OSA with continuous positive airway pressure, CPAP, a potentially beneficial adjunct in slowing disease progression and improving liver health. 14. Although traditionally associated with alcohol, steatohepatitis can develop in non-drinkers who consume excessive fructose, which is metabolized in the liver, resulting in de novo lipogenesis and increased triglyceride synthesis, underlining the impact of dietary choices on liver health and the importance of reducing fructose intake for NAFLD patients. 15. The concept of metabolic-associated fatty liver disease, MAFLD, has been proposed to more accurately reflect the metabolic underpinnings and multisystem involvement of fatty liver disease, emphasizing the transition towards a diagnostic approach that integrates metabolic risk factors, allowing for better stratification and management in clinical practice. 16. Emerging evidence suggests that certain medications, such as statins and SGLT2 inhibitors, not only manage associated metabolic conditions but also provide ancillary benefits for liver health, including reductions in liver fat and fibrosis, showcasing the potential of repurposing existing cardiometabolic medications to tackle the hepatic sequelae of metabolic syndrome. 17. Choline, an essential nutrient found in eggs, meat, and fish, plays an important role in preventing liver steatosis by assisting in lipoprotein assembly and VLDL secretion, reinforcing the nutritional importance of adequate choline intake and the potential consequences of deficiency in exacerbating fatty liver conditions. (18) Hepatic macrophages, or Kupffer cells, are key drivers of inflammation in fatty liver disease through the production of pro-inflammatory cytokines, which contribute to the exacerbation of liver injury and fibrosis. Thus, modulating the activity of these immune cells represents a promising therapeutic avenue to mitigate liver inflammation and progression. 19. Ethnic variations in the prevalence and severity of NAFLD suggest that genetic, lifestyle, and environmental factors intersect to influence disease distribution, with studies demonstrating higher susceptibility among Hispanic individuals, highlighting the need for culturally tailored interventions and awareness campaigns that address specific risks and misconceptions. Omega-3 fatty acids, abundant in fish oils, have been shown to reduce liver fat, inflammation, and triglyceride levels, indicating their potential as a supportive therapy in NAFLD management, especially for individuals who may not respond adequately to lifestyle changes alone, and underscoring the importance of dietary management in liver health. 21. The endocannabinoid system is increasingly recognized as a crucial modulator of hepatic energy storage, inflammation, and fibrosis in NAFLD, thus emerging as a potential target for treatment. Cannabinoid receptor antagonists, despite controversy, offer exciting possibilities for intervening in this pathway and controlling disease progression. The presence of liver fibrosis in NAFLD significantly increases the risk of adverse outcomes, making fibrosis staging vital in risk stratification and management decisions, with non-invasive biomarkers and elastography techniques offering reliable alternatives to liver biopsy, providing accessible and safer methods for assessing fibrosis risk. Identifying and managing comorbid conditions such as type 2 diabetes, hypertension, and dyslipidemia is crucial in NAFLD management, as these conditions share underlying pathophysiological links with liver disease and can exacerbate NAFLD progression, necessitating a comprehensive and multidisciplinary approach for optimal outcomes. Alcoholic fatty liver disease and non-alcoholic fatty liver disease share similar histological features, making clinical distinction based on history and risk factors essential for diagnosis, with alcohol abstinence serving as a critical and effective intervention for those with alcohol-related liver disease, whereas lifestyle changes remain foundational for NAFLD. Given the silent nature of early-stage NAFLD, routine screening for fatty liver in patients with obesity, metabolic syndrome, or type 2 diabetes is recommended to facilitate early diagnosis and intervention, underscoring the importance of awareness and vigilance in primary care and the potential benefit of periodic liver assessments in at-risk populations. Leptin resistance, often noted in individuals with obesity, contributes to steatosis by impairing the regulation of appetite and energy expenditure and promoting pro-inflammatory cytokines that exacerbate liver inflammation and fibrosis, presenting a target for novel therapies aimed at restoring leptin sensitivity and breaking the cycle of metabolic dysregulation. The prevalence of pediatric NAFLD is rising alarmingly, mirroring the increase in childhood obesity, with studies indicating that early onset of fatty liver can predispose youth to severe liver complications in adulthood, highlighting the urgency for public health interventions focusing on diet, physical activity, and lifestyle in childhood and adolescence. The gut-derived hormone fibroblast growth factor 19, FGF19, is implicated in the regulation of bile acid synthesis and glucose metabolism. Its therapeutic modulation offers intriguing prospects for correcting metabolic dysfunction and reducing liver fat content in patients with NAFLD, representing a promising area for novel therapeutic development. 29. Studies on liver fat quantification techniques have illuminated the efficacy of controlled attenuation parameter, CAP, via transient elastography, which provides a reliable, non-invasive, and widely accessible method for assessing hepatic steatosis, facilitating early diagnosis and monitoring while circumventing the risks and discomfort of liver biopsy. Gender differences in NAFLD reveal that men tend to develop the disease earlier, while women, particularly postmenopausal women, face a higher risk of disease progression, suggesting the influence of hormonal factors in disease dynamics and underlining the importance of gender-specific research and treatment approaches. 31. Pharmacological interventions targeting the insulin pathway, such as thiazolidinediones, are undergoing investigation to address insulin resistance in NAFLD patients, offering potential benefits in reducing liver fat, inflammation, and fibrosis, although balanced against potential side effects such as weight gain and cardiovascular risk. 32. Ectopic fat deposition, not only in the liver but also in muscles and the pancreas, constitutes an important aspect of the metabolic disturbances associated with NAFLD, highlighting the interconnected nature of metabolic health and the necessity for interventions that address overall body composition and systemic insulin sensitivity. Oxidative stress biomarkers such as melandialdehyde and 8-isoprostane provide valuable insights into the oxidative damage occurring in NAFLD, serving as potential diagnostic and prognostic tools for assessing the severity and progression of the disease and guiding antioxidant-based therapeutic strategies. Emerging research into the role of bile acids and the farnesoid X receptor, FXR, in NAFLD pathogenesis underscores their influence on lipid metabolism, hepatic inflammation, and fibrosis, identifying FXR agonists as promising candidates in the development of targeted therapeutics aimed at mitigating disease progression. The utilization of artificial intelligence and machine learning in analyzing electronic health records and imaging data holds great promise for enhancing the accuracy of NAFLD diagnosis and risk stratification, expediting the identification of high-risk individuals, and optimizing personalized treatment plans in a rapidly evolving healthcare landscape. The increase in lipotoxic intermediates such as diacylglycerol and ceramides in the liver has been linked to insulin resistance and hepatic inflammation, pointing to these lipid species as potential therapeutic targets in efforts to reduce liver fat accumulation and improve insulin sensitivity in patients with NAFLD. Advanced glycation end products, AGEs, accumulate in NAFLD due to high blood sugar levels and oxidative stress, contributing to liver inflammation and fibrosis, and emphasizing the importance of managing glycemic control and reducing dietary age intake as part of a comprehensive liver health strategy. Studies indicate a pivotal shift in lipid droplet biology and homeostasis within hepatocytes during NAFLD, with proteins involved in droplet formation and breakdown offering insights into novel therapeutic targets focused on normalizing lipid storage and mobilization processes within the liver. Visceral adiposity is closely linked to NAFLD, with evidence suggesting that reduction of visceral fat through targeted interventions such as aerobic and resistance exercise significantly diminishes liver fat and inflammation, reinforcing the importance of managing central obesity as a cornerstone of NAFLD prevention and treatment. Various cellular types within the liver, including hepatic stellate cells and ductular reaction cells, contribute to fibrogenesis in NAFLD through the secretion of extracellular matrix proteins, highlighting the diverse cellular contributions to liver fibrosis and the need for therapies targeting multiple cellular and molecular pathways. Plasma biomarkers like cytokeratin 18 fragments offer non-invasive means of diagnosing steatohepatitis in NAFLD patients by reflecting hepatocyte apoptosis, providing an important diagnostic alternative that may guide treatment decisions and evaluate responses without resorting to invasive liver biopsy techniques. 42. Disruption of circadian rhythms, often due to modern lifestyle patterns like shift work and poor sleep hygiene, can exacerbate metabolic disorders such as NAFLD by altering hepatic glucose and lipid metabolism, underlining the potential benefits of chronotherapeutic approaches that align treatment and lifestyle modifications with natural circadian rhythms. 43. Using dietary supplements like berberine, an alkaloid derived from plants, has shown promise in improving insulin sensitivity, reducing hepatic steatosis, and exerting overall beneficial metabolic effects, suggesting an additional, complementary role in managing NAFLD when combined with lifestyle interventions. 44. Iron overload, often detected through elevated serum ferritin levels in NAFLD patients, has been associated with increased hepatic inflammation and fibrosis, advocating for the assessment of iron status in NAFLD management and considering therapeutic phlebotomy or iron chelation as potential interventions in cases of significant iron burden. 45. The inconspicuous clinical course of NAFLD contrasts with its potential for serious complications, necessitating vigilant, regular follow-ups, including metabolic health assessments and liver function tests, to promptly identify transitions to more advanced liver disease and initiate timely interventions. 46. Genetic studies of NAFLD have also identified contributions from variants like TM6SF2 and GCKR, further elucidating the complex heritability and genetic risk factors involved in susceptibility and progression, reinforcing the potential for future genetic screening approaches to personalize and optimize patient management. 47. Pharmacological advances in the form of dual peroxisome proliferator activated receptor, PPAR, agonists are currently under investigation as potential NAFLD treatments due to their capacity to modulate lipid metabolism, reduce inflammation, and improve insulin sensitivity, offering a promising multifaceted approach to care. 48. Inflammation in NAFLD is driven not just by classic cytokines like TNF-alpha but also by novel mediators like TGF-beta and IL-1-beta, highlighting the importance of targeted anti-inflammatory strategies that can halt the progressive nature of this disease and address underlying molecular inflammations. 49. The measurement of liver stiffness via elastography provides an indirect yet valuable assessment of liver fibrosis in NAFLD patients, offering a non-invasive diagnostic tool that stratifies fibrosis risk and guides clinical decision-making in managing the disease without the need for invasive procedures. 50. Emerging therapeutic strategies for NAFLD include targeting microRNAs, which regulate gene expression involved in lipid metabolism, fibrogenesis, and inflammation, representing a new frontier in the molecular treatment of NAFLD and offering exciting possibilities for future pharmacologic development. 1. Understanding leukemia begins with recognizing its pathophysiology, where unchecked proliferation of abnormal white blood cells in the bone marrow disrupts normal hematopoiesis, leading to overproduction of dysfunctional leukocytes that can infiltrate vital organs and severely compromise immune system functioning. 2. A groundbreaking aspect of leukemia diagnosis involves flow cytometry, a sophisticated technique that enables clinicians to identify and quantify various cell populations in a blood sample, thus differentiating between subtypes of leukemia with unparalleled precision and informing subsequent treatment decisions. 3. The evolution of targeted therapy in leukemia is exemplified by tyrosine kinase inhibitors, such as imatinib, which specifically antagonize the BCR-ABL fusion protein in chronic myeloid leukemia, CML, thereby halting cancer cells' proliferation without substantially impacting normal cellular processes. 4. In acute lymphoblastic leukemia, all cytogenetics plays a pivotal role, as identifying chromosomal abnormalities such as the Philadelphia chromosome or translocations involving chromosome 12 and 21 informs prognosis and the selection of precise therapeutic protocols that are tailored to individual genetic profiles. 5. Leukapheresis is an innovative therapeutic intervention for acute leukemic presentations, where the removal of excess leukocytes from the bloodstream through apheresis rapidly diminishes hyperviscosity syndromes, thereby preventing cerebrovascular accidents and relieving symptomatic leukostasis. 6. Acute myeloid leukemia, AML, pathophysiology hinges on mutations in hematopoietic progenitor cells leading to clonal expansion of immature myeloid blasts, which not only crowd out normal precursors but also manifest in varied clinical presentations such as anemia, infection, and thrombocytopenia. 7. The notion of minimal residual disease, MRD, detection in leukemia has transformed remission monitoring, with sensitive techniques such as next-generation sequencing allowing for the detection of residual leukemic cells at a molecular level, thereby preempting relapse and refining therapeutic regimens. 8. Educational outreach in leukemia highlights the risk factors, including previous chemotherapy, radiation exposure, and genetic predisposition, emphasizing preventive strategies and early intervention to potentially mitigate the disease burden and improve demographic-specific outcomes. 9. Leukemia stem cells represent a paramount challenge due to their self-renewing capacity and resistance to conventional therapies. Targeting these cells with inhibitors of specific signaling pathways could potentially eradicate the root of the disease and prevent relapse. 10. The discovery and differentiation of T-cell and B-cell leukemias have provided a greater understanding of leukemogenesis, enabling specialized treatment plans that target distinct immunophenotypes, thereby improving therapeutic efficacy by directly engaging the malignancy's cellular origin. 11. Bone marrow aspiration and biopsy remain gold standard procedures for leukemia diagnosis, providing vital morphological and cytogenetic information necessary for classifying leukemia type, assessing marrow cellularity, and pinpointing specific chromosomal or molecular aberrations. 12. The role of the tumor microenvironment in leukemia progression is gaining attention, with stromal cell signals and cytokine networks being investigated for their contributions to drug resistance and establishing niches that protect leukemic cells from therapeutic elimination. 13. Personalized medicine in the management of leukemia now capitalizes on genetic and molecular data to customize treatment regimens, using pharmacogenomics to predict drug response and toxicity, thereby optimizing therapeutic outcomes while minimizing adverse effects. 14. Advances in leukemia research emphasize the potential of CAR T-cell therapy, wherein genetically modified autologous T-cells are engineered to express chimeric antigen receptors that target specific leukemia-associated antigens, achieving unprecedented remission rates in refractory cases. 15. Pediatric leukemia research underscores that children with Down syndrome have an elevated risk of developing acute leukemia, necessitating vigilant clinical surveillance and tailored therapeutic approaches to maximize outcomes while minimizing treatment-related morbidity. 16. High-dose chemotherapy followed by hematopoietic stem cell transplantation remains a cornerstone in treating certain high-risk leukemias, wherein autologous or allogeneic stem cells are infused to replace the eradicated leukemic marrow and restore hematopoietic functions. 17. Understanding the role of epigenetic modifications in leukemia, such as DNA methylation and histone acetylation, has opened new avenues for therapies like hypomethylating agents, which seek to reverse aberrant epigenetic states and reactivate tumor suppressor genes. The application of machine learning in leukemia is revolutionizing diagnostics by analyzing vast datasets to identify patterns and anomalies, offering the potential for early detection and personalized prognosis while continuously refining therapeutic approaches through adaptive algorithms. Leukemia-related fatigue, a pervasive symptom that significantly impacts quality of life, is being re-evaluated through comprehensive patient-centered studies aiming at integrative management approaches that encompass physical, psychological, and pharmacologic strategies. Chronic lymphocytic leukemia, CLL pathogenesis is heavily influenced by the accumulation of functionally inert yet non-apoptotic B lymphocytes, with research targeting the B-cell receptor signaling pathway to inhibit downstream survival signals and induce cancer cell apoptosis. Translational research in leukemia has spotlighted the significance of microRNAs in post-transcriptional regulation, with select mRNAs serving as potential biomarkers for early diagnosis, therapeutic targets, or as modulators of drug sensitivity and resistance mechanisms. In pediatric leukemia, supportive care has gained prominence, encompassing measures to address treatment-related toxicities such as infections, organ dysfunction, and growth impairment, thus elevating survivors' quality of life and fostering holistic recovery journeys. The discovery of oncogenes such as TET2 and FLT3 in leukemia has catalyzed research into their role in leukemic transformation, with ongoing trials testing inhibitors and prototypic compounds aimed at these genes to arrest disease progression at a molecular level. Recognition of therapy-related acute leukemia, resulting from previous treatment for other malignancies, highlights the need for judicious therapeutic planning, grasping personalized risk assessments and monitoring to prevent secondary leukemogenesis. Cutting-edge metabolomics research is revealing leukemia's distinct metabolic profiles, where aberrant metabolic pathways not only drive leukemic cell survival but also present opportunities for therapeutic interventions targeting critical metabolic vulnerabilities. Investigative efforts are unraveling how the immune system's evasion by leukemic cells relies on down-regulating checkpoint molecules. Thus, therapeutic strategies rekindling anti-leukemic immune responses are being refined to overcome immune escape mechanisms. For adolescent leukemia survivors, long-term follow-up care is critical, given the potential for late effects such as secondary cancers, cardiac dysfunction, or cognitive impairment, necessitating comprehensive survivorship programs that address these diverse health challenges. Exploring the interplay between leukemia and the central nervous system is crucial, as certain leukemias demonstrate proclivity for CNS invasion. Lumbar puncture and prophylactic CNS-directed therapies are integral to preventing neurological manifestations and relapses. Investigating the therapeutic potential of bispecific antibodies in leukemia involves engineering molecules that simultaneously bind to leukemic cells and T cells, harnessing the immune system for precise targeting and elimination of malignant hematopoietic cells. Advances in leukemia diagnostics incorporate liquid biopsy technology, allowing non-invasive detection of circulating tumor DNA and clonal evolution monitoring in plasma, providing real-time data for early relapse identification and therapeutic decision-making. 31. Leukemia pathophysiology often involves recurrent cytogenetic abnormalities, such as translocations or inversions, which lead to the creation of fusion genes. These genetic markers are pivotal in subclassifying leukemias and tailoring targeted treatments. 32. Research in leukemia explores the implications of clonal hematopoiesis of indeterminate potential, where certain mutations might predispose individuals to malignant transformation, spotlighting the need for heightened surveillance and preemptive therapeutic considerations. 3.3. In the context of leukemia, investigating the efficacy of kinase inhibitors inhibiting dysregulated signal transduction pathways holds promise, as exemplified by drugs targeting the JAK-STAT and PI3K, AKT pathways present in multiple leukemias. 34. The microbiome's influence on leukemia progression and treatment response is an emerging front in oncological research, with symbiotic bacterial communities impacting drug metabolism and immune modulation, necessitating further exploration to enhance therapeutic regimens. 35. Incorporating patient-reported outcomes into leukemia clinical trials provides rich insights into the impact of therapies on symptom burden and quality of life, fostering a more holistic understanding of patient-centered care and informed decision-making. 36. The role of the bone marrow niche microenvironment in leukemia has prompted research into therapies disrupting interactions between leukemic cells and supportive stromal components, aiming to increase the efficacy of conventional chemotherapeutic regimens. 37. Understanding pharmacokinetics and pharmacodynamics in leukemia therapy guides dosing regimens and toxicity management, ensuring that therapeutic concentrations are achieved without incurring unacceptable side effects, hence enhancing treatment outcomes. 38. Recent strides in immunophenotyping have advanced the identification of leukemia subtypes, with specific antigen expression profiles guiding targeted treatment options such as monoclonal antibody therapies, elevating precision medicine in hematology. 39. Hematologic support in leukemia consists of transfusion strategies for managing cytopenias, wherein red blood cells and platelets are administered to prevent bleeding complications and alleviate anemia-related symptoms, contributing significantly to patient management. 40. Exploring the genetic landscape of leukemia uncovers actionable mutations, with collaborative databases pooling genomic information to identify mutation-driven treatment options, thereby advancing the goal of precision oncology for leukemic patients. 41. The paradigm shift in understanding leukemia has brought focus to the relevance of patient psychosocial dynamics, with psychological support interventions playing a vital role in mitigating the emotional impact of diagnosis and treatment, aiding overall healing. 42. Investigations into lifestyle modifications as adjunctive measures in leukemia management propose strategies to bolster general health, mitigate comorbid conditions, and possibly modulate cancer progression through diet, exercise, and stress management routines. 43. Molecular-targeted radiotherapy in leukemia utilizes radio-labeled molecules binding selectively to leukemic antigens, enabling precise delivery of radiation to cancerous cells while minimizing damage to healthy tissue, heralding a new era of radiotherapy precision. 44. Understanding cytokine release syndrome, a notable adverse effect associated with leukemia immunotherapies like CAR T-cells, is crucial. Careful monitoring and management, often with corticosteroids or cytokine inhibitors, ensure this potent treatment remains viable. 45. Leukemia treatment resistance is an ongoing challenge, with research into mechanisms such as efflux pump overexpression and altered drug metabolism informing development of novel agents capable of overcoming these defenses to enhance patient responses. The advent of transcriptomics in leukemia research reveals the comprehensive gene expression profiles characteristic of each leukemia subtype, offering insights into disease biology and opportunities for discovering new molecular targets for therapeutic exploitation. The identification of leukemia stem cell markers such as CD123 has prompted a wave of immunotherapeutic strategies, with agents aimed at these markers showing promise in eradicating the putative roots of leukemia, thereby reducing recurrence rates. Understanding the prevalence and impact of acute leukemia in aging populations has underscored the need for geriatric-focused treatment protocols that maximize therapeutic benefit while accommodating the physiological vulnerabilities inherent in older adults. Advancements in cryopreservation and expansion of hematopoietic stem cells offer new possibilities for leukemic patients lacking suitable donors, enhancing the accessibility and success rates of stem cell transplants, particularly for minority populations. The exploration of leukemia in rare genetic disorders like Fanconi anemia emphasizes the complexity of carcinogenesis within a context of genetic instability, guiding innovation in genetic therapies and personalized treatment strategies that address the multifaceted nature of these cases. Chronic obstructive pulmonary disease (COPD) is primarily caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. It is characterized by restricted airflow and inflammation in the airways, leading to symptoms such as shortness of breath, chronic cough, and sputum production, and is diagnosed using spirometry, which measures the volume of air the patient can exhale in 1 second. Asthma is a chronic respiratory condition marked by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, typically triggered by allergens, cold air, exercise, or stress. It involves airway inflammation, hyperreactivity, and reversible airflow obstruction, and is diagnosed with lung function tests that show variable airflow limitation. Pulmonary embolism is a blockage in one of the pulmonary arteries in the lungs, typically caused by blood clots that travel to the lungs from the legs or other parts of the body. Deep vein thrombosis. Symptoms include sudden shortness of breath, chest pain, and a rapid heartbeat, and diagnosis often involves a CT pulmonary angiogram. Pneumonia is an infection that inflames the air sacs in one or both lungs, which may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. It can be caused by a variety of organisms, including bacteria, viruses, and fungi, and is often diagnosed with chest X-rays and sputum tests. Tuberculosis (TB) is a potentially serious infectious disease that mainly affects the lungs, spread through inhalation of airborne particles released from an infected individual, and is characterized by cough, chest pain, weight loss, night sweats, and fever. Diagnosis usually requires a skin test, blood tests, or culturing bacteria from clinical specimens. Interstitial lung disease (ILD) encompasses a large group of disorders characterized by progressive scarring of lung tissue, leading to irreversible lung damage, reduced oxygen exchange, and symptoms such as a dry cough and shortness of breath. Diagnosis often involves a high-resolution CT scan and lung biopsy to assess the pattern of fibrosis. Bronchiectasis is a chronic condition where the walls of the bronchi are thickened from inflammation and infection, leading to persistent cough, large amounts of sputum, and recurrent chest infections. Diagnosis typically involves a high-resolution CT scan to visualize dilated airways and assess the extent of lung damage. 8. Cystic fibrosis is a genetic disorder that affects mostly the lungs, leading to thick, sticky mucus production that can clog the airways, resulting in persistent lung infections and declining respiratory function. Diagnosis is confirmed with a sweat chloride test and genetic testing for mutations in the CFTR gene. Nine. Idiopathic pulmonary fibrosis, IPF, is a type of chronic, progressive interstitial lung disease characterized by a gradual scarring of lung tissue, which leads to a persistent cough and worsening shortness of breath. Lung biopsy or high-resolution computed tomography, HRCT, are often used to diagnose this condition and differentiate it from other interstitial lung diseases. 10. Acute respiratory distress syndrome, ARDS, is a severe lung condition occurring when fluid fills up the alveoli in the lungs, leading to severe shortness of breath and respiratory failure. It can be caused by a variety of factors, including trauma, sepsis, and pneumonia, and is diagnosed by clinical symptoms and imaging studies showing bilateral lung infiltrates. (11) Pleural effusion is the accumulation of excess fluid between the layers of the pleura outside the lungs, which can cause respiratory distress, chest pain, and cough. Potential causes include congestive heart failure, pneumonia, and malignancies, and it is diagnosed with imaging such as chest X-ray or ultrasound and confirmed by thoracentesis to analyze the pleural fluid. (12) Lung cancer is a malignant tumor characterized by uncontrolled cell growth in tissues of the lung, often asymptomatic in the early stages but can eventually lead to a persistent cough, hemoptysis, chest pain, and weight loss. It is commonly diagnosed through imaging such as CT scans and confirmed by a biopsy to determine histological type. (13) Obstructive sleep apnea, OSA, is a common disorder characterized by repetitive episodes of complete or partial upper airway obstruction during sleep, causing breathing disturbances, snoring, and excessive daytime sleepiness. It is diagnosed using polysomnography, which evaluates breathing patterns, oxygen levels, and heart rate during sleep. (14) Legionnaire's disease is a type of pneumonia caused by Legionella bacteria, typically contracted through inhalation of aerosolized water containing the bacteria. Symptoms may include high fever, chills, cough, and muscle aches, and diagnosis is confirmed through urine antigen tests and cultures of respiratory secretions. (15) Sarcoidosis is an inflammatory disease that affects multiple organs in the body, especially the lungs, characterized by the formation of granulomas, which can lead to cough, respiratory dysfunction, and fatigue. Diagnosis often involves a combination of clinical evaluation, imaging studies such as chest X-rays or CT scans, and biopsy of affected tissue. (16) Pneumothorax occurs when air leaks into the space between the lung and chest wall, causing the lung to collapse, which results in sudden chest pain and shortness of breath. It can result from trauma, lung disease, or spontaneous causes and is diagnosed with a chest X-ray or CT scan that shows the presence of air in the pleural space. (17) Respiratory tract infection is a group of infections of either the upper or lower respiratory tract, commonly caused by viruses such as rhinoviruses and influenza, leading to symptoms like sore throat, cough, fever, or difficulty breathing, and diagnosis is primarily based on clinical symptoms supported by laboratory tests when needed. (18) Pulmonary hypertension is high blood pressure in the arteries of the lungs that can lead to right-sided heart failure. It presents with shortness of breath, fatigue, and chest pain, often requiring right heart catheterization for definitive diagnosis and echocardiography for initial assessment of pulmonary arterial pressure. (19) Silicosis is an occupational lung disease caused by inhalation of silica dust, leading to inflammation and scarring of lung tissue, resulting in breathing difficulties and increased risk of tuberculosis. Diagnosis typically includes a history of occupational exposure, characteristic chest X-ray or CT findings, and pulmonary function tests. 20. Bronchiolitis, most commonly affecting infants and young children, is a viral infection primarily caused by the respiratory syncytial virus, RSV, resulting in inflammation and congestion in the bronchioles, with symptoms such as wheezing, cough, and difficulty breathing. Diagnosis is usually clinical but may include nasopharyngeal swabs to identify the virus. 21. Coal workers' pneumoconiosis, also known as black lung disease, is caused by long-term exposure to coal dust, leading to lung inflammation, fibrosis, and structural damage. Symptoms include chronic cough and shortness of breath, and diagnosis is typically made through occupational history, chest X-ray, and pulmonary function tests. 22. Pulmonary edema is a condition characterized by excess fluid in the lungs, causing difficulty breathing, coughing, and wheezing. It can result from left-sided heart failure, kidney failure, or acute respiratory distress, and is diagnosed based on physical examination, chest X-ray showing fluid accumulation in the lungs, and relevant laboratory tests. 23. Asbestosis is a chronic lung disease caused by inhaling asbestos fibers, leading to pulmonary fibrosis and increased risk of lung cancer and mesothelioma. Symptoms include shortness of breath and a persistent cough, and diagnosis relies on a thorough history of asbestos exposure, imaging such as chest X-ray or high-resolution CT, and lung function tests. 24. Pleurisy involves inflammation of the pleura, the membrane around the lungs, causing sharp chest pain that worsens with breathing, coughing, or sneezing. Potential causes include infections, autoimmune conditions, or pulmonary embolism, and diagnostic procedures include chest imaging to assess pleural thickening and laboratory tests to identify the underlying cause. 25. Croup is a viral infection of the upper airway, notably in children, resulting in swelling around the larynx, trachea, and bronchi, characterized by a distinctive barking cough, stridor, and hoarseness. Diagnosis is often clinical, based on the classic symptoms and presentation, with supportive care as the mainstay of treatment. 26. Chemical pneumonitis is inflammation of the lung tissue due to inhalation of irritants such as smoke, fumes, or vapors, which can lead to cough, difficulty breathing, and chest pain. Diagnosis relies on clinical history, imaging studies to assess lung inflammation, and exclusion of other causes of pneumonia. 27. Alpha-1 antitrypsin deficiency is a genetic disorder affecting the lungs and liver, due to lack of a protein that protects the lungs from damage, leading to emphysema and chronic obstructive pulmonary disease. Symptoms develop in adulthood and include progressive shortness of breath, and it is diagnosed by measuring serum alpha-1 antitrypsin levels. 28. Respiratory failure is a condition in which the respiratory system fails in oxygenation and/or carbon dioxide elimination, leading to hypoxemia and/or hypercapnia. It can be classified into type 1, hypoxemic, and type 2, hypercapnic, with diagnosis involving arterial blood gas analysis and treatment tailored to the underlying cause. 29. Aspirational pneumonia occurs when a person inhales food, liquid, or vomit into the lungs, leading to infection and inflammation. Symptoms include cough, fever, chest discomfort, and breathing difficulties, and diagnosis is based on clinical presentation, risk factors, and imaging studies such as a chest X-ray showing infiltrates in the lung. 30. Pulmonary thromboembolism involves the obstruction of the pulmonary artery or one of its branches by blood clots that travel from the legs, causing sudden shortness of breath, chest pain, and potentially life-threatening complications. Computed tomography pulmonary angiography is the most common method for confirming diagnosis. 31. Legionnaire's disease, a severe form of pneumonia caused by Legionella bacteria, presents with symptoms such as high fever, cough, and muscle aches. It is contracted by inhaling contaminated water droplets from sources like cooling towers, and diagnosis involves urine antigen tests or culture of the bacteria from respiratory secretions. 32. Anthracosis, often seen in coal miners, is characterized by accumulation of carbon-laden macrophages in the lung tissues, which can lead to chronic coughing and bronchial irritation. Diagnosis is usually made through bronchoscopy and examination of lung tissues for characteristic black pigmentation due to carbon deposits. 3.3. Mycoplasma pneumonia, known as walking pneumonia, is caused by Mycoplasma pneumoniae bacteria, which causes milder respiratory symptoms such as persistent cough, headache, and low-grade fever. Diagnosis is often clinical, supported by serological tests or PCR to detect specific antibodies or DNA of the bacteria. (34) Histoplasmosis is a fungal infection caused by inhaling the spores of the Histoplasma capsulatum, primarily affecting the lungs and leading to symptoms similar to flu, including cough and fever. Diagnosis is confirmed through culture, serology, or molecular testing of respiratory samples to detect the presence of the fungus. 35. Klebsiella pneumoniae is a bacterial pathogen causing a form of atypical pneumonia with clinical signs such as high fever, production of thick blood-tinged sputum, and lung infiltration. It frequently affects individuals with weakened immune systems, diagnosed by culturing the organism from respiratory secretions or blood samples. 36. The hantavirus pulmonary syndrome, HPS, is a severe respiratory disease caused by the hantavirus, transmitted to humans through contact with the urine, droppings, or saliva of infected rodents. Initial symptoms resemble flu-like illness, quickly progressing to acute respiratory failure, diagnosed via serological tests identifying hantavirus antibodies. 37. Alpha-1 antitrypsin deficiency is a genetic disorder that leads to the development of chronic obstructive pulmonary disease, COPD, and liver disease due to the lack of alpha-1 antitrypsin protein, which protects tissues from enzymatic breakdown, diagnosed by measuring serum levels of the protein and identifying genetic mutations. 38. Allergic rhinitis, commonly known as hay fever, is an allergic response to specific airborne allergens, resulting in symptoms like nasal congestion, sneezing, and itchy eyes. Diagnosis often involves a combination of clinical evaluation, skin prick tests, and specific IgE blood tests to identify triggering allergens. 39. Tracheobronchitis, often caused by viral infections such as influenza or bacterial agents like Bordetella pertussis, is characterized by inflammation of the trachea and bronchi, leading to symptoms including persistent cough, sore throat, and wheezing. Diagnosis is usually clinical, supported by throat swabs or cultures if necessary. 40. Respiratory syncytial virus, RSV, infection is a common cause of respiratory tract infections in infants and young children, manifesting as bronchiolitis or pneumonia, characterized by coughing, wheezing, and difficulty breathing. Diagnosis is confirmed by detecting the virus in nasal secretions through rapid antigen testing or PCR. 41. Lung fibrosis can develop as a progressive scarring process in the lungs, potentially resulting from chronic exposure to certain toxic inhalants, infections, or autoimmune diseases, leading to cough and restrictive lung disease. Diagnosis involves high-resolution computed tomography and pulmonary function tests revealing decreased lung volumes. 42. Lymphangioliomyomatosis, LAM, is a rare lung disease that predominantly affects women of childbearing age, characterized by abnormal growth of smooth muscle cells in the lungs, resulting in cystic lung changes, dyspnea, and spontaneous pneumothorax. The diagnosis is established through clinical assessment, imaging, and tissue biopsy to observe characteristic changes. 43. Chronic bronchitis, part of the chronic obstructive pulmonary disease spectrum, involves long-term inflammation of the bronchi, leading to symptoms such as a persistent productive cough and shortness of breath, usually diagnosed by evaluating the chronicity of symptoms and pulmonary function tests indicating airflow obstruction. 44. Pulmonary alveolar proteinosis is a rare disease where proteinaceous material accumulates in the alveoli, causing progressive respiratory impairment, cough, and increased risk of lung infections. Diagnosis is confirmed through bronchoalveolar lavage showing characteristic milky fluid and histopathological examination of lung tissue samples. (45) Pertussis, also known as whooping cough, is a highly contagious bacterial disease caused by Bordetella pertussis, characterized by severe coughing fits followed by a high-pitched, whoop sound. Diagnosis involves nasopharyngeal swab samples for culture or PCR testing to detect the bacterium, with vaccination as a key prevention strategy. (46) Diffuse alveolar hemorrhage syndrome is a group of diseases characterized by bleeding into the alveoli, leading to symptoms like cough, hemoptysis, anemia, and respiratory distress, often linked with autoimmune disorders. Diagnosis requires bronchoalveolar lavage and imaging studies to establish the presence and extent of alveolar bleeding. (47) The common cold is a viral infection of the upper respiratory tract caused by numerous types of rhinoviruses, resulting in symptoms such as nasal congestion, sore throat, and cough. Diagnosis is generally clinical, without the need for specific tests, unless distinguishing it from other more severe conditions such as influenza. (48) Wegener's granulomatosis, now known as granulomatosis with polyangiitis, is an autoimmune disorder that causes inflammation of blood vessels in the respiratory tract and other organs, producing symptoms like cough, sinusitis, and hemoptysis. Diagnosis is confirmed by serological tests for anti-neutrophil cytoplasmic antibodies, ANCA, and tissue biopsy. (49) The influenza virus causes an acute respiratory illness characterized by sudden onset of fever, cough, sore throat, and muscle aches, presenting in seasonal outbreaks with potential for significant morbidity and mortality. Diagnosis is often clinical, supported by rapid antigen tests or PCR for confirmation during epidemic peaks to guide antiviral treatment. (50) Emphysema, a type of COPD, involves the destruction of the alveoli and subsequent loss of lung elasticity, leading to symptoms like shortness of breath and limited exercise tolerance, mainly caused by smoking. Diagnosis typically involves pulmonary function tests showing reduced airflow and lung capacity, alongside imaging such as chest X-ray or CT scan. (1) Cerebral aneurysms, which occur due to weakened blood vessels in the brain, can remain asymptomatic until they rupture. This highlights the need for proactive screening in individuals with high risk factors like hypertension, smoking, or family history of aneurysms, as early detection through imaging modalities such as MRI and CT angiography can be critical for prevention. (2) The pathophysiology of cerebral aneurysms involves complex hemodynamic changes that exert excess pressure on arterial walls, where undeveloped collagen and elastin fibers fail to provide adequate resistance, leading to focal dilation, while genetic predispositions may further exacerbate these vulnerabilities by altering vascular structural integrity. (3) Technological advancements in endovascular techniques have revolutionized the treatment of cerebral aneurysms, with the deployment of flow diverters and stent-assisted coiling offering minimally invasive options that significantly reduce recovery time, complications, and the risk of recurrence when compared to traditional surgical clipping. (4) An underlying cause of cerebral aneurysms is hemodynamic stress, which arises from turbulent blood flow, primarily at bifurcations of cerebral arteries where high shear stress leads to endothelial injury and subsequent vascular wall remodeling, setting the stage for aneurysm formation as the vascular architecture becomes compromised. (5) Ruptured cerebral aneurysms are a cause of subarachnoid hemorrhage, a serious clinical condition associated with elevated mortality and morbidity, where rapid intervention is crucial. Key symptoms like sudden severe headache, neck stiffness, and altered consciousness should prompt immediate diagnostic evaluations including CT scan and lumbar puncture. 6. The genetic factors contributing to cerebral aneurysms can include mutations in genes related to connective tissue formation such as COL3A1, which disrupts collagen synthesis leading to weakened arterial walls, highlighting the importance of genetic counseling for at-risk individuals and their families. Seven. Early signs of an unruptured cerebral aneurysm might present subtly, with neurological deficits manifesting as cranial nerve palsies, localized headaches, or transient visual disturbances, a situation that necessitates vigilant clinical evaluations and neuroimaging where high-resolution detectors can reveal early aneurysmal changes. 8. Risk factors for cerebral aneurysms include modifiable lifestyle influences such as smoking, which accelerates atherosclerosis and hypertension by promoting endothelial dysfunction, along with non-modifiable factors like age and female gender. Therefore, lifestyle modification and regular screening are integral to disease management and prevention. 9. In cases where surgical intervention is indicated, microsurgical clipping requires precise intracranial navigation to apply a titanium clip at the neck of the aneurysm, effectively isolating it from cerebral circulation to prevent rupture, significantly lowering the chances of hemorrhagic events with a relatively low complication rate. 10. Intracranial pressure (ICP) monitoring is critical in patients with suspected or confirmed ruptured cerebral aneurysms, as elevated ICP can lead to compromised cerebral perfusion and herniation. Aggressive management with mannitol, hypertonic saline, or CSF drainage may be necessary to maintain optimal cerebral hemodynamics. Dual antiplatelet therapy is recommended post-coiling in aneurysm management to prevent thromboembolic complications, as the presence of foreign material in the cerebral circulation can stimulate platelet aggregation and thrombus formation, which might otherwise negate the benefits of endovascular repair. 12. The detection of cerebral aneurysms has been greatly improved with the use of 3D rotational angiography, which provides high-resolution images that assist in assessing aneurysm morphology and characteristics to aid clinicians in formulating customized intervention strategies, thereby enhancing patient outcomes. 13. With growing evidence of inflammation contributing to aneurysm formation, researchers are exploring pharmacotherapeutics aimed at mitigating inflammatory pathways, as inflammatory cytokines like TNF-alpha and IL-6 play a significant role in destabilizing the vascular matrix and facilitating aneurysmal growth. 14. Vasospasm is a common sequel to subarachnoid hemorrhage caused by cerebral aneurysm rupture, where intense cerebral artery vasoconstriction can lead to ischemic complications. Treatment approaches like nimodipine administration aim to alleviate these occurrences by inhibiting calcium influx into vascular smooth muscle cells. 15. Asymptomatic patients with small cerebral aneurysms often undergo a watchful waiting approach, where routine non-invasive imaging studies like MR angiography are employed at regular intervals to monitor aneurysm growth and the potential requirement for intervention, thus minimizing unnecessary surgical risks in stable cases. 16. Histological examination of aneurysmal sacs has shown macrophage infiltration and apoptosis within the medial layer, suggesting that therapeutic approaches targeting apoptotic pathways may hold promise in stabilizing aneurysmal walls and preventing subsequent enlargement or rupture. 17. The interplay of genetics and environment in cerebral aneurysm pathogenesis is becoming clearer with genome-wide association studies identifying loci like 9p21.3 associated with vascular disease susceptibility, promoting avenues for personalized medicine and targeted therapies for high-risk individuals. 18. Hypertension is a primary contributor to the formation and rupture of cerebral aneurysms, as chronic pressure overload results in endothelial injury and vascular remodeling, necessitating stringent blood pressure control and antihypertensive therapy as preventive measures in patients with known or suspected aneurysmal disease. 19. Dietary modification, including reducing sodium intake and increasing fruit and vegetable consumption, may lower aneurysm formation risk by mitigating hypertension and vascular inflammation, thereby complementing clinical management strategies and enhancing overall vascular health outcomes. 20. Neurointerventionalists are at the forefront of treating stable cerebral aneurysms with cutting-edge techniques that include the use of embolic agents or coils engineered to promote thrombosis within the aneurysm sac, effectively excluding it from circulation and reducing the likelihood of future rupture. 21. Advances in computational fluid dynamics modeling allow researchers to simulate blood flow patterns within cerebral vasculature, offering insights into the hemodynamic forces that contribute to aneurysm formation and influencing the design of novel flow-modifying devices for individualized aneurysm management. 22. Effective public awareness campaigns and education initiatives about cerebral aneurysm symptoms and risk factors play a crucial role in early detection and intervention, as they empower individuals to seek timely medical evaluations and adhere to preventive health measures, reducing overall aneurysm-related morbidity. 23. Postoperative management of cerebral aneurysm patients focuses heavily on rehabilitation therapies, which might include physical, occupational, or cognitive therapies, to address any neurological deficits or impairments resulting from aneurysm rupture or surgical intervention, facilitating improved functional recovery. 24. The presence of multiple cerebral aneurysms in individuals is not uncommon, necessitating a comprehensive diagnostic approach that involves advanced imaging studies to map the entirety of the cerebral vasculature, ensuring all potential sites of aneurysm formation are identified and appropriately managed. 25. Pharmacological agents like statins, known for their lipid-lowering effects, are being investigated for their vascular protective properties, which might extend to reducing the growth and rupture risk of cerebral aneurysms by enhancing endothelial function and reducing vascular inflammation. 26. Epidemiological studies reveal regional variations in cerebral aneurysm prevalence and rupture rates, likely reflecting differences in genetic predispositions, lifestyle factors, and healthcare access, underscoring the need for tailored public health strategies to address these disparities and improve regional outcomes. 27. Imaging biomarkers are being developed to enhance the prediction of cerebral aneurysm rupture risk, with studies investigating the correlation between aneurysm wall enhancement on MRI and instability, which could guide clinical decision-making and the timing of interventional therapies. 28. With family history being a significant risk factor for cerebral aneurysms, first-degree relatives of affected individuals are likely to benefit from early screening strategies, helping to identify potentially life-threatening aneurysms before they rupture and in settings where genetic counseling and testing are available. 29. Innovative biodegradable stents are the subject of ongoing research aimed at decreasing long-term thrombogenicity and foreign body reactions associated with aneurysm repair, offering the potential for safer, more effective long-term outcomes in patients undergoing endovascular treatment. 30. Cognitive outcomes post-aneurysm rupture depend on rupture severity, treatment modality, and promptness of medical intervention, with comprehensive neuropsychological assessments and supportive therapies being essential to improve cognitive recovery and enhance patients' quality of life. 31. Artificial intelligence and machine learning algorithms are increasingly being applied to cerebral aneurysm imaging for enhanced diagnostic accuracy by improving the identification of aneurysm characteristics that indicate rupture propensity, thus optimizing individual patient management plans. Glucocorticoids have emerged as a potential therapeutic option in the acute management of cerebral aneurysms by reducing perianeurysmal edema and inflammatory response, although their long-term efficacy and safety profile require further clinical investigation to inform treatment protocols. The role of neurotransmitters in cerebral aneurysm rupture is being explored, with particular attention to serotonin and its effects on vascular tone and platelet aggregation, possibly revealing novel pharmacological targets for the prevention of aneurysm-related hemorrhagic events. Interdisciplinary teams consisting of neurologists, neurosurgeons, and interventional radiologists are crucial in the comprehensive management of cerebral aneurysms, facilitating personalized treatment pathways that integrate medical, surgical, and rehabilitative care tailored to patient-specific health profiles. Cerebrovascular autoregulation can be disrupted post-aneurysm intervention, necessitating meticulous monitoring of cerebral perfusion pressure to prevent secondary ischemic injury, with management strategies involving both pharmacologic and supportive measures to stabilize cerebral blood flow and oxygenation. Nutrition plays a role in aneurysm recovery, where a diet rich in omega-3 fatty acids, antioxidants, and anti-inflammatory foods can support vascular health, aiding in the reduction of sequelae associated with aneurysm formation and rupture, and contributing to more favorable long-term outcomes. Serological biomarkers such as matrix metalloproteinases are under investigation for their potential to predict cerebral aneurysm growth and rupture, as their involvement in extracellular matrix degradation may provide insights into aneurysm pathogenesis and offer targets for therapeutic intervention. The development of patient simulation models in cerebral aneurysm education provides interactive opportunities for medical professionals to rehearse complex scenarios, enhance diagnostic acuity, and practice innovative treatment techniques, thereby improving clinical skills and patient safety. The connection between brain aneurysms and polycystic kidney disease is well documented. Specifically, individuals with autosomal dominant polycystic kidney disease have an increased risk of intracranial aneurysms due to inherent vascular abnormalities, necessitating proactive screening measures. Environmental influences such as pollution and low socioeconomic status have been implicated in cerebral aneurysm development, possibly through effects on systemic inflammation and access to healthcare, highlighting the importance of addressing social determinants of health in prevention strategies. MicroRNAs are emerging as key regulatory molecules in the pathogenesis of cerebral aneurysms, where their modulation of gene expression related to vascular remodeling and inflammatory processes may provide novel therapeutic targets to halt or reverse aneurysmal progression. Nanomedicine is finding application in cerebral aneurysm therapy, with nanoparticulate systems being designed to deliver drugs or genes directly to aneurysmal sites, thereby enhancing localized action while reducing systemic side effects, opening new frontiers for minimally invasive treatment strategies. For patients contraindicated for surgery, balloon-assisted coiling provides a viable alternative for aneurysm management, where a balloon is temporarily inflated in the parent vessel to aid coil placement, proving particularly effective in achieving complete occlusion of wide-necked aneurysms. 44. The connection between hormonal factors and aneurysm formation, particularly in postmenopausal women, is under scrutiny, with studies examining the protective role of estrogen on vascular integrity, potentially offering insights into hormone replacement therapy as a preventive measure against aneurysm development. 45. Workplace challenges faced by individuals with cerebral aneurysms require specific rehabilitation strategies, ensuring an effective return to work process that addresses cognitive, emotional, and physical reconditioning, thereby enabling seamless reintegration and productive living post-intervention. 46. Circulating endothelial cells have been proposed as potential biomarkers for detecting aneurysm instability, providing a non-invasive means to assess endothelial damage and disruption, which are critical factors in aneurysm integrity and associated hemorrhagic risk. 47. The use of computational fluid dynamics in analyzing hemodynamic impacts post-endovascular therapy is essential, as these models provide valuable insights into flow modification effects, contributing to the refinement of devices and techniques aimed at improving treatment efficacy and patient outcomes. 48. Cross-disciplinary research involving epidemiologists, geneticists, and neuroscientists is pivotal in uncovering the multifaceted etiologies of cerebral aneurysms, building comprehensive models that integrate genetic, environmental, and lifestyle factors to inform preventative healthcare policies. 49. Preclinical studies using animal models of cerebral aneurysms are vital for understanding disease progression and testing potential therapeutic approaches, providing a controlled environment to investigate pathophysiological mechanisms and evaluate the translational potential of novel treatments. 50. The future of cerebral aneurysm management lies in personalized medicine, where advancements in genomic profiling and biomarker identification will facilitate tailored therapeutic interventions and preventive strategies, ensuring optimal outcomes based on individual genetic, physiological, and lifestyle contexts. 1. A staggering diversity of microbial symbionts thrives within the human gastrointestinal tract, with the gut microbiota encompassing trillions of bacteria that wield profound influence over digestion and overall health. Yet disruptions in this microbiome, such as through antibiotics or a Western diet, can precipitate conditions like inflammatory bowel disease, irritable bowel syndrome, and metabolic disorders, emphasizing the importance of maintaining microbial balance for gastrointestinal homeostasis. 2. Crohn's disease, a type of inflammatory bowel disease, manifests with transmural inflammation that can affect any part of the gastrointestinal tract from mouth to anus, often leading to complications such as strictures, fistulas, and nutrient malabsorption. Despite its immune-modulated pathophysiology being not entirely understood, innovative biologic therapies targeting TNF-alpha and other inflammatory mediators have significantly improved patients' quality of life. 3. Gastroesophageal reflux disease, GERD, represents a chronic condition characterized by the retrograde flow of stomach contents into the esophagus, leading to symptoms such as heartburn and regurgitation, with potential complications including esophagitis and Barrett's esophagus, and lifestyle modifications like dietary changes and elevation of the head during sleep are often first-line therapies, supplemented by proton pump inhibitors to reduce acid production when necessary. 4. Celiac disease is an autoimmune disorder where ingestion of gluten leads to damage in the small intestine, with specific genetic markers HLA-DQ2 and HLA-DQ8 playing central roles in pathogenesis, and strict adherence to a gluten-free diet is currently the sole management strategy, underscoring the need for vigilance in identifying hidden sources of gluten to prevent malabsorption and related complications such as osteoporosis and anemia. 5. Acute pancreatitis, often precipitated by gallstones or excessive alcohol intake, involves the autodigestion of pancreatic tissue by prematurely activated digestive enzymes, and while mild cases may resolve with supportive care like hydration and fasting, severe forms can result in necrosis and systemic inflammatory response syndrome, necessitating intensive medical interventions and sometimes surgical debridement. 6. Irritable bowel syndrome, IBS, is a functional GI disorder characterized by a combination of abdominal pain, bloating, and altered bowel habits without any detectable organic cause, distinguishing itself with the brain-gut interaction being pivotal in its pathophysiology, and a personalized approach to treatment incorporating dietary adjustments, like low FODMAP diet, psychological support, and specific medication targets hallmark symptoms. 7. Peptic ulcer disease is primarily caused by Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, leading to erosions in the gastric or duodenal mucosa due to imbalances between protective and aggressive gastric factors, and eradication of H. pylori through antibiotic regimens or cessation of offending NSAIDs, coupled with acid suppression therapy, typically results in ulcer healing and symptom resolution. 8. Diverticulosis refers to the presence of herniations or pouches in the colonic wall that become inflamed or infected, resulting in diverticulitis, a condition characterized by acute abdominal pain, fever, and digestive disturbances, highlighting dietary fiber's role in prevention and antibiotics or, in severe cases, surgery's necessity for resolving complications like perforations or fistulas. 9. Chronic liver disease can culminate in portal hypertension, a condition where increased pressure in the portal venous system leads to complications such as esophageal varices, splenomegaly, and ascites, with non-invasive elastography providing a modern diagnostic tool for assessing liver stiffness and therapeutic advancements like TIPS procedure offering significant relief and management options. 10. Gallstones are crystalline concretions formed in the gallbladder due to imbalances in the composition of bile, with cholesterol stones being the most prevalent type in the Western world. And while many remain asymptomatic, if a stone obstructs the cystic duct, it can lead to cholecystitis, biliary colic, or pancreatitis, necessitating potential cholecystectomy as a definitive treatment. 11. The human gastrointestinal system displays a fascinatingly complex layered structure with the enteric nervous system operating as a second brain, capable of autonomous function in orchestrating peristalsis and secretion, with neuronal interconnectivity and neuromodulators reminiscent of the central nervous system, asserting its foundational role in maintaining digestive function and influencing emotional states. 12. Cirrhosis, the final common pathway for a myriad of chronic liver diseases, results from progressive fibrosis and nodular regeneration within the liver parenchyma, ultimately compromising hepatic function and leading to complications such as jaundice, coagulopathy, and hepatic encephalopathy, with liver transplantation remaining the only curative option for end-stage cirrhosis despite ongoing advancements in antifibrotic therapies. 13. Malabsorption syndromes are marked by defective nutrient absorption in the intestine, with conditions like lactose intolerance and tropical sprue affecting various digestive processes, leading to symptoms such as diarrhea, weight loss, and nutritional deficiencies, and they necessitate both accurate differential diagnosis via tests like breath hydrogen and stool analysis, as well as targeted dietary and pharmacological interventions. 14. Gastric cancer, predominantly adenocarcinoma, poses a major global health concern with risk factors including H. pylori infection, dietary influences, and genetic predispositions, often presenting in late stages due to nonspecific early symptoms, but advances in endoscopic surveillance techniques, alongside surgical and chemotherapeutic modalities, have provided tangible improvements in early detection and patient survival outcomes. 15. Functional dyspepsia, a chronic disorder characterized by upper abdominal discomfort and related symptoms, presents without an underlying structural cause, challenging clinicians with its complex interplay of gastric motility disturbance, visceral hypersensitivity, and psychosocial factors, thus mandating a multifaceted approach that may include prokinetics, acid suppression, and psychological therapies like cognitive behavioral therapy. Hepatitis C, a blood-borne viral infection that predominantly targets hepatocytes, can progress silently to chronic liver disease and cirrhosis over decades, but recent developments in direct-acting antiviral agents have revolutionized its management, providing cure rates above 95% and reducing the incidence of liver-related complications, thereby offering a beacon of hope for managing viral-induced liver diseases. Hepatic encephalopathy, resulting from the buildup of neurotoxic substances like ammonia due to liver dysfunction, manifests with a spectrum of neurological impairments ranging from confusion to coma in advanced cases, and treatment strategies focus on reducing ammonia levels using lactulose or rifaximin, alongside addressing the precipitating factors like infections or dehydration to prevent flares of this debilitating condition. Clostridium difficile infection is a leading cause of healthcare-associated diarrhea due to alteration of normal gut flora following antibiotic usage, and the hallmark pseudomembranous colitis can progress to severe fulminant colitis, necessitating prompt recognition and management with oral vancomycin or fidaxomicin, and fecal microbiota transplantation has emerged as an innovative therapy for recurrent cases. Barrett's esophagus, a precursor for esophageal adenocarcinoma, results from chronic gastroesophageal reflux causing metaplasia of the esophageal lining, with endoscopic surveillance and biopsy forming the cornerstone of monitoring, and advanced interventions like radiofrequency ablation or endoscopic mucosal resection in selected cases offer potential measures to mitigate cancer progression risk. Intussusception occurs when one segment of intestine telescopes into another, causing bowel obstruction and ischemia if untreated, predominantly affecting young children who present with classic triad of intermittent abdominal pain, current jelly, stools, and a palpable abdominal mass, with treatment often involving a therapeutic enema or surgical intervention to resolve the obstruction. Non-alcoholic fatty liver disease encompasses a spectrum from simple steatosis to non-alcoholic steatohepatitis, reflecting fat accumulation in hepatocytes primarily linked to metabolic syndrome. Features such as obesity, insulin resistance, and dyslipidemia, demanding lifestyle modifications as the primary therapeutic approach, while pharmacological interventions focusing on insulin sensitizers show promise in reversing hepatic steatosis and inflammation. Helicobacter pylori's unique spiral morphology and urease production enable survival and colonization within the acidic gastric environment, causing chronic gastritis, peptic ulcers, and being a recognized carcinogen associated with gastric cancer, making eradication regimens combining multiple antibiotics and acid suppression pivotal in reducing its clinical burden and preventing associated gastric malignancies. Acute appendicitis, the most common surgical emergency, results from obstruction and subsequent infection of the appendix leading to inflammation and potential perforation, presenting with periumbilical pain migrating to the right lower quadrant, and timely diagnosis and surgical intervention, typically in the form of appendectomy, remain crucial to avoid complications like peritonitis or abscess formation. Hirschsprung's disease is a congenital condition resulting from the absence of ganglion cells in the distal colon, leading to functional bowel obstruction and chronic constipation in neonates, with rectal biopsy being the definitive diagnostic tool, and surgical resection of the aganglionic segment forming the cornerstone of treatment to restore normal bowel function and prevent enterocolitis. Autoimmune hepatitis, characterized by chronic inflammation of the liver due to immune-mediated attack on hepatocytes, presents with varied symptoms from asymptomatic elevations in liver enzymes to fulminant hepatic failure, and although precise etiology remains elusive, Treatment typically involves immunosuppression with corticosteroids and azathioprine to control inflammation and prevent progression to cirrhosis. (26) Esophageal achalasia, a disorder of esophageal motility characterized by impaired relaxation of the lower esophageal sphincter and loss of peristalsis, presents with progressive dysphagia to solids and liquids, and high-resolution manometry aids its diagnosis, with treatment options including pneumatic dilation, surgical myotomy, or peroral endoscopic myotomy offering symptomatic relief and improving esophageal function. 27. Microscopic colitis, comprising collagenous and lymphocytic variants, is an inflammatory bowel condition causing chronic watery diarrhea with normal endoscopic findings, but distinctive histopathological features on biopsy, and management generally involves cessation of potential offending agents like NSAIDs, with budesonide providing effective resolution of symptoms in many cases. (28) Zollinger-Ellison syndrome is a rare disorder caused by gastrin-secreting tumors, usually in the pancreas or duodenum, leading to gastric acid hypersecretion and recurrent peptic ulcers, with gastrin levels and imaging for tumor localization aiding in diagnosis, and management encompasses not only acid suppression but also surgical resection or somatostatin analogs to control hormone production. (29) Gluten sensitivity, a non-celiac adverse response to gluten ingestion, presents with symptoms overlapping with irritable bowel syndrome, including abdominal discomfort and bloating, without the autoimmune component seen in celiac disease, necessitating exclusion of other potential causes, and a gluten-free diet often providing symptomatic improvement, although the long-term necessity of dietary restrictions remains a topic of ongoing research. (30) Incarcerated inguinal hernias present when a segment of intestine becomes trapped within the inguinal canal, risking obstruction and ischemia, with acute presentation involving localized pain, irreducible mass, and possible systemic signs if strangulation occurs, and urgent surgical intervention is imperative not only to release the incarcerated bowel but also to repair the hernia to prevent recurrence. (31) Gastritis refers to inflammation of the gastric mucosa, which may be acute or chronic, and although often asymptomatic, it can manifest with epigastric pain, nausea, or bloating, with etiological factors ranging from infection by H. pylori to NSAID use and alcohol consumption, highlighting the importance of addressing the underlying cause alongside acid suppression to facilitate mucosal healing. (32) Hemochromatosis, a genetic disorder characterized by excessive iron absorption and accumulation in tissues, leads to organ damage, particularly in the liver, heart, and pancreas, presenting with liver cirrhosis, diabetes, and skin pigmentation changes. An early diagnosis facilitated by genetic testing allows for effective management through regular phlebotomy to prevent long-term complications. (3) Gastrointestinal stromal tumors, GISTs, are mesenchymal tumors arising predominantly in the stomach or small intestine, characterized by mutations in the KIT or PDGFRA genes, and present with nonspecific symptoms such as gastrointestinal bleeding or pain, with management advancing significantly through the use of imatinib, a tyrosine kinase inhibitor, besides surgical resection for localized disease. (34) Ascites, the abnormal accumulation of fluid in the peritoneal cavity, commonly arises from portal hypertension or malignancy, presenting with abdominal distension and discomfort, and evaluating the serum ascites albumin gradient aids in establishing the etiology, while therapeutic paracentesis provides symptomatic relief, with albumin infusion and diuretics being adjunctive therapy to manage fluid overload and prevent recurrence. (35) Behçet's disease is a systemic vasculitis characterized by recurrent oral ulcers, genital ulcers, and uveitis, with potential gastrointestinal involvement leading to ulceration and bleeding, and although its precise pathophysiology remains unclear, treatment with immunosuppressive agents like colchicine, corticosteroids, or biologics targeting tumor necrosis factor alpha plays a pivotal role in controlling systemic and gastrointestinal manifestations. 36. Functional abdominal pain syndrome is a chronic pain condition characterized by continual or frequent abdominal pain not associated with altered bowel patterns, distinguishing it from other functional gastrointestinal disorders, with its management necessitating a biopsychosocial approach involving pharmacologic measures targeting pain pathways, psychological therapies, and supportive care for comprehensive symptom management. 37. The role of ghrelin in the gastrointestinal system extends beyond its well-known hunger-promoting action, with this peptide hormone influencing gastric motility, pancreatic hormone secretion, and potentially exerting protective effects on gastric mucosa, positioning it as an intriguing target for therapeutic research in conditions ranging from gastroparesis to cachexia due to its multifaceted physiological and pathophysiological roles. 38. Eosinophilic esophagitis is a chronic immune-mediated condition characterized by eosinophil infiltration in the esophageal mucosa leading to dysphagia and potential esophageal remodeling, often linked with atopic conditions, and its management involves dietary exclusion of allergens, typically guided by allergy testing, alongside topical corticosteroids to reduce eosinophilic inflammation and prevent disease progression. 39. Helicobacter pylori's involvement in extragastric manifestations such as idiopathic thrombocytopenic purpura and iron deficiency anemia continues to intrigue researchers, with evidence suggesting that eradication of H. pylori can lead to resolution or improvement in these conditions, thus necessitating consideration of this bacterium's far-reaching impact beyond the confines of the gastrointestinal tract in certain clinical scenarios. 40. The curiously named Meckel's diverticulum is a remnant of the omphalomesentaric duct found in the ileum, which may become symptomatic if it harbors ectopic tissue-producing acid, or causes obstruction, and while often asymptomatic, it remains the most common congenital anomaly of the gastrointestinal tract, with technetium 99M scintigraphy aiding in diagnosis when symptomatic presentations resembling appendicitis or gastrointestinal bleeding emerge. 41. Gastroparesis is a disorder characterized by delayed gastric emptying without mechanical obstruction, presenting with symptoms such as nausea, vomiting, and early satiety, often associated with diabetes or idiopathic causes, and management includes dietary modifications, prokinetic agents, and potentially gastric electrical stimulation to improve gastric motility and alleviate symptoms. 42. Chronic intestinal pseudo-obstruction mimics mechanical bowel obstruction without a physical blockage, resulting from significant abnormalities in enteric smooth muscle or nerves, leading to gastrointestinal dysmotility with symptoms like abdominal distension, pain, and malnutrition, necessitating a multifaceted approach including dietary adjustments, pharmacological motility agents, and sometimes parenteral nutrition for effective management. 43. The multifactorial etiology of colorectal cancer encompasses genetic predispositions, including familial adenomatous polyposis and Lynch syndrome, alongside environmental influences like diet, with screening colonoscopy playing a crucial role in early detection and prevention, while advances in molecular profiling derive personalized approaches to therapy, including targeted therapies and immunotherapies, in improving patient outcomes. 44. Primary biliary cholangitis is a chronic liver disease driven by autoimmune destruction of intrahepatic bile ducts, presenting with fatigue, pruritus, and eventual progression to cirrhosis. And while its precise etiology remains enigmatic, treatment with ursodeoxycholic acid and emerging drugs like obeticholic acid can slow disease progression, providing a favorable prognosis when diagnosed early. 45. Biliary atresia, a life-threatening congenital liver disorder, involves progressive obliteration of extrahepatic bile ducts leading to cholestasis and cirrhosis, requiring the Kasai procedure, a surgical intervention connecting the intestine to the liver, as a timely measure to restore bile flow and delay liver transplantation, which remains inevitable in many cases for long-term survival. (46) Small intestinal bacterial overgrowth, SIBO, results from excessive bacteria in the small intestine, often due to impaired motility or anatomical abnormalities, leading to symptoms like bloating, diarrhea, and malabsorption, with diagnosis supported by breath testing and management involving antibiotics and probiotics aimed at restoring normal bacterial populations and alleviating symptoms. (47) The gut-brain axis embodies the complex bidirectional communication network between the central nervous system and the enteric nervous system, influencing not only gastrointestinal processes but also psychological states and behaviors, with emerging evidence highlighting the role of gut microbiota in modulating this interaction, opening novel therapeutic avenues for disorders like anxiety and depression linked to gut dysbiosis. (48) Esophageal strictures occur due to fibrosis and narrowing of the esophageal lumen from conditions such as chronic reflux esophagitis, malignancy, or radiation, presenting with progressive dysphagia, and management typically involves endoscopic dilation to restore luminal patency, while addressing the underlying cause is critical for preventing recurrence and ensuring durable symptom relief. (49) Hepatorenal syndrome, a serious complication of liver cirrhosis, arises from renal vasoconstriction secondary to systemic circulatory changes, leading to acute kidney injury in the absence of intrinsic renal disease, and its management includes vasoconstrictors like terlipressin and albumin infusion to improve renal perfusion, while liver transplantation offers definitive treatment and resolution of this life-threatening condition. (50) Carcinoid tumors, slow-growing neoplasms originating from enterochromaffin cells in the gastrointestinal tract, typically secrete serotonin and other vasoactive substances, leading to carcinoid syndrome characterized by flushing, diarrhea, and valvular heart disease, and while surgical resection remains curative for localized disease, somatostatin analogs provide symptom control and reduced hormone secretion in metastatic cases. 1. Hepatitis B is a viral infection primarily targeting the liver, causing both acute and chronic disease, with unique surface antigens, HB-ZAG, that serve as essential markers for diagnosis and monitoring. And while its transmission occurs through exposure to infectious body fluids such as blood, semen, and vaginal secretions, some innovative studies suggest potential spillover mechanisms through everyday skin contact, especially during communal activities involving sharp objects. (2) The hepatitis B virus, HBV, cunningly incorporates itself into the host's DNA, which makes complete eradication challenging and thus necessitates prolonged and sometimes lifelong antiviral therapy that primarily involves nucleose T-ide analogs like entecavir and tenofovir to achieve viral suppression, although these therapies do not cure the disease and require careful monitoring for the development of drug resistance and renal or bone complications. (3) Upon HBV infection, a complex interaction ensues within the immune system where cytotoxic T lymphocytes target infected hepatocytes, leading to liver inflammation and potential damage, which paradoxically contributes both to viral clearance in acute cases and liver pathology in chronic cases, a dualistic pathophysiological process that continues to be a subject of intense research. (4) Chronic hepatitis B can progress to severe liver diseases such as cirrhosis or hepatocellular carcinoma, HCC, with the risk of such progression drastically increasing in individuals with co-infections such as hepatitis C or D, emphasizing the need for comprehensive serological screening and integrated management strategies that address comorbid conditions to prevent severe outcomes. 5. The HBV genome operates with a high degree of genetic plasticity, containing 4 partially overlapping open reading frames that encode several multifunctional proteins, and the virus's capacity to generate mutations, especially in the precore and basal core promoter regions, can modify its pathogenic potential and influence the host's immune response, complicating treatment and vaccine design efforts. Six. While hepatitis B vaccination remains a key preventive measure with remarkable efficacy rates in the general population, seroconversion rates can be disappointingly low in certain cohorts such as hemodialysis patients and immunocompromised individuals, prompting exploration into vaccine adjuvants, varied dosing schedules, and alternative routes of administration to improve protective immunogenicity. 7. An intriguing aspect of HBV infection is the formation of subviral particles, which are composed mainly of surface antigens but lack genomic DNA, and these particles are thought to serve as decoys that distract the immune system's attention from the infectious virions, thereby facilitating chronicity and making them vital targets in the quest for therapeutic vaccines. 8. The enigmatic role of HBV X protein, HBX, in viral replication, host cell gene regulation, and oncogenesis has been linked to its ability to interact with various cellular proteins and pathways, including ones involved in signal transduction, apoptosis, and cell cycle regulation, presenting a multifaceted challenge in understanding its full implications and therapeutic targeting potential. 9. Advanced imaging techniques such as transient elastography and magnetic resonance elastography are transforming the landscape of non-invasive liver fibrosis assessment in hepatitis B patients, providing critical insights into the extent of fibrosis and guiding treatment decisions, although the interpretation of stiffness values requires a nuanced understanding of potential confounding factors like inflammation or hepatic steatosis. 10. While the discovery of a functional cure for hepatitis B remains an unmet medical need, innovative therapeutic approaches are being explored, including RNA interference strategies to knock down viral gene expression, therapeutic vaccines designed to boost immune clearance, and CRISPR-Cas9 technologies aimed at eliminating cccDNA from hepatocytes, each holding promise but accompanied by unique challenges in specificity and delivery. 11. Acute hepatitis B infections can be asymptomatic or present with a spectrum of symptoms ranging from mild flu-like manifestations to severe fulminant hepatic failure, where the extreme form is characterized by rapid deterioration of liver functions, coagulopathy, encephalopathy, and a high mortality rate unless emergent interventions such as liver transplantation are pursued. 12. The prevalence of hepatitis B shows significant geographical variation, with the highest burdens in sub-Saharan Africa and East Asia, often due to vertical transmission from mother to child during childbirth, a scenario that underscores the importance of neonatal vaccination programs and the administration of hepatitis B immunoglobulin in preventing mother-to-child transmission in endemic regions. 13. Serological testing for hepatitis B antigen, HBAg, plays a crucial role in clinical practice, as its presence typically indicates high replicative activity and increased infectivity, guiding prognosis and therapeutic evaluation, although its correlation with liver disease progression is nuanced, particularly in the context of HBV genotype variation and shifts in the immune-tolerant phase. 14. Hepatitis B infection can be modulated by the presence of the hepatitis delta virus, HDV, a satellite virus that requires HBV for replication and can cause more aggressive liver disease characterized by more rapid progression to cirrhosis, higher rates of decompensation, and an increased risk of hepatocellular carcinoma, mandating a different therapeutic approach and the prioritization of HDV screening in HBV-infected patients. 15. The discovery of occult hepatitis B infection, where individuals remain HBsAg negative but with HBV DNA detectable in liver tissue or blood, has significant clinical implications, especially in immunocompromised patients undergoing chemotherapy or organ transplantation, as reactivation of the virus can occur with profound liver failure unless prophylactic antiviral therapy is instituted. HBV replication is elegantly orchestrated through the formation of covalently closed circular DNA, cccDNA, which acts as a mini chromosome within the nucleus of infected hepatocytes, providing a template for episodic viral replication and a reservoir for reactivation, positioning it as a prime target for novel therapeutic strategies aimed at achieving sustained virological response. The rise of antiviral-resistant hepatitis B strains poses a considerable challenge to clinical management, with resistances to lamivudine and adefovir being notable, and necessitates routine surveillance to detect genetic mutations that confer resistance, thereby ensuring timely modifications in therapy to prevent disease progression and liver-related complications. Understanding the immunological paradox wherein chronic hepatitis B persists despite an intact immune system involves recognizing HBV's ability to induce immune tolerance, partly through the upregulation of checkpoint molecules like PD-1 and TIM-3, which inhibit effective T-cell responses, making checkpoint blockade an exciting area of research for potential therapeutic interventions. The intricate relationship between hepatitis B and liver cancer has been delineated by observations of HBV integration into the host genome, the promotion of genomic instability, and the expression of oncogenic viral proteins, with chronic HBV infection being one of the few viral etiologies directly associated with carcinogenesis, highlighting the preventive potential of early antiviral therapy and vaccination. Innovative approaches to hepatitis B treatment also explore the use of therapeutic protein inhibitors targeting viral assembly and secretion, which aim to reduce serum levels of HBsAg, consequently simplifying clinical monitoring and potentially aiding in restoring the host's immune control over infection, opening avenues for additional combination regimen trials. Genetic studies have unveiled the significant impact of host genetic polymorphisms, particularly in the HLA and cytokine genes, on susceptibility to and outcomes of hepatitis B infection, offering insights into potential personalized vaccine and treatment strategies tailored to individuals' genetic profiles and possibly improving the efficacy of therapeutic interventions. In chronic hepatitis B management, the decision to initiate antiviral therapy is closely linked to assessing liver histology, which traditionally required invasive biopsy, yet the advent of reliable non-invasive biomarkers, including serum aminotransferase levels, HBV DNA quantification, and novel fibrosis markers, is revolutionizing patient evaluation, albeit with a constant search for enhancing diagnostic accuracy. Hepatitis B vaccines exemplify a tremendous public health success story, yet addressing the global challenge of vaccine refusal and misconceptions, particularly in low vaccination coverage areas, calls for innovative health education and communication strategies that leverage technology and community involvement to enhance awareness, increase acceptance, and ultimately control the spread of the virus. The complexity of hepatitis B co-infection with HIV demands a specialized treatment paradigm since drug-drug interactions and overlapping toxicities can influence regimen choice, necessitating a multidisciplinary approach to optimize both viral suppression and liver disease management, with the potential for integrative therapies combining antiretrovirals with agents specifically targeting HBV replication. 25. Radiologists play a pivotal role in the interdisciplinary care of hepatitis B patients, with advanced imaging modalities such as contrast-enhanced ultrasound not only aiding in the initial detection and characterization of liver lesions but also in the monitoring of therapeutic response and early identification of post-treatment complications, thus ensuring comprehensive patient management. 26. Hepatitis B antigen-negative chronic hepatitis B presents a clinical challenge due to its diverse clinical course characterized by episodic flares of hepatitis and varying degrees of viral replication, necessitating ongoing patient monitoring, flexible treatment regimens, and timely intervention to mitigate the risk of liver disease progression and carcinoma development. 27. The potential hepatoprotective properties of naturally occurring compounds, including those derived from traditional herbs like Phyllanthus amarus, have sparked interest in complementary and alternative medicine approaches for hepatitis B, suggesting that adjunctive therapies could modulate immune responses or provide symptomatic relief, although rigorous clinical validation remains imperative. 28. In children born to hepatitis B infected mothers, understanding the immunological factors contributing to viral persistence and early exposure impacts remains critical, with ongoing research focused on identifying markers of immune tolerance, optimizing maternal antenatal antiviral intervention, and improving neonatal immunoprophylaxis strategies to effectively prevent vertical transmission. 29. Obtaining an accurate epidemiological picture of hepatitis B is crucial for informing public health policies, and the integration of data analytics and machine learning techniques provides novel tools for predicting trends, identifying high-risk populations, and optimizing resource allocation for screening, vaccination, and treatment programs, leading to more targeted and effective interventions. 30. Psychological aspects of hepatitis B diagnosis, often underappreciated in clinical settings, can significantly impact patient adherence to medical recommendations, meriting the incorporation of structured support systems, mental health assessments, and culturally sensitive counseling into routine management to empower patients and improve overall treatment outcomes. 31. Hepatitis B's interaction with host metabolic processes has gained attention, with evidence suggesting that viral factors may influence hepatic lipid metabolism, contributing to the dual burden of HBV and metabolic syndrome, a nexus that could unravel novel therapeutic pathways targeting metabolic modulation alongside antiviral strategies to enhance clinical efficacy. 32. Community-focused screening and vaccination programs, leveraging mobile health technology and point-of-care testing, present an innovative strategy to address hepatitis B in remote or underserved areas, ensuring timely identification and linkage to care for infected individuals, and strengthening disease surveillance through real-time data analytics. 3. Advances in proteomics and metabolomics are expanding the horizon of hepatitis B research, providing detailed insights into host pathogen interactions, identifying novel biomarkers for disease progression and therapeutic response, and offering potential targets for precision medicine approaches in hepatitis B management. 34. Understanding the impact of hepatitis B on hepatic immune microenvironments reveals insights into liver-specific lymphocyte populations, such as liver-resident T and innate lymphoid cells, and their functional roles in maintaining chronic infection or facilitating disease clearance, pointing to novel immunomodulatory pathways that could be harnessed therapeutically. 35. The correlation between hepatitis B viral load and intrahepatic inflammation underscores the need for regular quantification of serum HBV DNA in guiding therapeutic decisions, with fluctuations in viral replication potentially offering clues regarding patient compliance, emerging resistance, or changes in liver disease status that warrant clinical correlation and intervention. 36. Hepatitis B's complex life cycle involves a delicate balance between viral replication, cccDNA maintenance, and immune evasion strategies, offering a unique platform for studying viral host interactions and providing opportunities to exploit these processes for the development of therapeutic vaccines and curative antiviral regimens designed to disrupt this equilibrium. 37. Implementing hepatitis B health literacy curriculum in educational institutions not only amps up awareness among young individuals but also empowers them to become advocates in destigmatizing the disease, thereby fostering an informed community capable of recognizing early symptoms, understanding vaccination importance, and encouraging proactive engagement with healthcare professionals for screening and management. 38. Chronic hepatitis B requires a dynamic approach to management, with recommendations urging clinicians to consider factors such as patient's age, liver function status, family history of liver diseases, and genotype when formulating individualized treatment plans, ensuring that therapeutic decisions reflect the comprehensive clinical scenario and patient's long-term health prospects. 39. The role of the liver in hormone regulation and nutrient storage means that hepatitis B can have systemic manifestations beyond hepatic injury, including endocrine disturbances and nutritional deficiencies, which necessitate a holistic consideration of patient symptoms and potential need for interdisciplinary management strategies incorporating endocrinologists and nutritional experts. 40. Understanding the structural nuances of the hepatitis B surface antigen has paved the way for improved vaccine development and serological testing specificity, revealing that antigenic variations could influence immune evasion and chronicity, thus informing strategies to optimize vaccine formulations to balance robust seroconversion with minimized allergenic potential. 41. The interplay between hepatitis B infection and hematological disorders uncovers intricate associations, with evidence that HBV infection can induce hematological malignancies or cytopenias through mechanisms such as chronic inflammation or direct viral effects on bone marrow, underlining the importance of thorough hematologic evaluation in HBV-positive individuals to preempt and manage such complications. 42. Emerging research into blood-brain barrier permeability and peripheral nervous system manifestations in hepatitis B proposes an intriguing extension of the disease beyond hepatic pathology, with some studies indicating viral particles or inflammatory mediators may contribute to neurological symptoms, thereby calling for expanded neurological assessments when managing chronic HBV patients with atypical presentations. 43. Hepatitis B poses distinct challenges in transplant medicine, especially in the context of liver transplantation where pre-existing infection risks graft failure or reinfection, compelling the development of innovative prophylactic and therapeutic regimens, including passive immunization with HBV immunoglobulin and the careful selection of post-transplant antiviral therapy to assure favorable graft outcomes. 44. Multifaceted interventions that integrate lifestyle modifications with medical treatment have shown promise in managing hepatitis B, particularly in addressing contributory factors such as alcohol consumption, which exacerbates liver damage, and thus formulating comprehensive care plans that include dietary advice, physical activity, and psychological support can improve adherence and disease management outcomes. 45. In the realm of hepatitis B research, cutting-edge methodologies such as single-cell sequencing are being employed to dissect the heterogeneity of immune cells in the liver of infected individuals, offering unprecedented resolution into immune landscape remodeling during chronic HBV infection and potentially unveiling novel therapeutic targets for immunomodulation or immune clearance strategies. 46. The phenomenon of HBV reactivation, characterized by a resurgence in viral replication in previously inactive or resolved infections, is particularly concerning in patients receiving immunosuppressive treatments, emphasizing the necessity for vigilant monitoring protocols and preemptive antiviral therapy to mitigate risks, especially amid emerging biological therapies that alter immune function. 47. Development of targeted HBV antiviral agents like capsid assembly modulators offers a novel mechanism for disrupting viral replication, focusing efforts on destabilizing the viral core protein assembly process, which is critical for nucleocapsid formation, and represents a promising breakthrough in achieving sustained viral control, potentially as part of combination therapeutic approaches. 48. Hepatitis B is intriguingly linked to alterations in lipid metabolism, with the virus affecting host lipidomes and contributing to the development of hepatic steatosis in some patients, serving as a substrate for further liver damage, and illustrating the necessity of an integrative approach to management that considers both antiviral strategies and interventions targeting dyslipidemia and metabolic syndromes. 49. The challenge of universal coverage with hepatitis B vaccination has led to initiatives enhancing global access to vaccines, including advocating for mandatory infant immunization policies and innovating low-cost vaccine production techniques to boost equitable distribution efforts, particularly in resource-limited settings, emphasizing the critical role of international collaboration in addressing global health disparities in HBV infection rates. 50. The intricate socioeconomic dimensions of hepatitis B impact not only individual health outcomes but also broader public health challenges, necessitating a comprehensive policy framework that addresses health inequities, enhances disease education, and promotes the integration of hepatitis B control measures into primary healthcare systems, ultimately aiming to mitigate the global burden and empower communities. 1. Gastric ulcers, a common form of peptic ulcers, occur when the protective mucosal lining of the stomach is damaged, most often due to Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, resulting in symptoms like burning stomach pain, bloating, and nausea, and are diagnosed through endoscopy and treated with proton pump inhibitors, antibiotics, and lifestyle modifications to reduce stress and dietary irritants. 2. Inflammatory bowel disease, IBD, encompassing Crohn's disease and ulcerative colitis, is characterized by chronic inflammation of the gastrointestinal tract, with Crohn's affecting any part from mouth to anus and ulcerative colitis limited to the colon and rectum, presenting with symptoms such as abdominal pain, diarrhea, weight loss, and fatigue, and requiring a combination of diagnostic imaging, endoscopic evaluation, and serological markers for diagnosis and management with anti-inflammatory drugs, immunosuppressants, and occasionally surgery. 3. Irritable bowel syndrome, IBS, a functional gastrointestinal disorder, manifests with symptoms of abdominal pain, bloating, diarrhea, and constipation, often triggered by stress, hormonal changes, or certain foods, but lacks structural abnormalities, making diagnosis reliant on exclusion of other conditions and Rome-IV criteria, with treatment focused on dietary modifications, stress management, and pharmacological agents such as fiber supplements, antispasmodics, and laxatives to alleviate symptoms and improve patient quality of life. 4. Celiac disease is an autoimmune disorder triggered by ingestion of gluten, a protein found in wheat, barley, and rye, leading to small intestinal villus atrophy and malabsorption, manifesting with symptoms like diarrhea, bloating, weight loss, and fatigue, and diagnosed through serologic testing for antibodies such as tissue transglutaminase IgA, with confirmation via duodenal biopsy. Strict lifelong adherence to a gluten-free diet is the cornerstone of treatment to alleviate symptoms and prevent complications such as osteoporosis and malignancy. 5. Gastroesophageal reflux disease, GERD, occurs when stomach acid frequently flows back into the esophagus, irritating its lining and leading to symptoms such as heartburn, regurgitation, and difficulty swallowing, often due to lower esophageal sphincter relaxation or hiatal hernia, and can cause complications like esophagitis or Barrett's esophagus if untreated. Diagnosis is based on clinical presentation, pH monitoring, and endoscopy, with lifestyle modifications, antacids, and proton pump inhibitors forming the backbone of treatment. 6. Acute pancreatitis, an inflammatory condition of the pancreas, is commonly caused by gallstones or alcohol intake, presenting with sudden onset severe epigastric pain radiating to the back, nausea, vomiting, and elevated serum amylase and lipase levels. It is diagnosed through clinical evaluation and imaging studies such as CT scan, and management involves supportive care with fluid resuscitation, pain control, and avoidance of oral intake to rest the pancreas, while addressing the underlying etiology to prevent future attacks. 7. Barrett's esophagus is a condition in which the normal squamous epithelium of the distal esophagus is replaced by columnar-lined epithelium due to chronic gastroesophageal reflux disease, GERD, increasing the risk for esophageal adenocarcinoma, and is often asymptomatic, diagnosed through endoscopic biopsy revealing intestinal metaplasia. Surveillance with periodic endoscopy and management of reflux through lifestyle modification and proton pump inhibitors are critical for reducing carcinoma risk. 8. Diverticulitis occurs when small bulging pouches, or diverticula, in the digestive tract lining become inflamed or infected, typically presenting with abdominal pain, fever, and altered bowel habits, often in the lower left quadrant, and a diet low in fiber and high in refined foods is a major risk factor. It is diagnosed with imaging such as CT scan, and treatment involves bowel rest, antibiotics, and dietary adjustments, with surgery reserved for recurrent or complicated cases. 9. Hepatitis, an inflammation of the liver, can be caused by viral infections, notably hepatitis A, B, C, D, and E, alcohol, drugs, or autoimmune disease, presenting with symptoms such as jaundice, abdominal pain, fatigue, and elevated liver enzymes, and diagnosis involves serological testing and liver function tests, with treatment tailored to the etiology, such as antiviral drugs for chronic viral hepatitis, abstinence from alcohol, immunosuppressants for autoimmune hepatitis, and lifestyle modifications to preserve liver function. 10. Gallstones, or cholelithiasis, are solid particles that form in the gallbladder from bile components, often due to supersaturation of cholesterol, biliary stasis, or increased bilirubin, and are largely asymptomatic but can cause biliary colic, cholecystitis, pancreatitis, or cholangitis if obstructive. Diagnosis is confirmed by ultrasound, and management ranges from observation to laparoscopic cholecystectomy, especially in symptomatic cases or complications. 11. Ulcerative colitis is a form of inflammatory bowel disease that specifically affects the colon and rectum, causing continuous colonic mucosal inflammation beginning in the rectum and extending proximally, with symptoms including bloody diarrhea, abdominal cramping, and urgency, diagnosed through colonoscopy and histopathological examination, and treated with aminosalicylates, corticosteroids, immunomodulators, and biologic agents to induce and maintain remission, with colectomy as a surgical option for refractory or complicated disease. 12. Crohn's disease is an inflammatory bowel disease that can affect any part of the gastrointestinal tract from mouth to anus, characterized by transmural inflammation, skip lesions, and complications such as strictures, fistulas, and abscesses, presenting with abdominal pain, diarrhea, weight loss, and nutritional deficiencies. Diagnosis is made through endoscopic evaluation, imaging, and biopsy, and management involves anti-inflammatory medications, biologics, nutritional support, and, when necessary, surgical intervention to manage complications or treatment resistance. 13. Hepatic encephalopathy is a complex neuropsychiatric syndrome resulting from liver dysfunction, often triggered by acute or chronic liver disease, marked by confusion, altered level of consciousness, and asterixis, due to buildup of neurotoxic substances like ammonia, and diagnosed clinically and supported by blood ammonia levels. Management focuses on reducing ammonia production and absorption with lactulose and antibiotics, addressing precipitating factors, and consideration of liver transplantation in severe or refractory cases. 14. Achalasia is a motility disorder of the esophagus characterized by failure of the lower esophageal sphincter to relax and absent or impaired peristalsis, leading to symptoms of progressive dysphagia for solids and liquids, regurgitation, and chest pain, with diagnostic confirmation via esophageal manometry, barium swallow, and endoscopy. Treatment options include pneumatic dilation, surgical myotomy, and pharmacologic therapies such as botulinum toxin injections to relieve obstruction and improve swallowing function. 15. Clostridioides difficile infection is a significant cause of antibiotic-associated diarrhea, resulting from disruption of normal colonic microbiota, typically due to broad-spectrum antibiotic use, leading to toxin-mediated colitis with symptoms of watery diarrhea, fever, and abdominal pain, confirmed by stool toxin assays or PCR. Management involves cessation of the offending antibiotic, initiation of oral vancomycin or fidaxomicin, and infection control measures, with fecal microbiota transplantation considered in recurrent cases. 16. Celiac disease requires lifelong adherence to a gluten-free diet to manage symptoms and prevent complications, as it is an autoimmune disorder where ingestion of gluten leads to small intestinal mucosal injury, malabsorption, and symptoms like diarrhea, anemia, and neurological issues, confirmed by serologic testing for specific antibodies and duodenal biopsy showing villus atrophy, with diligent dietary management necessary to improve patient outcomes and quality of life significantly. 17. Colorectal cancer screening, crucial for early detection and improved survival, involves methods such as fecal occult blood testing, fecal immunochemical tests, sigmoidoscopy, and colonoscopy beginning at age 45 to 50 for average-risk individuals, aiming to identify and remove precancerous polyps and detect cancer at an early, more treatable stage, with high-risk individuals requiring earlier and more frequent screening intervals based on personal or family history and genetic factors. 18. Wilson's disease is a rare genetic disorder characterized by excessive copper accumulation in the body due to defective hepatic copper transport, leading to hepatic, neurologic, and psychiatric manifestations, often with Kayser-Fleischer rings on examination, and diagnostic confirmation includes serum ceruloplasmin, 24-hour urinary copper excretion, liver biopsy, or genetic testing. It is managed with copper chelating agents such as D-penicillamine or trientine, and zinc therapy to prevent disease progression and maintain normal copper balance. 19. Portal hypertension, most commonly resulting from cirrhosis, is characterized by increased pressure in the portal venous system, leading to complications such as variceal bleeding, ascites, and hepatic encephalopathy, with diagnosis made by assessing clinical signs and using imaging modalities like Doppler ultrasound and hepatic venous pressure gradient measurement, while treatment aims at lowering portal pressure through beta blockers, endoscopic variceal ligation, TIPS, transjugular intrahepatic portosystemic shunt, and managing underlying liver disease. 20. Lactose intolerance is the inability to digest lactose, a sugar found in milk and dairy products, due to deficient levels of the enzyme lactase produced by the small intestine, resulting in symptoms like bloating, diarrhea, and abdominal pain after consuming lactose-containing foods, diagnosed by hydrogen breath test, lactose tolerance test, or lactase gene testing, and managed through dietary modifications, lactose-free products, and lactase enzyme supplements to improve symptoms and dietary tolerance. 21. Gastrointestinal bleeding can present as hematemesis, melena, or hematochezia, with upper GI bleeding most commonly caused by peptic ulcers, esophageal varices, and Mallory-Weiss tears, while lower GI bleeding often results from diverticulosis, colorectal cancer, or hemorrhoids. Diagnosis involves endoscopic evaluation, imaging, and laboratory tests assessing hematologic and coagulation status, while management depends on stabilization with intravenous fluids and blood products, endoscopic hemostatic procedures, and treating the underlying cause. 22. Dumping syndrome, often seen post-gastric surgery, occurs when ingested food moves too quickly from the stomach into the small intestine, causing early and late postprandial symptoms such as nausea, bloating, abdominal cramps, diarrhea, dizziness, and tachycardia, and is mitigated by dietary changes focusing on smaller, more frequent meals with reduced simple carbohydrates, along with medications to retard gastric emptying or surgery in refractory cases to restore normal gastric physiology. Zollinger-Ellison syndrome is a rare condition characterized by gastrin-secreting tumors, gastrinomas, situated primarily in the pancreas or duodenum, leading to hypersecretion of gastric acid, peptic ulcer disease, and diarrhea, with diagnosis supported by elevated fasting gastrin levels, stomach pH measurement, and imaging studies to locate gastrinomas. Treatment includes high-dose proton pump inhibitors to control acid secretion and surgical resection or somatostatin analogs for tumor management. 24. Giardiasis is a common protozoal infection of the small intestine caused by Giardia lamblia, transmitted by contaminated water or food, leading to symptoms such as diarrhea, flatulence, stomach cramps, and weight loss. Diagnosis is confirmed by stool examination for cysts or trophozoites, antigen detection, or PCR testing, and it is treated effectively with antiparasitic agents like metronidazole or tinidazole, emphasizing the importance of safe drinking water and hygienic practices to prevent transmission. 25. Hepatocellular carcinoma, the most common primary liver cancer, often arises in the background of chronic liver disease and cirrhosis secondary to hepatitis B or C infection, alcohol abuse, or non-alcoholic fatty liver disease, presenting insidiously with weight loss, jaundice, and abdominal mass. Diagnosis is achieved through a combination of imaging modalities like ultrasound or MRI and serum alpha-fetoprotein measurement, with treatment options ranging from surgical resection, transarterial chemoembolization, local ablative therapies, to systemic treatments including kinase inhibitors and immunotherapy. 26. Constipation, a common digestive complaint, is characterized by infrequent bowel movements or difficulty evacuating stools, often due to inadequate dietary fiber, fluid intake, physical inactivity, or medications, and can be functional or secondary to underlying disorders like irritable bowel syndrome or neurological conditions. Management includes dietary modifications to increase fiber and water, behavioral interventions to establish regular bowel habits, and pharmacological treatments such as laxatives, stool softeners, or prokinetic agents to relieve symptoms and ensure regular bowel activity. 27. Non-alcoholic fatty liver disease, NAFLD, is the hepatic manifestation of metabolic syndrome, characterized by fat accumulation in the liver, which can progress to non-alcoholic steatohepatitis, NASH, fibrosis, and cirrhosis, associated with obesity, diabetes, dyslipidemia, and hypertension. Diagnosis involves imaging studies like ultrasound or MRI, and serological testing to exclude other liver diseases, while management focuses on lifestyle modifications, including dietary changes, physical activity, weight loss, and pharmacologic interventions targeting insulin resistance and hepatic inflammation. 28. Gastric cancer, often adenocarcinoma, is a malignancy arising from the stomach lining, associated with risk factors such as Helicobacter pylori infection, smoking, dietary factors, and certain genetic syndromes, presenting with vague symptoms like abdominal pain, weight loss, nausea, and early satiety, typically diagnosed through endoscopy with biopsy and staging through CT or PET scans. Management depends on the stage and may involve surgical resection, chemotherapy, radiation, and targeted therapies, with a focus on early detection and intervention to improve prognosis. 29. Bile acid malabsorption can lead to chronic diarrhea and stearia due to excessive bile acids reaching the colon after conditions such as ileal resection, Crohn's disease, or idiopathic causes. Diagnosis is often clinical, supported by a CAT scan or response to bile acid sequestrants, and management involves dietary modifications alongside medications like cholestyramine or colesevelam to bind unabsorbed bile acids in the gastrointestinal tract and reduce diarrhea. 30. Appendicitis is the inflammation of the vermiform appendix, often due to obstruction by fecaliths or lymphoid hyperplasia, presenting acutely with periumbilical pain that localizes to the right lower quadrant, accompanied by nausea, vomiting, and fever, with diagnosis supported by clinical examination, laboratory tests, and imaging like ultrasound or CT scan. Surgical removal via appendectomy, typically performed laparoscopically, is the definitive treatment to prevent complications such as perforation and peritonitis. 31. Primary sclerosing cholangitis, PSC, is a chronic liver disease characterized by progressive inflammation and fibrosis of the bile ducts, leading to strictures, cholestasis, and eventual cirrhosis, often associated with inflammatory bowel disease, particularly ulcerative colitis. Diagnosis is confirmed using cholangiography revealing a beaded appearance of biliary ducts, and management focuses on symptom relief, monitoring for complications, and liver transplantation in advanced cases, as no specific curative medical therapy exists. (32) Hemochromatosis is an iron overload disorder, predominantly genetic, characterized by excessive intestinal iron absorption and deposition in various organs, leading to symptoms including fatigue, arthralgia, diabetes, and skin hyperpigmentation, with diagnosis confirmed by elevated serum ferritin, transferrin saturation, and genetic testing for HFE mutations, while management involves regular phlebotomy to normalize iron levels and prevent organ damage, with liver biopsy used to assess the extent of hepatic fibrosis or cirrhosis. 3.3. Intussusception is a condition where a segment of the bowel telescopes into an adjacent segment, commonly seen in infants, resulting in symptoms such as sudden abdominal pain, vomiting, and current jelly stools, with diagnosis often confirmed by ultrasound showing the characteristic target sign. Treatment may involve air or contrast enema reduction, which is both diagnostic and therapeutic, with surgical intervention necessary in cases of failed non-operative reduction or signs of bowel necrosis or perforation. 34. Esophageal cancer, most commonly squamous cell carcinoma or adenocarcinoma, presents with progressive dysphagia, weight loss, odynophagia, and hoarseness, primarily affecting men over women, and associated with risk factors like tobacco use, alcohol consumption, Barrett's esophagus, and achalasia. Diagnosis requires endoscopy with biopsy and imaging for staging, while treatment varies by stage, including surgical resection, chemoradiotherapy, and palliative care to manage symptoms and improve quality of life. 35. Gastric polyps are growths found on the stomach lining, often discovered incidentally during endoscopy, and can be non-neoplastic, such as hyperplastic polyps, or neoplastic, like adenoma, with potential to progress to cancer. Management involves histological assessment via biopsy, with surveillance and removal of neoplastic polyps, especially those with high-grade dysplasia, to prevent malignant transformation, alongside evaluation for underlying conditions such as chronic gastritis or atrophic gastritis. 36. Steatohepatitis, characterized by liver inflammation and damage due to lipid accumulation, is an intermediate stage between simple fatty liver and cirrhosis, commonly seen in alcohol abuse, alcoholic steatohepatitis, or as part of non-alcoholic fatty liver disease, NAFLD, diagnosed through liver function tests and imaging showing fat infiltration, possibly confirmed with biopsy. Management focuses on lifestyle adjustments like weight reduction and abstinence from alcohol or steatosis-inducing agents to halt progression and prevent cirrhosis. 37. Intestinal obstruction can be caused by mechanical factors such as adhesions, hernias, or neoplasms, or functional issues like ileus, resulting in symptoms of abdominal pain, vomiting, distension, and constipation. Diagnosis is based on clinical examination and imaging, particularly abdominal X-ray or CT scan showing dilated bowel loops, air fluid levels, and potential transition points, while management often requires hospitalization for fluid and electrolyte replacement, bowel rest, and surgery when indicated, particularly in complete or strangulated obstructions. 38. Dyspepsia, often known as indigestion, encompasses chronic or recurrent upper abdominal discomfort or pain, typically related to eating, and may be functional, peptic ulcer related, or indicative of underlying biliary or pancreatic disorders. Diagnosis involves clinical evaluation, exclusion of alarm features, and possible endoscopy, with treatment consisting of lifestyle adjustments, dietary changes, and pharmacologic agents such as acid suppressants or prokinetics, tailored to patient response and underlying etiology. 39. Eosinophilic esophagitis is a chronic immune-mediated disease characterized by eosinophil infiltration in the esophagus, leading to symptoms like dysphagia and food impaction, triggered by food allergens or environmental factors. Diagnosis is confirmed by endoscopic findings of rings or furrows and a high eosinophil count in esophageal biopsies, with management involving dietary elimination, proton pump inhibitors, and topical corticosteroids to reduce inflammation and prevent structural changes in the esophagus. 40. Gastric emptying disorders, such as gastroparesis, involve delayed gastric emptying without an obstructive cause, leading to symptoms of nausea, vomiting, early satiety, and bloating, often associated with diabetes mellitus, post-surgical conditions, or idiopathic origins. Diagnosis requires gastric emptying scintigraphy to measure retention, and treatment focuses on dietary modifications, glycemic control in diabetic patients, and medications like prokinetics or antiemetics to manage symptoms effectively and enhance gastric motility. 41. Peritonitis, an inflammation of the peritoneum, usually due to bacterial infection from gastrointestinal perforation, rupture of an abdominal organ, or dialysis complications, presents with severe abdominal pain, tenderness, rigidity, and systemic symptoms like fever or shock, diagnosed by clinical examination and supported by laboratory tests and imaging. Prompt treatment involves broad-spectrum antibiotics and often surgical intervention to address the underlying cause and drain infectious material or perform necessary repairs. 42. Hepatorenal syndrome is a functional kidney failure complication associated with severe liver disease like cirrhosis, characterized by intense renal vasoconstriction and reduced renal perfusion, with criteria for diagnosis including cirrhosis with ascites and exclusion of other causes of renal dysfunction. Management includes addressing precipitating factors, using vasoconstrictors to improve renal function, and considering liver transplantation when feasible to provide long-term resolution through improved liver function. 43. Short bowel syndrome results from extensive surgical resection of the small intestine, causing malabsorption, diarrhea, and malnutrition due to insufficient intestinal absorptive surface, necessitating a multidisciplinary approach involving dietary adjustments, vitamin and mineral supplementation, and medications such as antidiarrheals or proton pump inhibitors. In severe cases, patients may require parenteral nutrition or surgical interventions like bowel lengthening procedures to improve nutritional status and quality of life. 44. Hemorrhoids are swollen vascular structures in the anal canal, often associated with increased intra-abdominal pressure from straining during defecation or prolonged sitting, manifesting as rectal bleeding, pain, pruritus, and palpable masses, classified into internal or external hemorrhoids based on location. Management includes dietary modifications to increase fiber intake, topical treatments, sclerotherapy, rubber band ligation, and surgical hemorrhoidectomy for persistent or complicated cases requiring resolution. 45. Mesenteric ischemia, involving reduced blood flow to the intestines, can be acute due to arterial embolism, thrombosis, or chronic from atherosclerotic disease. It presents with severe abdominal pain, particularly postprandial in chronic cases, often coupled with fear of eating leading to significant weight loss. Diagnosis relies on a combination of clinical suspicion, laboratory tests, and imaging modalities such as CT angiography, while management involves prompt revascularization, anticoagulation, and surgical intervention tailored to the underlying cause and clinical stability of the patient. 46. Diverticulosis refers to the presence of diverticula in the colon, often asymptomatic but identified incidentally during imaging or colonoscopy, related to increased intraluminal pressure and chronic low-fiber diet. While benign, they can lead to complications such as diverticulitis or bleeding, with management emphasizing dietary fiber intake to prevent progression and regular monitoring for symptoms indicating complications, which may need further medical or surgical intervention. 47. Autoimmune hepatitis is a chronic inflammatory liver disease characterized by immune-mediated hepatocytic injury, with diagnostic features including elevated liver enzymes, positive serology for autoimmune antibodies, such as ANA, SMA, or LKM1, and liver biopsy showing interface hepatitis with lymphoplasmacytic infiltrate. Treatment requires immunosuppression, typically starting with corticosteroids like prednisone, often in combination with azathioprine, to induce and maintain remission and prevent disease progression to cirrhosis or liver failure. 48. Gastroparesis, often idiopathic or associated with underlying conditions like diabetes mellitus, involves delayed gastric emptying leading to symptoms such as nausea, vomiting, early satiety, and bloating without mechanical obstruction. Diagnosis is confirmed by gastric emptying scintigraphy and exclusion of structural causes, with management focused on dietary modifications, glycemic control, prokinetic medications like metoclopramide, and symptomatic relief through antiemetics or gastric electrical stimulation in refractory cases. (49) SIBO, small intestinal bacterial overgrowth, is characterized by an increased number or alteration of bacteria in the small intestine, leading to symptoms like bloating, diarrhea, abdominal pain, and malabsorption. Diagnosis involves breath tests, such as lactulose or glucose, and treatment includes antibiotics such as rifaximin or metronidazole, probiotics, and addressing underlying anatomical or motility disorders to prevent recurrence and maintain a balanced gut microbiome. (50) Pyloric stenosis, typically seen in infants, involves hypertrophy of the pyloric muscle, causing gastric outlet obstruction with projectile vomiting, dehydration, and failure to thrive, diagnosed through ultrasound revealing elongation and thickening of the pylorus. Treatment is surgical, with pyloromyotomy to relieve obstruction and restore normal feeding and hydration status, emphasizing the importance of early recognition and intervention to prevent severe electrolyte imbalances and nutritional deficits. 1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. 2. Understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. 3. The diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. 4. Medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. 5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. 7. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. 8. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. 9. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. 11. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. 12. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. 13. Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. 14. The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. 15. Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. 16. Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. 17. Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. 18. The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. 19. Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. 20. The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. 21. Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. 22. The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. 23. Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. 39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. 41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. A cerebral aneurysm is a localized dilation in a blood vessel within the brain, often forming at artery junctions due to intrinsic weaknesses in the vessel wall that can be exacerbated by conditions like hypertension and atherosclerosis, raising the risk of rupture, which can lead to a potentially life-threatening hemorrhagic stroke. The rupture of a cerebral aneurysm results in a subarachnoid hemorrhage, characterized by a sudden, severe headache often described as a thunderclap or worst headache of life, due to the rapid increase in intracranial pressure, with symptoms potentially including neck stiffness, photophobia, nausea, vomiting, and impaired consciousness. Many cerebral aneurysms remain asymptomatic until rupture, but unruptured aneurysms may occasionally cause symptoms by pressing on surrounding brain tissue or nerves, potentially leading to focal neurological deficits such as vision changes, pain above or behind an eye, or numbness on one side of the face. The pathophysiology of cerebral aneurysms involves a complex interplay of genetic factors, hemodynamic stress, inflammation, and extracellular matrix remodeling that weakens the blood vessel wall, primarily affecting the internal elastic lamina and media layers, making the vessel more prone to dilation and rupture. Five. The gold standard for diagnosing cerebral aneurysms non-invasively is magnetic resonance angiography, MRA, or computed tomography angiography, CTA, which provides detailed images of blood vessels in the brain, allowing clinicians to identify even small aneurysms and assess their size, shape, and location. Six. Risk factors for the development and rupture of cerebral aneurysms include smoking, hypertension, family history, age over 40, female gender, alcohol abuse, and certain genetic disorders such as polycystic kidney disease or Ehlers-Danlos syndrome, which can contribute to connective tissue weaknesses. 7. Management of unruptured cerebral aneurysms involves a careful balance between regular monitoring and surgical intervention, with decisions influenced by the size, location, morphology of the aneurysm, and patient-related factors such as age, health status, and risk tolerance, to minimize potential rupture complications. 8. Endovascular coiling is a minimally invasive procedure commonly used to treat cerebral aneurysms by inserting a catheter through the blood vessels to the site of the aneurysm, where detachable coils are placed to induce clotting, effectively sealing off the aneurysm and reducing the likelihood of rupture. 9. Surgical clipping of a cerebral aneurysm involves an open craniotomy to access the aneurysm directly, allowing a neurosurgeon to place a metal clip at the neck of the aneurysm, thereby isolating it from the parent vessel, which is a more invasive but often definitive treatment compared to endovascular techniques. The choice between coiling and clipping may depend on various factors, such as the aneurysm's size, shape, and location, as well as the patient's overall health and the availability of experienced surgical and endovascular teams, with both methods having their unique risks and benefits in terms of efficacy and recovery. 11. Cerebral vasospasm is a potential complication following the rupture of a cerebral aneurysm, where the sudden release of blood into the subarachnoid space leads to narrowing of cerebral arteries, which can significantly reduce blood flow and cause further brain injury, often peaking 3 to 14 days after the initial hemorrhage. 12. Nimodipine, a calcium channel blocker, is routinely administered orally in the acute management of subarachnoid hemorrhage from a ruptured cerebral aneurysm to prevent or mitigate the effects of cerebral vasospasm and associated ischemic deficits, despite its hypotensive effect requiring cautious monitoring of blood pressure. 13. The Hunt and Hess scale and the World Federation of Neurosurgical Societies, WFNS, scale are clinical grading systems used to assess the severity of aneurysmal subarachnoid hemorrhage, helping to predict outcomes by evaluating factors like the patient's level of consciousness, presence of focal neurological deficits, and overall clinical condition. 14. The Fisher scale, based on the amount and distribution of blood seen on initial CT scans, is used to grade subarachnoid hemorrhage from a ruptured cerebral aneurysm, offering prognostic information regarding the likelihood of vasospasm, with higher grades indicating an increased risk and need for vigilant monitoring and intervention. 15. Seizures may occur after the rupture of a cerebral aneurysm due to the acute brain injury and cortical irritation caused by subarachnoid hemorrhage or increased intracranial pressure, necessitating prophylactic or therapeutic anticonvulsant medication in some patients to manage and prevent further neurological complications. 16. Genetic testing for individuals with familial history of cerebral aneurysms may help identify underlying hereditary factors, especially in cases of connective tissue disorders like Marfan syndrome, providing insights into potential predispositions and enabling proactive monitoring or early intervention to manage increased rupture risks. 17. Acute management of a ruptured cerebral aneurysm focuses on stabilizing the patient's condition through airway management, blood pressure control, intracranial pressure monitoring, and potentially early surgical intervention to prevent rebleeding and manage complications that could worsen patient outcomes. 18. Secondary complications like hydrocephalus, an accumulation of cerebrospinal fluid due to impaired reabsorption following subarachnoid hemorrhage, may require the placement of a temporary external ventricular drain or a permanent ventriculoperitoneal shunt to alleviate pressure in the ventricles, preventing further damage to brain tissue. 19. Lifestyle modifications, including smoking cessation, alcohol moderation, regular blood pressure monitoring, and a heart-healthy diet, are recommended for individuals at risk of cerebral aneurysms to reduce modifiable risk factors associated with aneurysm development and rupture, contributing to improved long-term outcomes. 20. High-resolution vessel wall imaging using MRI can provide insights into the morphology and histopathology of cerebral aneurysms, allowing the visualization of intraluminal thrombus, aneurysm wall inflammation, or instability, thus helping in the stratification of rupture risk and guiding clinical management decisions. 21. Computational fluid dynamics is an emerging tool that allows the assessment of hemodynamic forces at play within and around cerebral aneurysms, providing valuable data on flow patterns that may influence aneurysm growth and rupture risk, and can aid in the customization of treatment approaches or the development of new interventions. 22. The role of inflammation in cerebral aneurysm pathogenesis is under active research, with evidence suggesting that an inflammatory response within the aneurysm wall contributes to wall degeneration and rupture, highlighting potential therapeutic targets for anti-inflammatory agents that could stabilize aneurysms or slow their progression. 23. In the acute phase of cerebral aneurysm rupture, managing intracranial pressure is paramount, often requiring sedation, hyperosmolar therapy, and careful ventilation strategies to ensure adequate cerebral perfusion, while avoiding interventions that could exacerbate swelling or lead to secondary brain injury. 24. Advances in endovascular technology, such as flow-diverting stents, provide alternatives for treating wide-necked or complex cerebral aneurysms, working by redirecting blood flow away from the aneurysm sac, promoting healing and vessel remodeling, and broadening the options for minimally invasive treatment. 25. The size and shape of a cerebral aneurysm are critical determinants in assessing rupture risk, with large, greater than 7 mm, and irregularly shaped aneurysms are those exhibiting daughter sacs, carrying a higher propensity for rupture compared to small, smooth-walled aneurysms, which may warrant closer monitoring or more immediate intervention. 1. Dyslipidemia, primarily characterized by abnormal lipid levels in the bloodstream, often involves elevated levels of low-density lipoprotein cholesterol, LDLC, reduced high-density lipoprotein cholesterol, HDLC, and increased triglycerides, fostering a conducive environment for atherosclerosis development, thus increasing the risk for coronary artery disease and cerebrovascular incidents. 2. The pathophysiology of dyslipidemia largely involves the dysregulation of lipid metabolism, which is influenced by genetic predispositions, lifestyle factors, and underlying conditions such as obesity, insulin resistance, and chronic kidney disease, all contributing to an imbalance in lipid transport and synthesis. 3. Clinical diagnosis of dyslipidemia typically requires a fasting lipid panel, assessing total cholesterol, LDL-C, HDL-C, and triglycerides, where variations suggest potential lipoprotein metabolism disorders, confirming a need for further investigation or intervention. 4. Statins, as HMG-CoA reductase inhibitors, represent the cornerstone of dyslipidemia treatment, effectively reducing LDL-C levels, stabilizing atherosclerotic plaques, and ultimately decreasing cardiovascular morbidity and mortality rates in patients with high cholesterol. Five. Lifestyle modifications, including a heart-healthy diet rich in omega-3 fatty acids, regular physical activity, maintenance of a healthy weight, and smoking cessation, are fundamental components of dyslipidemia management, aimed at enhancing lipid profiles and reducing associated cardiovascular risks. 6. Genetic factors play a critical role in dyslipidemia, with familial hypercholesterolemia being a notable genetic disorder characterized by mutations in the LDL receptor gene, leading to severely elevated LDL-C levels and an increased propensity for premature cardiovascular disease. 7. Emerging therapies for dyslipidemia, such as monoclonal antibodies targeting proprotein convertase subtilisin, Cushing type 9, PCSK9 inhibitors, provide a novel mechanism for dramatically lowering LDL-C levels by enhancing the liver's ability to clear circulating LDL particles. 8. The relationship between dyslipidemia and inflammation has been increasingly recognized, with studies suggesting that systemic inflammation, as measured by markers such as C-reactive protein, may exacerbate cholesterol-driven atherosclerosis and contribute to adverse cardiovascular events. 9. Non-alcoholic fatty liver disease, NAFLD, is frequently associated with dyslipidemia due to lipid accumulation in hepatocytes, which may further exacerbate insulin resistance, creating a vicious cycle that promotes metabolic syndrome and cardiovascular complications. 10. Dyslipidemia is not limited to adult populations, as children and adolescents are increasingly diagnosed with lipid disorders, often linked to obesity, sedentary lifestyles, and poor dietary habits, warranting early intervention to prevent lifelong cardiovascular disease risk. 11. Apolipoproteins, such as ApoB and ApoAI, play critical roles in lipoprotein structure and function, where ApoB is associated with atherogenic particles like LDL, while ApoAI is the primary apolipoprotein of HDL, highlighting the significance of apolipoprotein ratios in evaluating dyslipidemia's cardiovascular risk. 12. The role of lipoprotein A or Lp(a) in dyslipidemia and cardiovascular disease is gaining attention, as elevated levels are genetically determined and contribute to atherogenesis and thrombosis, making it a challenging target for therapeutic intervention. 13. Advanced lipid testing, which includes assessment of lipoprotein particle size and number, can offer additional insights into cardiovascular risk by differentiating between small, dense LDL particles known to be more atherogenic and larger, less harmful ones. 14. Diabetes mellitus significantly augments the risk of dyslipidemia, often characterized by a triad of elevated triglycerides, low HDL-C, and predominance of small dense LDL particles, necessitating aggressive lipid management to mitigate cardiovascular risk. 15. The interplay between hypothyroidism and dyslipidemia is well established, as reduced thyroid hormone levels can diminish lipid clearance, leading to elevated cholesterol and triglyceride levels, thereby necessitating thyroid function assessment in patients presenting with lipid abnormalities. 16. Dyslipidemia in postmenopausal women is frequently observed due to hormonal changes, particularly reduced estrogen levels, which impact hepatic lipoprotein metabolism, leading to elevated LDL-C and decreased HDL-C levels, increasing cardiovascular disease incidence. 17. The Mediterranean diet, characterized by high intake of fruits, vegetables, whole grains, and healthy fats such as olive oil, has been shown to significantly improve lipid profiles in individuals with dyslipidemia, thereby reducing cardiovascular disease risks. 18. Secondary causes of dyslipidemia should always be considered, including conditions such as nephrotic syndrome, hypothyroidism, alcohol use, and medications like corticosteroids and beta blockers, as managing these underlying issues can improve lipid levels. 19. Dyslipidemia is often a silent condition, lacking obvious symptoms until the occurrence of significant cardiovascular events such as myocardial infarction or stroke, underscoring the importance of regular screening and proactive management in at-risk populations. 20. Regular physical activity is one of the most effective lifestyle interventions in managing dyslipidemia, as aerobic exercise helps increase HDL-C and decrease triglycerides, while also reducing visceral fat and improving overall cardiovascular health. 21. Polyphenol-rich foods, such as berries, dark chocolate, and red wine, contain bioactive compounds that have been shown to favorably influence lipid levels by reducing cholesterol absorption and oxidative stress, providing adjunctive benefits in dyslipidemia management. 22. Omega-3 fatty acids, abundant in fatty fish like salmon and mackerel, play a crucial role in reducing serum triglyceride levels and exerting cardiovascular protective effects, making them a beneficial dietary addition for individuals with hyperlipidemia. 23. Dyslipidemia is a critical component of metabolic syndrome, a cluster of conditions that include hypertension, insulin resistance, and abdominal obesity, collectively elevating the risk of developing type 2 diabetes and cardiovascular diseases. 24. Niacin, also known as vitamin B3, can significantly elevate HDL-C levels and lower triglycerides, although its use in clinical practice has declined due to the development of more effective and better tolerated lipid-lowering medications like statins and PCSK9 inhibitors. 25. Dyslipidemia management in chronic kidney disease is challenging due to altered lipoprotein metabolism, with patients commonly exhibiting elevated triglycerides and low HDL-C, necessitating careful selection of lipid-lowering therapies to avoid further renal impairment. 26. The role of coenzyme Q10 in dyslipidemia management remains controversial, as some studies suggest it may help mitigate the myalgic side effects of statin therapy, thereby potentially enhancing patient adherence to lipid-lowering medications. 27. Phytosterols, naturally occurring compounds found in plant-based foods, effectively lower LDL-C levels by competing with cholesterol absorption in the intestinal tract, offering a natural adjunct to conventional dyslipidemia therapies. 28. Dyslipidemia in pregnancy can be physiologically normal due to hormonal changes. However, severely elevated lipid levels may require intervention, especially if they pose additional risks such as gestational diabetes or preeclampsia. 29. Clinicians should consider the atherogenic index of plasma, AIP, calculated as the logarithm of the ratio between plasma triglycerides and HDL-C, as a predictive marker for cardiovascular risk assessment in patients with dyslipidemia. 30. 30. Dyslipidemia is a prevalent comorbidity in chronic inflammatory conditions, such as rheumatoid arthritis and psoriasis, where systemic inflammation exacerbates lipid abnormalities, prompting integrated approaches for cardiovascular risk reduction in these populations. 31. Statin intolerance, whether due to muscle-related side effects or biochemical abnormalities, remains a significant barrier in dyslipidemia management, necessitating alternative therapies such as ezetimibe, bile acid sequestrants, or PCSK9 inhibitors to achieve lipid targets. 32. Monoclonal antibodies against PCSK9 represent a breakthrough in dyslipidemia treatment, especially for familial hypercholesterolemia patients unable to achieve target LDL-C levels despite maximal statin therapy, highlighting personalized approaches in lipid management. 3. The liver plays a central role in lipid regulation, and conditions such as cirrhosis or hepatitis can drastically alter lipid profiles, often resulting in atypical presentations of dyslipidemia that require specialized diagnostic and therapeutic strategies. 34. Investigations into the gut microbiome's impact on lipid metabolism suggest that specific microbial compositions can influence lipid levels, opening novel avenues for dyslipidemia treatment through probiotics or dietary modifications aimed at beneficial gut flora alterations. 35. Bempedoic acid offers a non-statin alternative for dyslipidemia management, particularly beneficial for patients intolerant to statins, as it lowers LDL-C by inhibiting ATP citrate lyase, an enzyme involved in the biosynthesis of cholesterol and fatty acids. 36. Alcohol consumption impacts lipid profiles, where moderate intake of certain types, like red wine with resveratrol, may confer cardiovascular benefits, while excessive alcohol can exacerbate dyslipidemia by raising triglyceride levels and contributing to hepatic steatosis. 37. Proprotein convertase subtilisin Cushing type 9, PCSK9 inhibitors have revolutionized the treatment landscape for dyslipidemia, providing a powerful option for significantly reducing LDL cholesterol levels, especially in patients with genetic lipid disorders like familial hypercholesterolemia. 38. Dyslipidemia plays a critical role in cerebrovascular disease pathogenesis, where elevated cholesterol levels contribute to the formation and progression of carotid artery plaques, increasing the risk for ischemic stroke and necessitating aggressive lipid management. 39. Hemoglobin A1c, traditionally used for diabetes management, can be a useful additional marker in assessing cardiovascular risk in patients with dyslipidemia, as hyperglycemia exacerbates lipid abnormalities and accelerates atherogenesis. 40. Lipid-lowering therapies in elderly patients with dyslipidemia require careful consideration of comorbidities and potential polypharmacy, balancing the benefits of cardiovascular risk reduction with the risks of adverse drug interactions and side effects. 41. Lipoprotein-lowering strategies targeting very low-density lipoprotein, VLDL, are crucial in managing dyslipidemia associated with hypertriglyceridemia, given VLDL's role in triglyceride transport and its contribution to atherogenic remnant particle formation. 42. Dyslipidemia is intricately linked with hypertension, as elevated cholesterol levels contribute to endothelial dysfunction and arterial stiffness, further exacerbating cardiovascular risk and necessitating integrated management approaches. 43. Recent advancements in genetic testing allow for more precise identification of dyslipidemia subtypes, particularly in familial hypercholesterolemia, enabling personalized treatment plans and enhanced risk stratification for patients and their families. 44. Comprehensive cardiovascular disease prevention in patients with dyslipidemia includes optimizing other risk factors such as hypertension and diabetes management, reinforcing the importance of a holistic approach to reduce overall cardiovascular morbidity and mortality. #45. Psychological factors, including stress, have been shown to impact lipid profiles adversely, potentially aggravating dyslipidemia through increased cortisol levels and promoting unhealthy lifestyle behaviors, highlighting the need for stress management interventions. #46. Dyslipidemia influences the pathogenesis of chronic endothelial injury, wherein excess circulating lipids lead to oxidative stress and endothelial cell dysfunction, forming the initial step in atherogenesis and necessitating interventions aimed at restoring vascular health. #47. Vitamin D's potential role in dyslipidemia management continues to be explored, given its involvement in various metabolic processes, although evidence remains mixed regarding its ability to significantly alter lipid profiles or improve cardiovascular outcomes. #48. The pharmacogenomics of statin therapy in dyslipidemia is an evolving field, providing insights into genetic factors that may influence statin metabolism and response, guiding personalized medication strategies to optimize efficacy and minimize adverse effects. #49. Dyslipidemia is an important modifiable risk factor in cancer development, as elevated lipid levels contribute to chronic inflammation and oxidative stress, fostering an environment conducive to oncogenesis, thereby necessitating integrated preventive efforts in high-risk populations. #50. The concept of residual cardiovascular risk in dyslipidemia management emphasizes that despite achieving optimal LDL-C levels, patients may still suffer cardiovascular events, prompting research into other potential targets, such as triglycerides and lipoprotein (A), for comprehensive risk reduction. #1. Chronic obstructive pulmonary disease, COPD, is a progressive inflammatory lung disease characterized by obstructed airflow from the lungs due to emphysema and chronic bronchitis, which makes it a significant cause of morbidity and mortality worldwide, with smoking identified as the primary risk factor but also including genetic predispositions such as alpha-1 antitrypsin deficiency. #2. In COPD, the small airways become narrowed and the alveolar walls are destroyed, a phenomenon known as emphysema, which traps air during expiration and leads to hyperinflation of the lungs, making it hard for the patient to exhale completely, causing chronic airflow limitation and dramatically impairing quality of life. #3. COPD diagnosis is confirmed through spirometry, which measures the forced expiratory volume in 1 second, FEV1, and the forced vital capacity, FVC, resulting in a reduced FEV1-FVC ratio that is not significantly reversible with bronchodilators, indicating a persistent obstructive pattern. #4. The hallmark symptoms of COPD include chronic and progressive dyspnea, persistent cough often with sputum production, and wheezing, with exacerbations characterized by an increase in symptom intensity, often triggered by infections or environmental pollutants, thereby significantly impacting patient well-being. #5. Long-term exposure to noxious gases and particulate matter, primarily from cigarette smoke and occupational exposure to dust and chemicals, accounts for the majority of COPD cases, but recent research is exploring the role of indoor air pollution from biomass fuels used in cooking and heating, especially in developing countries. #6. Pulmonary rehabilitation is a cornerstone in the management of COPD, comprising of exercise training, education, and psychological support, which aims to improve the physical and emotional condition of people with respiratory diseases and empower them to better manage their symptoms. 7. Pharmacological treatments for COPD focus on relieving symptoms and preventing exacerbations, with bronchodilators like long-acting beta agonists, LABAs, and long-acting muscarinic antagonists, LAMAs, being first-line therapies, often used in combination to maximize dilation of airways and improve lung function. 8. In COPD, systemic corticosteroids are used during acute exacerbations to reduce inflammation and improve lung function, although chronic use is limited due to potential side effects, so maintenance therapy often involves inhaled corticosteroids in conjunction with bronchodilators for patients with frequent exacerbations. 9. Emerging treatments for COPD include the use of phosphodiesterase 4 inhibitors such as roflumilast, which works by reducing inflammation in the airways and has been shown to decrease the frequency of exacerbations in patients with severe COPD and chronic bronchitis. 10. In COPD pathophysiology, the process of oxidative stress plays a pivotal role wherein the imbalance between oxidants and antioxidants within the lungs leads to tissue damage, ongoing inflammation, and further degradation of lung function, reinforcing the progression of the disease. 11. The destruction of elastic fibers in the alveolar walls in COPD is largely mediated by enzyme systems such as matrix metalloproteinases (MMPs) and neutrophil elastase, which become overactive due to chronic inflammation and contribute to the loss of lung elasticity and alveolar integrity. 12. Genetic factors in COPD play a crucial role, with the most well-documented being the deficiency of alpha-1 antitrypsin, a protein that protects lung tissue from enzyme-induced damage, and individuals with severe deficiency are at a much higher risk of developing COPD regardless of smoking status. 13. Imaging studies such as chest X-rays and computed tomography (CT) scans are used in COPD to assess for evidence of hyperinflation, increased lung volume, and possible complications like pneumothorax, with CT scans providing greater detail in visualizing emphysematous changes and bulli in the lungs. 14. The chronic inflammation in COPD is predominantly neutrophilic, contrasting with the eosinophilic inflammation commonly seen in asthma, which results in different pathophysiological mechanisms and therapeutic responses, highlighting the intricate immune dysregulation present in COPD. 15. Comorbidities frequently associated with COPD include cardiovascular diseases, osteoporosis, metabolic syndrome, anxiety, and depression, all of which severely affect the health status and quality of life of patients, warranting a comprehensive and multidisciplinary approach to management. 16. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a framework for the diagnosis, management, and prevention of COPD by categorizing the disease based on the severity of airflow limitation, symptom burden, and frequency of exacerbations, offering a personalized approach to treatment. 17. Oxygen therapy is a life-saving intervention for COPD patients with chronic respiratory failure, particularly those with resting hypoxemia, as it improves survival by preventing the harmful effects of chronic hypoxia and relieving some of the physiological stress on the cardiovascular system. 18. Smoking cessation remains the most effective strategy in slowing the progression of COPD, and nicotine replacement therapy, varenicline, and bupropion have been shown in clinical trials to increase the rates of sustained abstinence from smoking, thereby preserving lung function and improving long-term outcomes. 19. Lung volume reduction surgery, LVRS, can be considered for selected patients with severe emphysema-dominant COPD, as it reduces hyperinflation and improves lung mechanics, leading to better respiratory function and quality of life, although careful patient selection is crucial due to the associated surgical risks. 20. The impact of air pollution on COPD exacerbations is significant, with exposure to pollutants such as nitrogen dioxide, sulfur dioxide, and particulate matter leading to increased hospital admissions and mortality rates among COPD patients, emphasizing the importance of improving air quality through public health initiatives. The use of non-invasive ventilation (NIV) during acute COPD exacerbations with hypercapnic respiratory failure can significantly reduce the need for intubation, improve gas exchange, and decrease mortality, making it an essential tool in the acute management of severe exacerbations. Patients with COPD often experience muscle wasting and weakness, particularly in the lower limbs, which is attributed to a combination of systemic inflammation, inactivity, altered muscle metabolism, and nutritional deficits, necessitating targeted interventions such as strength training and nutritional support. Advanced COPD often leads to pulmonary hypertension due to chronic hypoxic vasoconstriction, which results in remodeling of the pulmonary vasculature and increased pressure in the pulmonary arteries, eventually leading to right-sided heart failure or cor pulmonale. In the progression of COPD, the concept of the phenotypic approach is gaining traction, recognizing that patients might have differing prevalent symptoms and pathophysiological characteristics, such as asthma-COPD overlap, ACO, which requires specific diagnostic and therapeutic strategies. Exacerbation prevention in COPD relies heavily on vaccination, with annual influenza vaccination and pneumococcal vaccines being recommended as they significantly reduce hospitalization rates and improve survival by protecting against respiratory infections that can precipitate exacerbations. In COPD, the mucus hypersecretion seen in chronic bronchitis results from an overproduction of mucus by enlarged goblet cells and submucosal glands in response to chronic irritation and inflammation, which contributes to airway obstruction and chronic cough in affected individuals. Regular physical activity is associated with improved exercise tolerance and quality of life in people with COPD, as well as reduced risk of hospital readmissions after exacerbations, underscoring the importance of incorporating physical activity into the routine management plan for these patients. Bronchoscopic lung volume reduction is a minimally invasive alternative to surgical interventions in COPD, using devices such as endobronchial valves to occlude airways in targeted areas of emphysematous lungs, achieving volume reduction and improved ventilatory efficiency. Hospital-at-home programs for managing COPD exacerbations have shown to be as effective as hospital care in appropriately selected patients, providing benefits such as reduced healthcare costs, improved patient satisfaction, and a lower risk of acquiring hospital-associated infections. Digital health technologies, including telemedicine, remote monitoring, and wearable devices, are increasingly being integrated into the management of COPD, offering opportunities for continuous monitoring of physiological parameters, patient education, and timely intervention, potentially reducing exacerbation rates. The role of long-term antibiotics in preventing COPD exacerbations is being explored through the use of agents such as macrolides, which have anti-inflammatory properties and have been shown to reduce exacerbation frequency in certain patients with frequent and severe exacerbations. Dysregulated repair mechanisms in COPD lead to structural changes in the airways and alveoli, including airway wall thickening and fibrosis, which contribute to the disease's chronic and progressive nature, highlighting the need for therapies targeting these underlying pathological processes. . 3. Recognition of the single nucleotide polymorphisms, SNPs, associated with COPD susceptibility has opened the door to personalized medicine approaches and could lead to tailored preventive and therapeutic strategies specific to individual genetic profiles in the future. 34. COPD profoundly affects the systemic circulation, leading to extrapulmonary manifestations such as atherosclerosis and an increased risk of cardiovascular events, mediated by systemic inflammation, oxidative stress, and alterations in lipid metabolism, requiring cardiovascular risk assessment in COPD management. 35. Bacterial colonization of the lower airways is common in COPD due to compromised host defenses, contributing to chronic inflammation and exacerbations, with common colonizers including Haemophilus influenzae, Streptococcus pneumoniae, and Moraxella catarrhalis. 36. Cognitive impairment, including deficits in attention, memory, and executive function, has been observed in patients with COPD, possibly due to chronic hypoxia, systemic inflammation, and the presence of comorbid depression, impacting daily functioning and quality of life. 37. The economic burden of COPD is substantial, with direct costs related to medical visits, hospitalizations, and medications, while indirect costs arise from lost productivity and premature mortality, making it imperative to implement cost-effective preventive and management strategies. 38. Mitochondrial dysfunction is implicated in COPD pathogenesis, where oxidative stress and inflammation lead to impaired energy metabolism and cell death in pulmonary tissues, suggesting potential therapeutic targets focusing on mitochondrial health to slow disease progression. 39. In COPD, breathlessness is exacerbated by dynamic hyperinflation, where the increased end expiratory lung volume due to expiratory flow limitation and gas trapping during physical activity leads to increased respiratory workload and early onset of dyspnea. 40. The use of biomarkers in COPD, such as blood eosinophil counts and exhaled nitric oxide levels, is being researched to better stratify patients in personalized therapy, as they may help predict response to inhaled corticosteroids and other targeted treatments. 41. The development of fibrosis in the small airways in COPD contributes to fixed airflow obstruction, complicating the disease and limiting reversibility with bronchodilators, as the fibrotic tissue causes airway narrowing and impaired ventilation. 42. COPD complications include pneumothorax, particularly in patients with emphysema, where ruptured lung bully can lead to air escaping into the pleural space, causing the lung to collapse and necessitating emergency medical intervention. 43. End-stage COPD may require considerations for lung transplantation in eligible patients when medical therapies fail to provide sufficient symptomatic relief, with indicators for transplantation including severe airflow obstruction, hypercapnia, and frequent exacerbations despite maximal treatment. 44. Anxiety and panic attacks are prevalent in COPD patients, often exacerbated by breathlessness, leading to a vicious cycle of avoidance, deconditioning, and worsening symptoms that necessitate psychological interventions alongside pulmonary rehabilitation. 45. The heterogeneity of COPD is reflected in various phenotypes characterized by differing emphysema and bronchitis components, smoking history, and genetic factors, necessitating individualized treatment plans that cater to the specificities of each patient's disease presentation. 46. The use of statins in COPD patients is being investigated for their potential to reduce inflammation and improve outcomes beyond their lipid-lowering effects, as observational studies have suggested a possible reduction in all-cause mortality and exacerbations. 47. Sleep disturbances are common in COPD, with studies indicating increased occurrence of insomnia, nocturnal hypoxia, restless leg syndrome, and sleep apnea, further contributing to impaired daytime functioning and required specialized management to improve sleep quality. The relationship between COPD and malnutrition is complex, as the increased work of breathing, systemic inflammation, and metabolic changes can lead to weight loss and muscle wasting, highlighting the need for nutritional assessment and intervention as part of comprehensive COPD care. The role of endothelin in COPD is being explored, with increased levels associated with vascular remodeling and pulmonary hypertension in COPD patients, representing a potential therapeutic target to address cardiovascular complications associated with the disease. Bronchiectasis can coexist with COPD, particularly in those with recurrent infections and mucus hypersecretion, characterized by permanent dilation and thickening of the bronchi, necessitating specific management strategies to address the overlapping disease presentations and optimize patient outcomes. Cardiovascular disease encompasses a range of heart and blood vessel disorders, with the most common being coronary artery disease, which can lead to myocardial infarction and is primarily caused by atherosclerosis, a complex pathophysiological process involving lipid deposition, inflammation, and endothelial dysfunction. The heart's electrical system, crucial for maintaining regular cardiac rhythms, can be disrupted in arrhythmias like atrial fibrillation, which increase the risk of thromboembolism, often requiring anticoagulant therapy to prevent stroke and other serious cardiovascular events. Hypertension, often dubbed the silent killer due to its asymptomatic nature, exerts chronic pressure on the cardiovascular system, leading to left ventricular hypertrophy, heart failure, and increased risk for ischemic heart disease if not managed through lifestyle modification and pharmacotherapy. Heart failure is a clinical syndrome characterized by the heart's inability to pump sufficient blood to meet the body's needs, stemming from either systolic or diastolic dysfunction, and is often managed with a combination of ACE inhibitors, beta blockers, and diuretics to alleviate symptoms and improve survival. Lipoprotein, A, is a genetically determined molecule that plays a significant role as an independent risk factor for cardiovascular diseases due to its pro-atherogenic and prothrombotic properties, necessitating targeted therapeutic approaches like PCSK9 inhibitors in high-risk individuals. Kawasaki disease is an acute, self-limited vasculitis primarily affecting children and poses a considerable risk for coronary artery aneurysms, requiring prompt treatment with high-dose intravenous immunoglobulin and aspirin to reduce cardiovascular complications and ensure long-term heart health. The intricate process of atherosclerosis begins with endothelial injury followed by LDL cholesterol infiltration and oxidation, triggering a cascade of immune responses that culminate in plaque formation and potential rupture, necessitating lifestyle changes and statin therapy for risk reduction. The ankle brachial index, ABI, is a simple, non-invasive diagnostic tool used to assess peripheral artery disease, wherein an ABI of less than 0.90 suggests a high likelihood of significant arterial obstruction and increased cardiovascular risk, guiding further diagnostic and therapeutic interventions. Takotsubo cardiomyopathy, also known as stress-induced cardiomyopathy or broken heart syndrome, mimics acute coronary syndrome but typically resolves with supportive care, highlighting the profound impact of emotional and physical stress on cardiovascular function. Coronary artery bypass grafting, CABG, is a surgical procedure that improves blood flow to the heart in cases of severe coronary artery disease by using grafts from other vessels to bypass blocked arteries, significantly enhancing quality of life and reducing mortality when medical therapy alone is insufficient. In hypertrophic cardiomyopathy, genetic mutations lead to an abnormally thickened heart muscle, particularly the septum, resulting in outflow obstruction, arrhythmias, and sudden cardiac death, often requiring genetic counseling, lifestyle adjustments, and medications such as beta blockers or surgical intervention for management. Angiotensin-converting enzyme inhibitors not only lower blood pressure but also exert protective effects on the cardiovascular system through mechanisms like reducing remodeling, preventing left ventricular hypertrophy, and improving endothelial function, making them a cornerstone in the treatment of heart failure and hypertension. Peripheral artery disease is marked by atherosclerotic blockages in the arteries of the legs, leading to intermittent claudication, rest pain, or critical limb ischemia. Early diagnosis and treatment with exercise therapy, antiplatelet agents, and revascularization are crucial to prevent limb loss and cardiovascular events. Cardiac biomarkers, including high-sensitivity troponins, are pivotal in diagnosing myocardial infarction, as they are sensitive indicators of cardiac myocyte injury, guiding early treatment strategies such as anticoagulation, antiplatelet therapy, and reperfusion to improve patient outcomes. Rheumatic heart disease is a chronic sequela of rheumatic fever caused by group A streptococcal infection, resulting in progressive damage to the heart valves, predominantly the mitral valve, necessitating long-term antibiotics and potentially surgical valve repair or replacement to prevent cardiac failure. The baroreceptor reflex plays a critical role in short-term blood pressure regulation by adjusting heart rate and vascular tone in response to changes in arterial wall stretch, crucial in preventing rapid fluctuations in blood pressure that could lead to syncope or hypertension-related complications. Endothelial cells, lining the interior of blood vessels, are indispensable for maintaining vascular health by secreting substances like nitric oxide, which promote vasodilation, inhibit platelet aggregation, and improve blood flow, and their dysfunction is a pivotal event in the pathogenesis of cardiovascular diseases. One hallmark of chronic heart failure is neurohormonal activation, where systems like the renin-angiotensin-aldosterone system are upregulated, leading to detrimental effects such as vasoconstriction, sodium retention, and cardiac remodeling, which are targeted by life-saving medications like ACE inhibitors and aldosterone antagonists. The QT interval on an electrocardiogram is a critical measure of ventricular repolarization, and its prolongation is associated with an increased risk of life-threatening arrhythmias such as torsades de pointes, necessitating careful monitoring and correction of electrolyte imbalances and medication adjustments as needed. Pulmonary embolism, a potentially fatal cardiovascular emergency, results from a thrombus typically originating in the deep veins of the legs or pelvis, and manifests with acute dyspnea, chest pain, and hypoxemia. Rapid diagnosis via imaging and treatment with anticoagulation is essential for improving survival. The inflammatory biomarker C-reactive protein, CRP, is utilized in cardiovascular risk assessment, as elevated levels correlate with increased risks of atherosclerosis and heart attacks, prompting preventive measures such as lifestyle modifications and pharmacologic interventions aimed at reducing systemic inflammation. Valvular heart diseases, such as aortic stenosis or mitral regurgitation, result from structural abnormalities causing impaired valve function, leading to volume or pressure overload that can progress to heart failure, necessitating regular monitoring and interventions like valve repair or replacement when symptomatic. 23. Essential hypertension is a complex, multifactorial disorder with contributions from genetic, environmental, and lifestyle factors, and it presents a major risk factor for cardiovascular morbidity and mortality, with treatment focused on achieving target blood pressures through lifestyle changes and evidence-based medication regimens. '24. In acute coronary syndromes, prompt recognition and management through the door-to-balloon protocol for angioplasty within 90 minutes in ST elevation myocardial infarction significantly improve outcomes by restoring blood flow and minimizing cardiac muscle damage, emphasizing the importance of time-sensitive intervention. 25. The role of platelets extends beyond hemostasis. In vascular injury, activated platelets contribute to thrombus formation by releasing mediators like thromboxane A2 and inducing coagulation pathways, making antiplatelet therapy a cornerstone in the prevention of recurrent cardiovascular events after an initial infarction. '26. Myocarditis, an inflammation of the heart muscle often due to viral infections, can lead to dilated cardiomyopathy and heart failure, with clinical management ranging from supportive care and anti-inflammatory treatments to advanced therapies like mechanical circulatory support in severe cases. '27. B-type natriuretic peptide, BNP, and its precursor NT-proBNP are crucial diagnostic tools in distinguishing heart failure from other causes of dyspnea, as they are elevated in response to ventricular stretch, guiding the initiation and adjustment of heart failure therapies to optimize patient care. '28. The Framingham Heart Study provided invaluable insights into cardiovascular risk factors, establishing the association between cholesterol levels, hypertension, and smoking with coronary artery disease, thereby shaping modern preventive strategies through risk calculators and lifestyle interventions. '29. Coarctation of the aorta, a congenital narrowing of the aorta typically distal to the left subclavian artery, results in hypertension in the upper extremities and reduced perfusion to the lower body, requiring careful monitoring and surgical repair or balloon angioplasty to prevent long-term complications like heart failure. '30. Sudden cardiac death, often precipitated by ventricular arrhythmias, poses a significant risk in patients with coronary artery disease or cardiomyopathy, with implantable cardioverter defibrillators providing life-saving intervention by restoring normal heart rhythm upon detecting life-threatening disturbances. '31. Triglycerides, though primarily an energy source, are also implicated in atherosclerotic cardiovascular disease risk, with hypertriglyceridemia contributing to small, dense LDL particles and endothelial impairment, necessitating dietary modification and medications like fibrates in conjunction with statins for management. '32. The cardiac stress testing involves assessing the heart's response to exercise or pharmacologic stress, identifying ischemia and functional capacity, with imaging modalities like echocardiography or nuclear scans enhancing diagnostic accuracy for coronary artery disease assessment and guiding treatment strategies. '33. Heart rate variability, HRV, the physiological phenomenon of variation in the time interval between heartbeats, serves as a marker of autonomic nervous system function and cardiovascular health, with reduced HRV associated with increased risk of cardiovascular morbidity and mortality in various populations. '34. The concept of cardiometabolic risk encompasses the clustering of cardiovascular risk factors, including insulin resistance, hypertension, dyslipidemia, and central obesity, necessitating comprehensive management approaches oriented towards lifestyle modification and pharmacotherapy to reduce the risk of cardiovascular events and diabetes. 35. Alcohol consumption has a complex relationship with cardiovascular health, where moderate intake may confer cardioprotective effects through HDL elevation and anti-inflammatory actions, yet excessive use poses risks for hypertension, cardiomyopathy, and atrial fibrillation, informing guidelines for responsible consumption. 36. The intricate process of heart muscle contraction, governed by the sliding filament theory, involves the interaction of actin and myosin filaments within cardiac muscle cells, regulated by calcium ion flux and essential for effective cardiac output, highlighting the significance of calcium channel blockers in treating conditions like hypertension and angina. 37. Patent ductus arteriosus, a common congenital heart defect, results from the failure of the ductus arteriosus to close after birth, causing left-to-right shunting, leading to pulmonary overcirculation and heart failure if untreated, advocating early diagnosis and intervention with either pharmacologic closure or surgical repair. 38. The J-curve phenomenon in hypertension management illustrates the potential for excessively low blood pressure to increase cardiovascular risk, prompting careful titration of antihypertensive therapy to balance optimizing blood pressure control while mitigating the risk of hypotension-related adverse events. 39. The renin-angiotensin-aldosterone system plays a pivotal role in blood pressure regulation and fluid balance, with dysregulation contributing to pathologies like hypertension, heart failure, and chronic kidney disease, where inhibitors of this system, such as ACE inhibitors and ARBs, are the mainstays of treatment. 40. Novel cardiovascular imaging techniques like coronary CTA and cardiac MRI enhance diagnostic precision by non-invasively characterizing coronary artery disease, myocardial function, and structure, guiding personalized management and optimizing therapeutic outcomes in complex cardiovascular cases. #41. Physical inactivity is recognized as a modifiable risk factor for cardiovascular disease, with regular exercise promoting cardiovascular health by improving endothelial function, reducing blood pressure and LDL cholesterol levels, and enhancing insulin sensitivity, underscoring the importance of active lifestyle interventions for disease prevention. #42. The metabolic syndrome, characterized by a constellation of factors including abdominal obesity, dyslipidemia, insulin resistance, and hypertension, increases cardiovascular disease risk exponentially, necessitating multifaceted therapeutic strategies focusing on weight reduction, physical activity, and pharmacotherapy for optimal risk reduction. #43. Mitral valve prolapse, a condition where the valve leaflets bulge into the left atrium during systole, can lead to mitral regurgitation, arrhythmias, and in some cases, significant cardiovascular symptoms requiring surgical intervention, highlighting the importance of regular monitoring and risk stratification. #44. The sodium-potassium pump maintains cellular electrochemical gradients essential for cardiac function, and its impairment can lead to elevated intracellular sodium and calcium levels, affecting myocardial contractility and rhythm, with digoxin influencing this pump to manage heart failure and atrial fibrillation effectively. #45. Homocysteine, an amino acid, is implicated in cardiovascular disease pathogenesis when elevated, promoting endothelial dysfunction, oxidative stress, and thrombotic events, leading to consideration of folic acid supplementation and lifestyle changes as potential therapeutic strategies for reducing associated cardiovascular risks. #46. Cardiovascular risk reduction in diabetes patients extends beyond glucose control, emphasizing management of blood pressure, lipid profiles, and lifestyle factors, with SGLT2 inhibitors and GLP-1 receptor agonists showing promise in reducing cardiovascular events and enhancing overall heart health in this high-risk population. 47. Myocardial perfusion imaging involves the assessment of blood flow to the heart muscle using tracers, providing valuable insight into coronary artery disease severity and therapeutic response, informing decisions on revascularization strategies like PCI or CABG to improve symptom relief and survival outcomes. 48. The progression of left bundle branch block alters ventricular depolarization and is indicative of underlying structural heart disease, often necessitating further evaluation and intervention strategies, such as device implantation in heart failure patients to optimize synchronicity and improve clinical outcomes. 49. Cardiogenic shock, characterized by inadequate tissue perfusion secondary to severe cardiac dysfunction, poses a critical condition with high mortality, demanding prompt intervention with inotropes, mechanical circulatory support, and definitive treatment strategies like PCI or CABG to stabilize hemodynamics and enhance survival prospects. 50. High-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, plays a vital role in reverse cholesterol transport and endothelial protection, with higher levels traditionally associated with decreased cardiovascular risk, though recent studies suggest functionality may be equally critical, prompting ongoing research into therapeutic HDL targeting approaches. 1. Cardiovascular disease, often abbreviated as CVD, encompasses a range of heart and blood vessel disorders, including coronary artery disease, heart failure, and hypertension, which are primarily caused by atherosclerosis, a condition characterized by the buildup of fatty plaques on the arterial walls, leading to compromised blood flow and potential myocardial infarction or stroke. 2. The heart's electrical system controls the rhythm of your heartbeats. Any disruption in the normal conduction pathways can result in arrhythmias, which are abnormal heart rhythms that can range from benign, such as premature ventricular contractions, to life-threatening, such as ventricular fibrillation, requiring prompt medical intervention like defibrillation or antiarrhythmic drugs. 3. Hypertension, or high blood pressure, is termed the silent killer because it often presents without symptoms but leads to significant damage to the cardiovascular system over time, contributing to the hardening of arteries, increased workload on the heart, and eventually leading to complications such as stroke, heart attack, and chronic kidney disease. 4. Atherosclerosis is the progressive buildup of plaques composed of cholesterol, fatty substances, cellular waste products, calcium, and fibrin within the inner lining of the arteries, resulting in narrowed and stiffened arteries, which reduce blood flow and oxygen supply to vital organs, and is a major underlying cause of cardiovascular diseases like coronary artery disease. 5. Heart failure is a chronic condition where the heart muscle becomes weakened and cannot pump blood efficiently to meet the body's needs, often resulting from damage from coronary artery disease, long-standing high blood pressure, or cardiomyopathy, leading to symptoms such as shortness of breath, fatigue, and fluid retention. 6. Angina pectoris is a clinical syndrome characterized by episodes of chest pain or discomfort due to myocardial ischemia, which occurs when the coronary arteries are unable to supply sufficient blood flow to the heart muscle, typically triggered by physical exertion or emotional stress, and is often relieved with rest or nitroglycerin. 7. The Framingham Risk Score is a widely used tool to estimate an individual's 10-year risk of developing coronary heart disease, based on factors such as age, sex, cholesterol levels, blood pressure, smoking status, and the presence of diabetes, thereby guiding clinician decision-making regarding interventions to reduce cardiovascular risk. 8. The gold standard for diagnosing coronary artery disease is coronary angiography, an invasive imaging procedure which involves injecting a contrast dye into the coronary arteries through a catheter, typically inserted via the femoral or radial artery, allowing for direct visualization of any stenosis or blockages that may require treatment such as angioplasty or coronary artery bypass grafting. 9. Statins are a class of lipid-lowering medications that inhibit HMG-CoA reductase, an enzyme involved in cholesterol synthesis in the liver, thereby effectively reducing LDL cholesterol levels in the bloodstream, stabilizing atherosclerotic plaques, and significantly decreasing the risk of major cardiovascular events such as heart attacks and strokes. 10. Echocardiography, a non-invasive imaging technique utilizing ultrasound waves, provides detailed information about the heart's structure and function, enabling clinicians to assess parameters such as ejection fraction, wall motion abnormalities, valve abnormalities, and any presence of pericardial effusions, thus guiding diagnosis and management in cardiovascular conditions. 11. Peripheral artery disease, PAD, is a circulatory problem in which narrowed arteries reduce blood flow to the limbs, usually caused by atherosclerosis, and typical symptoms include cramping, pain, or fatigue in the leg or hip muscles during activity, known as claudication, which often improves with rest, but may require medical management and lifestyle modifications. 12. Myocardial infarction, commonly known as a heart attack, results from the complete blockage of blood flow to a part of the heart muscle, often due to a ruptured atherosclerotic plaque and subsequent blood clot formation, leading to irreversible myocardial injury unless promptly treated, usually with reperfusion therapy such as thrombolysis or percutaneous coronary intervention. 13. The renin-angiotensin-aldosterone system, RAS, plays a critical role in regulating blood pressure and fluid balance, and its overactivity can contribute to the development of hypertension and heart failure, with medications such as ACE inhibitors and angiotensin receptor blockers effectively used to interrupt this pathway and manage these conditions. 14. Cardiac rehabilitation is a medically supervised program designed to improve the cardiovascular health of patients who have experienced a heart attack, heart failure, or undergone heart surgery, encompassing exercise training, education on heart-healthy living, and counseling to reduce stress, thereby significantly enhancing quality of life and reducing recurrence risk. 15. Sudden cardiac death is a catastrophic event caused by the abrupt loss of heart function, often due to ventricular tachyarrhythmias triggered by structural heart diseases or coronary artery disease, and can sometimes be prevented with the use of implantable cardioverter defibrillators in high-risk individuals with known heart conditions. 16. Biomarkers such as troponins are proteins released into the bloodstream during myocardial injury, and their measurement is critical in the early detection and diagnosis of acute coronary syndromes, as elevated levels of cardiac-specific troponins provide a sensitive and specific indication of myocardial infarction, guiding timely therapeutic strategies. 17. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, emphasizes the consumption of fruits, vegetables, whole grains, lean proteins, and low-fat dairy products while reducing salt, red meat, and added sugars, and has been shown to be effective in lowering blood pressure and reducing overall cardiovascular risk when incorporated into daily life. 18. Anomalous coronary arteries, a congenital defect occurring when a coronary artery originates from an improper location, can lead to compromised blood supply, especially under increased cardiac demand, and although often asymptomatic, they can result in myocardial ischemia and sudden cardiac death, requiring surgical correction in symptomatic cases. 19. The Ankle Brachial Index, ABI, is a simple, non-invasive test used to assess the presence of peripheral artery disease, calculated by dividing the systolic blood pressure in the ankle by the systolic blood pressure in the brachial artery, with an ABI of less than 0.9 indicating significant arterial narrowing that warrants further investigation or intervention. 20. Atrial fibrillation is the most common cardiac arrhythmia and is characterized by rapid and irregular beating of the atria, often leading to poor blood flow, increased risk of thromboembolism, and stroke, necessitating management strategies including rate control, rhythm control, and anticoagulation to mitigate associated risks and complications. 21. Lipoprotein A is an independent risk factor for cardiovascular disease, with elevated levels contributing to atherosclerosis and thrombosis due to its pro-inflammatory and pro-atherogenic properties, and although not routinely tested in standard lipid panels, it is considered in patients with premature heart disease or a family history of cardiovascular events. 22. Cardiac catheterization is a diagnostic procedure where a catheter is inserted into a blood vessel and threaded to the heart under fluoroscopic guidance, used to evaluate coronary artery blockages, measure pressures within the heart chambers, and examine cardiac function, often serving as a precursor to interventions like stenting or balloon angioplasty. 23. High-sensitivity C-reactive protein, HSCRP, is an inflammatory biomarker used to assess cardiovascular risk, with elevated levels indicating systemic inflammation and an increased likelihood of atherosclerotic cardiovascular disease, prompting lifestyle changes and possibly pharmacotherapy to reduce inflammation and prevent adverse cardiovascular events. 24. The heart's preload, a concept referring to the ventricular end diastolic volume, influences cardiac output by affecting the degree of myocardial fiber stretch prior to contraction, with conditions such as hypovolemia reducing preload, whereas fluid overloads or valvular disorders may increase it, impacting overall cardiac performance and hemodynamics. 25. Coronary artery bypass grafting, CABG, is a surgical procedure employed to restore adequate blood flow to the heart by bypassing blocked coronary arteries using a graft, typically harvested from the saphenous vein or internal mammary artery, improving symptoms of angina and reducing the risk of myocardial infarction in patients with severe coronary artery disease. 26. The cardiac conduction system comprises specialized tissue that controls the heart's rhythmic beating, beginning at the sinoatrial node, the natural pacemaker, transmitting impulses through the atrioventricular node, bundle of His and Purkinje fibers, ensuring coordinated contraction of the atria and ventricles necessary for efficient blood pumping. 27. Erectile dysfunction, though primarily a sexual health issue, often serves as an early indicator of cardiovascular disease, as endothelial dysfunction affecting blood vessel health impairs vasodilatory responses, mirroring similar changes in coronary circulation, thus warranting cardiovascular evaluation in patients presenting with this condition. 28. Lipid profile testing measures the levels of various types of cholesterol and triglycerides in the blood, including HDL, LDL, and total cholesterol, providing valuable information regarding an individual's risk for atherosclerosis and cardiovascular disease, and guiding treatment plans to achieve target lipid levels through dietary, lifestyle, and pharmacologic means. 29. The heart's afterload refers to the resistance the left ventricle must overcome during systole to eject blood, heavily influenced by systemic vascular resistance and arterial pressure, with conditions such as hypertension significantly increasing afterload, contributing to left ventricular hypertrophy and ultimately impairing overall cardiac efficiency. 30. Hypertrophic cardiomyopathy is a genetic condition characterized by abnormal thickening of the heart muscle, often affecting the septum between the ventricles, leading to impaired diastolic function, potentially causing outflow obstruction, arrhythmias, or sudden cardiac death, with management focusing on symptom control and risk reduction via medication or surgery. 31. Carotid artery disease, involving the narrowing or blockage of the major arteries in the neck caused by atherosclerosis, poses a significant risk for transient ischemic attacks, TIAs, or strokes due to reduced cerebral perfusion or embolization of plaque material to the brain, necessitating management with antiplatelet therapy, lifestyle modifications, and sometimes surgical intervention like carotid endarterectomy or stenting. 32. Aortic stenosis is a condition characterized by the narrowing of the aortic valve opening, limiting blood flow from the left ventricle into the aorta, often due to age-related calcification or congenital bicuspid valve deformities, leading to symptoms such as chest pain, syncope, or heart failure, and typically managed with valve replacement surgery when severe. 3. Cardiac magnetic resonance imaging (MRI) is a non-invasive diagnostic tool that uses powerful magnets and radio waves to create detailed images of the heart, allowing for precise evaluation of cardiac structure, function, tissue characterization, and assessment of myocardial scarring or fibrosis, often employed in the diagnosis of cardiomyopathies, congenital abnormalities, or post-infarct recovery assessment. 34. Kawasaki disease, primarily affecting children under 5 years old, is an acute, self-limited vasculitis that can lead to coronary artery aneurysms if untreated, presenting with symptoms such as prolonged fever, rash, conjunctivitis, and swollen lymph nodes, and is typically managed with early intravenous immunoglobulin and aspirin therapy to prevent cardiac complications. 35. Venous thromboembolism (VTE) refers to the formation of blood clots in the venous system, manifesting as deep vein thrombosis (DVT) or pulmonary embolism (PE), posing significant cardiovascular risk due to potential embolization to the lungs, and typically managed through anticoagulation therapy such as heparin or warfarin to prevent complications or recurrence. 36. Rheumatic heart disease, a consequence of rheumatic fever following untreated group A streptococcal infections, leads to chronic damage of cardiac valves, particularly the mitral and aortic valves, causing stenosis or regurgitation, resulting in heart failure over time, and is preventable through prompt antibiotic treatment of streptococcal infections and prophylaxis in those with a history of rheumatic fever. 37. Cocaine use exerts significant cardiovascular consequences due to potent stimulation of the sympathetic nervous system, resulting in increased heart rate, blood pressure, and risk of myocardial ischemia or infarction, arrhythmias, and sudden cardiac death even in young users, emphasizing the need for recognition and management of substance use in patients with cardiovascular presentations. 38. Pericarditis is the inflammation of the pericardium, the double-layered sac surrounding the heart, and can present with sharp chest pain, pericardial friction rub, and ECG changes such as diffuse street segment elevation, managed with anti-inflammatory treatments and monitoring for complications like pericardial effusion or constrictive pericarditis, which may require surgical intervention. 39. Beta blockers, a class of medications that reduce heart rate and myocardial oxygen demand, are commonly used in the management of various cardiovascular conditions including hypertension, ischemic heart disease, and heart failure, and have a secondary role in reducing the risk of sudden cardiac death in patients with heart failure or post-myocardial infarction. 40. Mitral valve prolapse (MVP) is a disorder involving the improper closure of the valve between the left atrium and left ventricle due to redundant or elongated valve leaflets, often causing regurgitation of blood into the atrium, with a majority of cases being asymptomatic but some presenting with palpitations or atypical chest pain, managed through regular monitoring and symptomatic treatment. 41. Diabetic cardiomyopathy is a distinct form of heart disease in diabetes patients, not directly related to other cardiovascular conditions, characterized by myocardial dysfunction due to chronic hyperglycemia, leading to fibrosis, left ventricular hypertrophy, and ultimately heart failure, emphasizing the importance of strict glycemic control and heart failure risk factor management in diabetic populations. 42. Electrophysiological studies, EPS, are invasive procedures used to diagnose and evaluate arrhythmias by recording electrical activity and mapping conduction pathways in the heart, guiding treatment decisions for complex cases of recurrent arrhythmias, often leading to therapeutic interventions like catheter ablation to correct abnormal rhythm sources. 43. Endothelial dysfunction is an early marker of vascular disease wherein the inner lining of blood vessels fails to regulate vascular tone, coagulation, and inflammation effectively, often triggered by risk factors like smoking, insulin resistance, hypertension, and hyperlipidemia, and plays a critical role in the pathogenesis of atherosclerosis and related cardiovascular events. (44) Valvular heart disease comprises abnormalities of one or more heart valves leading to stenosis, where the valve doesn't open fully, or regurgitation, where it doesn't close completely, often progressing due to degenerative changes, rheumatic heart disease, or infective endocarditis, potentially necessitating medical management or surgical repair, replacement to restore normal hemodynamics. 45. Metabolic syndrome is a cluster of conditions including abdominal obesity, dyslipidemia, hypertension, and insulin resistance, significantly increasing the risk for cardiovascular diseases and type 2 diabetes, necessitating comprehensive lifestyle interventions and possibly pharmacotherapy to reduce these risk factors and prevent associated cardiovascular outcomes. 46. Heart's systolic function is the ability of the ventricles to contract and generate enough pressure to eject blood into the circulation, commonly assessed by left ventricular ejection fraction, LVEF, during imaging studies, with reduced systolic function often indicating heart failure with reduced ejection fraction, HFrEF, and requiring targeted therapeutic strategies to improve cardiac performance. 47. Unstable angina, a form of acute coronary syndrome, is characterized by new or worsening chest pain that occurs at rest or with minimal exertion, indicative of acute myocardial ischemia due to transient reduction in coronary blood flow, requiring urgent medical attention and treatment with anticoagulants, antiplatelets, and possibly coronary revascularization to stabilize the condition. 48. The coronary calcium score, obtained via non-invasive CT scanning, quantifies the extent of calcified plaque in coronary arteries and serves as a predictive marker for future cardiovascular events, aiding in risk stratification and the decision to implement preventive strategies for patients with intermediate risk of atherosclerotic cardiovascular disease. 49. The vagus nerve plays a pivotal role in modulating heart rate through the parasympathetic nervous system, promoting a decrease in heart rate and blood pressure, thus providing a counterbalance to the sympathetic system, with vagal maneuvers or vagus nerve stimulators being utilized in clinical settings to manage certain tachyarrhythmias by enhancing parasympathetic tone. 50. Cardiogenic shock is a critical condition marked by inadequate cardiac output to meet metabolic demands, typically resulting from extensive myocardial infarction or decompensated heart failure, leading to severe hypotension, organ hypoperfusion, and metabolic acidosis, necessitating prompt recognition and aggressive medical interventions such as inotropes, mechanical circulatory support, or revascularization to restore hemodynamic stability. 1. Lung cancer, primarily caused by smoking, is often classified into two main types: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC, with NSCLC being the more prevalent, revolving around cellular differences that impact management and prognostic approaches. 2. Smoking cessation is crucial in both prevention and management of lung cancer, as cigarette smoke contains carcinogens that lead to genetic mutations which disrupt normal cell cycles, ultimately resulting in malignant lung tumors over time. 3. Lung cancer screening using low-dose computed tomography, LDCT, can significantly reduce mortality by identifying tumors at an early, more treatable stage, particularly in high-risk populations such as older adults with a significant smoking history. Four, symptoms of lung cancer often include persistent cough, hemoptysis, chest pain, and unexplained weight loss, and these symptoms typically reflect advanced disease, highlighting the importance of early detection for effective treatment outcomes. 5. The pathophysiology of non-small cell lung cancer involves various genetic mutations such as EGFR and ALK rearrangements, which have led to targeted therapies that significantly improve outcomes in patients with specific genetic profiles. Six, small cell lung cancer is characterized by rapid growth and early metastasis, often initially presenting with paraneoplastic syndromes such as SIADH or ACTH production, complicating diagnosis and requiring prompt and aggressive treatment including chemotherapy and radiotherapy. 7. Staging of lung cancer is crucial for determining the treatment regimen and is based on the TNM system, evaluating the size and extent of the tumor, lymph node involvement, and the presence of metastasis. 8. Pleural effusion can occur in lung cancer patients due to tumor infiltration or obstruction of lymphatic drainage, often requiring thoracentesis for diagnosis and symptomatic relief. 9. Immunotherapy has revolutionized the treatment landscape for advanced NSCLC, utilizing immune checkpoint inhibitors that help the immune system recognize and attack cancer cells, specifically by targeting PD-1 and PD-L1 pathways. 10. Palliative care plays a vital role in lung cancer management, aiming to improve quality of life by addressing symptoms management, emotional support, and advanced care planning alongside curative or control therapies. 11. Lung cancer metastasis is common, often spreading to the brain, bones, liver, and adrenal glands, with each site of metastasis requiring a tailored approach either through direct treatment or adjunctive supportive care to alleviate symptoms. 12. PET cord scans are frequently used in the evaluation of lung cancer, offering metabolic information that complements anatomical findings of CT alone, important for accurate staging and management decisions. 13. Brachytherapy, a form of radiotherapy, can be used as a localized treatment for certain cases of lung cancer, delivering radiation directly to the tumor site, thereby minimizing exposure to surrounding healthy tissues and potentially reducing side effects. 14. Angiogenesis inhibitors like bevacizumab are used in certain NSCLC regimens to block the tumor's blood supply, potentially starving cancer cells of nutrients and inhibiting tumor growth. 15. Risk factors for lung cancer extend beyond smoking and include exposure to radon, asbestos, and secondhand smoke, as well as having a family history of the disease, emphasizing the importance of multidisciplinary approaches for prevention. 16. Pulmonary function tests can be integral in assessing lung cancer patients' respiratory status prior to surgery or radiotherapy, helping predict postoperative outcomes and guiding the management of potential treatment complications. 17. Sabermetric radiotherapy, SABR, offers a non-invasive treatment modality for early-stage lung cancer, utilizing precise, high-dose radiation therapy to target tumors with minimal damage to surrounding tissues, ideal for patients who are poor surgical candidates. 18. Liquid biopsy, an emerging diagnostic tool, involves analyzing circulating tumor DNA in the blood for mutations and biomarkers, providing a less invasive means for monitoring treatment response and detecting relapse in lung cancer patients. 19. Smoking contributes to the development of lung cancer by causing DNA damage and chronic inflammation, creating an environment conducive to the formation of malignant cells, with the cumulative risk increasing with the number of pack years smoked. 20. Neuroendocrine tumors of the lung, including small cell lung cancer, display unique molecular and clinical features, often producing hormones that lead to systemic symptoms, requiring distinct approaches from non-neuroendocrine tumors. 21. Targeted therapies for lung cancer, such as tyrosine kinase inhibitors, TKIs, for EGFR-mutated NSCLC, have demonstrated effectiveness by inhibiting specific pathways essential for cancer cell growth, offering a personalized treatment option for suitable patients. 22. Pulmonary lobectomy is the standard surgical approach for resectable non-small cell lung cancer, involving the removal of an entire lobe of the lung, often combined with lymph node dissection to provide comprehensive cancer clearance. 23. Metabolic heterogeneity seen in lung cancer tumors poses challenges for treatment, as variable glucose uptake can affect both imaging accuracy in PET scans and the responsiveness to therapies like chemotherapy and radiotherapy. 24. Clubbing and hypertrophic osteoarthropathy, manifesting in distal phalanx changes and joint pain, represent potential paraneoplastic manifestations of lung cancer, necessitating evaluation for underlying malignancy, especially in smokers. 25. Recurrent respiratory infections or pneumonia can be an indicative symptom of lung cancer, driven by tumor-induced airway obstruction resulting in poor drainage and subsequent bacterial proliferation. 26. Nutritional support is vital for lung cancer patients experiencing cachexia or treatment-related appetite loss, focusing on high-calorie, protein-rich diets to maintain energy and muscle mass, which are crucial for withstanding aggressive cancer therapy. 27. Lung cancer patients receiving radiotherapy may experience radiation pneumonitis, characterized by cough, fever, and dyspnea, usually manifesting weeks after treatment and managed with corticosteroids to reduce inflammation. 28. The presence of KRAS mutations in lung cancer often correlates with poor prognosis and limited response to certain targeted therapies, presenting ongoing challenges in developing effective treatment strategies for affected patients. 29. Cachexia, a syndrome of unexplained weight loss and muscle atrophy, is commonly associated with advanced lung cancer, negatively impacting prognosis and quality of life, necessitating a multidisciplinary approach for management including nutritional and pharmacologic interventions. 30. Bronchoscopy with biopsy is a diagnostic cornerstone for lung cancer, allowing direct visualization of the airway, tumor tissue sampling, and sometimes therapeutic interventions such as stenting or laser treatment to relieve obstruction. 31. Early-stage non-small cell lung cancer has the potential to be curatively treated with surgical resection alone, highlighting the significance of early detection through screening methods to improve survival rates. 32. Lung cancer's molecular landscape is dynamic, often evolving under selective pressure of therapies, leading to acquired resistance to drugs like EGFR inhibitors, necessitating the development of next-generation inhibitors and combination strategies. 3. Central lung tumors frequently cause airway obstruction, leading to post-obstructive pneumonia, atelectasis, or hemoptysis, and require accurate localization and intervention, often through bronchoscopic or radiologic techniques. 34. In addition to tobacco, environmental air pollutants, including particulate matter and diesel exhaust, have been identified as contributing factors to lung cancer development, emphasizing the multifaceted nature of carcinogen exposure. 35. Emerging evidence suggests that chronic obstructive pulmonary disease, COPD, independently increases lung cancer risk, irrespective of smoking history, likely due to shared inflammatory pathways and genetic susceptibilities. 36. Hormonal therapy is not typically used in lung cancer treatment, except in specific cases where small cell lung cancer presents with ectopic production of hormones like ACTH, which requires management of related syndromes. 37. Persistent voice hoarseness in lung cancer patients can be indicative of recurrent laryngeal nerve involvement, often due to tumor invasion or lymphadenopathy in the mediastinum, necessitating thorough evaluation and imaging. 38. In lung cancer management, multidisciplinary tumor boards comprising oncologists, radiologists, pathologists, surgeons, and palliative care professionals enhance patient outcomes by tailoring individualized treatment plans based on comprehensive expert input. 39. Oncogenes like ALK are important in lung cancer pathogenesis, with translocations resulting in oncogenic fusion proteins driving cancer growth, leading to the development of ALK inhibitors that provide significant clinical benefits in affected patients. 40. Proton beam therapy offers an advanced form of radiation therapy for lung cancer, utilizing charged particles that deliver energy more precisely, potentially reducing collateral damage to surrounding healthy tissues compared to traditional photon-based radiotherapy. 41. Recent studies have highlighted that certain lung cancer subtypes associated with EGFR mutations may demonstrate increased susceptibility to tyrosine kinase inhibitors, underscoring the importance of genetic profiling in guiding targeted treatment. 42. Occupational exposure to asbestos is a well-known risk factor for lung cancer, specifically linked to mesothelioma and other pleural malignancies, highlighting necessary preventive measures in at-risk industrial settings. 43. Advanced lung cancer can present with systemic symptoms such as night sweats and fatigue, which, although nonspecific, warrant comprehensive evaluation given their potential indication of widespread disease or associated paraneoplastic phenomena. 44. Despite therapeutic advancements, lung cancer remains one of the leading causes of cancer-related mortality globally, underscoring the crucial need for ongoing research into prevention, early detection, and novel treatment modalities. 45. Lymphangitic carcinomatosis is a unique presentation where lung cancer spreads through lymphatic channels, leading to shortness of breath and cough, requiring prompt diagnosis as it often signals advanced and diffuse disease. 46. Rarely, lung cancer can present as a secondary effect of systemic embolization, where tumor cells invade the vasculature, resulting in peripheral symptoms like digital ischemia in a phenomenon known as tumor embolism. 47. The management of brain metastasis from lung cancer may involve whole brain radiotherapy, stereotactic radiosurgery, or surgical intervention depending on the number, size, and location of lesions, as well as patient performance status. 48. Carcinoid tumors of the lung, though rare, can be the source of typical or atypical presentations depending on their biologic activity and hormone secretion, requiring distinct surgical and medical management approaches compared to other lung neoplasms. 49. E-smoking or vaping has been investigated for its potential role in lung cancer risk, with ongoing studies evaluating the carcinogenicity of flavored aerosols and nicotine substitutes used in electronic cigarettes. 50. Advancements in telemedicine have facilitated the provision of comprehensive care for lung cancer patients, enabling remote consultations, treatment monitoring, and multidisciplinary team discussions, greatly improving access to oncology expertise. 1. Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. 2. The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. 3. Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. 4. The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. 5. Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. 6. The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. 7. The utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. 8. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. 9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. 10. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. 11. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. 25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. 26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. 27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided surgery using 5-ALA, have enhanced the precision of tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. 28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. 29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. 30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. 31. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. 32. Unveiling the potential of chimeric antigen receptor (CAR) T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. 3.3. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. 34. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. 35. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. 36. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. 37. Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. 39. Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. 41. Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. 42. Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. 43. Innovative surgical techniques in skull-base tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. 44. The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. 45. Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. 46. Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. 47. The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. 48. Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. 49. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. 50. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. 1. Hepatitis B is a viral infection caused by the hepatitis B virus that primarily affects the liver, leading to both acute and chronic disease states, with symptoms such as jaundice, fatigue, and abdominal pain often seen in acute cases, while chronic infection can progress to cirrhosis or liver cancer over several years if left untreated, highlighting the importance of early diagnosis and intervention. 2. The hepatitis B virus is a small, enveloped DNA virus belonging to the Hepidnaviridae family, and it replicates through an RNA intermediate using reverse transcription, which is a unique feature among DNA viruses and contributes to its ability to establish a persistent infection in the host liver cells. 3. Diagnosis of hepatitis B infection involves serological testing for surface antigens, HBsAg, surface antibodies, anti-HBs, and core antibodies, anti-HBc, which together help to determine the infection status, such as acute, chronic, or resolved infection, and vaccination response. 4. Hepatitis B surface antigen, HBsAg, is often the first marker to appear in the blood following infection and serves as an indicator of active viral replication, while the persistence of HBsAg beyond 6 months usually indicates progression to chronic hepatitis B infection. 5. The presence of hepatitis B antigen, HBsAg, in the blood is associated with higher levels of viral replication and infectivity, and its conversion to anti-HBe antibodies, HBe seroconversion, often signifies a reduction in viral activity and an improved prognosis in chronic hepatitis B patients. 6. In chronic hepatitis B, liver histopathology may reveal varying degrees of inflammation, fibrosis, or cirrhosis, and liver biopsy remains a useful diagnostic tool to assess the extent of liver damage and guide therapeutic decisions, although non-invasive tests are increasingly used to evaluate liver fibrosis. 7. The primary treatment goals in managing chronic hepatitis B are to prevent disease progression such as cirrhosis or hepatocellular carcinoma, reduce viral load to undetectable levels, and enhance the patient's quality of life. These are achieved through antiviral therapy with drugs like tenofovir or entecavir. 8. Antiviral medications like tenofovir disoproxil fumarate or entecavir are recommended as first-line therapy for chronic hepatitis B due to their high barrier to developing viral resistance, potent suppression of viral replication, and satisfactory safety profile, though patient monitoring for potential renal or bone side effects is necessary. 9. Pegylated interferon alpha therapy can be an alternative treatment option for some patients with chronic hepatitis B, particularly in those with genotype A infection or younger patients, as it may lead to higher rates of HBsAg clearance, representing functional cure, though the treatment is limited by its considerable side effects. 10. The prevention of hepatitis B transmission relies heavily on vaccination, with the hepatitis B vaccine, consisting of purified HBsAg, being highly effective at inducing protective immunity and recommended for all infants at birth, healthcare workers, and other high-risk groups to curb the spread of the virus. 11. Mother-to-child transmission of hepatitis B can be significantly reduced by administering the hepatitis B vaccine and hepatitis B immune globulin, HBIG, to newborns within 12 hours of birth, especially if the mother is HBsAg positive, thereby preventing the development of chronic hepatitis B in the infant. 12. Chronic hepatitis B infection is a major global health issue, with over 296 million people estimated to be infected worldwide, leading to significant morbidity and mortality as it causes liver-related complications such as cirrhosis and hepatocellular carcinoma, highlighting the importance of public health measures for prevention and control. Hepatitis B virus can be transmitted in several ways, including through unprotected sexual contact, exposure to infected blood, perinatal transmission from an infected mother to her child, and through unsafe injections or blood transfusions, necessitating comprehensive prevention strategies to reduce transmission rates. The incubation period for hepatitis B ranges from 30 to 180 days, during which time the virus proliferates in liver cells, leading to symptoms of acute hepatitis as the immune system mounts a response. Symptoms include malaise, anorexia, nausea, and jaundice, which often indicate liver inflammation. In early acute hepatitis B infection, liver enzymes such as alanine aminotransferase (ALT) and aspartate aminotransferase (AST) are elevated, reflecting liver cell injury. While the return of these enzymes to normal levels often indicates recovery, although chronic infection may develop in a minority of cases. The interplay between the hepatitis B virus and the host immune system plays a crucial role in determining the outcome of infection. The virus employs various mechanisms to evade immune detection, and the strength of the host's immune response influences whether the infection resolves spontaneously or becomes chronic. Regular monitoring of individuals with chronic hepatitis B involves periodic assessments of liver enzymes, hepatitis B viral DNA levels through PCR testing, and imaging studies to screen for liver cancer, which helps guide treatment decisions and detect complications such as cirrhosis or hepatocellular carcinoma at an early stage. Hepatitis B infection management has evolved with guidelines recommending risk stratification based on factors like age, family history of liver disease or cancer, and the presence of cirrhosis, which help tailor treatment approaches to individual patients for optimizing outcomes and preventing liver complications. Hepatitis B immunity can be conferred by past infection or vaccination, with the presence of anti-HBs antibodies indicating protective immunity, while individuals lacking these antibodies after successful vaccination may benefit from booster doses if they remain at high risk of exposure to the virus. Hepatitis B-related liver cancer is one of the leading causes of cancer-related deaths worldwide, and the development of hepatocellular carcinoma, HCC, is more common in patients with ongoing viral replication, co-infections with hepatitis C or D, or lifestyle factors like heavy alcohol consumption, emphasizing the need for routine HCC screening in high-risk populations. Hepatitis B DNA polymerase enzyme is a key target for antiviral drugs as it is essential for viral replication. Nucleose T-ide analogs inhibit this enzyme effectively, leading to suppression of viral replication and reduction of liver inflammation and fibrosis in treated individuals, although therapy may be lifelong in some cases. Chronic hepatitis B can progress through different phases, including immune tolerance, immune clearance, inactive carrier state, and reactivation, with each phase characterized by distinct viral replication levels and liver inflammation profiles, which inform monitoring and treatment strategies for managing the infection. Co-infection with hepatitis D virus, HDV, can occur in patients with hepatitis B, leading to more severe liver disease, as HDV requires hepatitis B surface antigen for replication. This combination requires specialized management as it poses a higher risk for rapid progression to cirrhosis and liver cancer. Pregnancy in women with chronic hepatitis B requires careful management, with antiviral therapy recommended in the third trimester for mothers with high viral loads to decrease the risk of mother-to-child transmission, alongside routine neonatal vaccination and administration of HBIG to at-risk newborns. Many individuals with occult hepatitis B infection have undetectable HB-Zag despite being carriers of the virus, posing a diagnostic challenge. These individuals often demonstrate the presence of HBV DNA in liver or serum samples and are at increased risk for the development of liver disease, particularly if co-infected with HCV or HIV. Hepatitis B can cause a wide range of extrahepatic manifestations such as polyarthritis nodosa, glomerulonephritis, and vasculitis, which result from immune complex deposition and hypersensitivity reactions, necessitating vigilant identification and multisystem management in affected individuals. The hepatitis B vaccine is an inactivated vaccine composed of non-infectious HB-Zag particles produced through recombinant DNA technology, and its administration induces an immune response that protects over 95% of vaccinated individuals for at least 20 years, although routine booster doses are not generally recommended for immunocompetent persons. Vaccination against hepatitis B has resulted in a dramatic decrease in the incidence of new infections, particularly among children and young adults due to robust immunization programs initiated globally, which has contributed significantly to the decrease in hepatitis B-related morbidity and mortality over the past few decades. Liver function tests, LFTs, are crucial in the assessment of hepatitis B infection, as they provide information on the extent of liver damage, with elevated levels of ALT and AST indicating hepatocellular injury, while monitoring changes in these enzymes is critical in evaluating treatment efficacy and liver disease progression. Antiviral therapy for hepatitis B has evolved significantly, with the introduction of potent nucleose (T)ide analogues that offer patients prolonged viral suppression, thereby reducing the risk of liver disease progression and complications. And while viral eradication remains challenging, functional cure defined by the loss of HB-Zag is an achievable treatment endpoint for some patients. In individuals with resolved hepatitis B infection, characterized by the presence of anti-HBC and anti-HBs antibodies without detectable HB-Zag, reactivation of hepatitis B can occur under certain circumstances, such as immunosuppressive therapy, necessitating prophylactic antiviral treatment to prevent flare-ups of hepatitis. The innate immune response plays a critical role in the initial defense against hepatitis B infection by recognizing viral components through pattern recognition receptors, including toll-like receptors, leading to the activation of interferon-stimulated genes which modulate the replication of the virus. Lamivudine was one of the first antiviral drugs approved for hepatitis B, and although it was effective in reducing viral load and improving liver function initially, its long-term use is limited by the rapid emergence of drug-resistant HBV strains, emphasizing the need for newer agents with a higher genetic barrier to resistance. Sequencing of the hepatitis B virus genome has led to the identification of several genotypes, labeled A to J, which have variable geographical distribution and slightly differing replication efficiency, clinical outcomes, and response to therapy, thereby influencing regional treatment guidelines and vaccination programs. In cases of acute hepatitis B, the virus is often cleared spontaneously in immunocompetent adults, with less than 5% of these cases progressing to chronic infection, in contrast to neonates and young children who have a higher risk of developing chronic hepatitis B due to their immature immune system. Hepatitis B is considered an occupational hazard for healthcare workers due to potential exposure to infectious blood and body fluids, and strict adherence to standard precautions, along with vaccination, is essential in preventing transmission among healthcare professionals. The detection of hepatitis B DNA levels through quantitative PCR testing is a key component in monitoring chronic hepatitis B management, as it provides information on viral replication activity, helps assess treatment response, and guides adjustments in therapeutic strategies to achieve optimal virologic suppression. 38. In patients with compensated cirrhosis secondary to hepatitis B, antiviral therapy can improve liver function and reduce the risk of decompensation, although close monitoring is necessary given the potential for serious complications, including hepatic decompensation and liver cancer, even during successful treatment. 39. The hepatitis B precore and basal core promoter mutations affect viral replication and expression of the hepatitis B e antigen, commonly seen in patients with HBsAg-negative chronic hepatitis B. These mutations often result in more severe liver disease and require vigilant management to prevent adverse outcomes. 40. The introduction of direct-acting antivirals for hepatitis C treatment has led to many co-infected with hepatitis B experiencing viral reactivation upon HCV clearance, necessitating careful monitoring and consideration of prophylactic antiviral therapy against hepatitis B in these patients. Hepatitis B can have profound psychosocial effects on affected individuals, as the stigma associated with chronic infection and potential transmission to others can lead to anxiety, depression, and social isolation, warranting comprehensive support and counseling to address these challenges alongside medical treatment. Chronic hepatitis B infection can significantly impact pregnancy outcomes, including increased risks of gestational diabetes, preterm birth, and low birth weight, and therefore requires collaboration between hepatologists and obstetricians to optimize maternal and neonatal health through careful monitoring and interventions. Hepatitis B-related acute liver failure, though rare, is a life-threatening condition that requires immediate medical attention and potentially liver transplantation, with rapid deterioration seen in patients who develop severe coagulopathy, encephalopathy, and multi-organ failure. Monitoring hepatitis B surface antigen quantification can provide prognostic information in chronic hepatitis B management, as a decline in HBsAg levels is often associated with favorable clinical outcomes, including spontaneous disease resolution or successful response to antiviral therapy. Adolescents and adults with hepatitis B often require vaccinations against hepatitis A if they are not already immune, as co-infection with both viruses can lead to more severe liver disease. Thus, hepatitis A vaccination is routinely recommended to reduce the risk of concomitant liver insults. Patients with chronic kidney disease often have a higher prevalence of hepatitis B infection due to increased exposure from dialysis procedures, necessitating routine screening, vaccination of susceptible individuals, and careful evaluation of antiviral treatment regimens to minimize nephrotoxicity. The adoption of universal blood screening for hepatitis B in blood donation centers has greatly reduced the risk of transfusion-related transmission, as blood donors are routinely tested for HBsAg, ensuring that blood supplies are safer and protecting recipients from acquiring the virus through transfusions. Chronic hepatitis B infection potentially elevates the risk of metabolic syndrome and cardiovascular disease secondary to chronic inflammation and liver disease, requiring integrated management strategies that address metabolic risk factors alongside liver-specific treatments. 49. Individuals co-infected with hepatitis B virus and HIV may require specialized antiretroviral therapy regimens that effectively target both viruses, as some medications used in HIV management, such as tenofovir, are also active against HBV, necessitating coordination between hepatologists and infectious disease specialists. 50. Understanding the transmission dynamics of hepatitis B in communities with a high prevalence of infection is critical for effective public health strategies, as tailoring prevention efforts, such as vaccination campaigns and education on safe practices, can substantially impact the overall burden of disease. 1. Liver cirrhosis is a chronic liver disease characterized by progressive fibrosis and regenerative nodule formation, leading to liver dysfunction, often resulting from chronic alcohol consumption, hepatitis B or C infections, and other chronic liver injuries, contributing to complications like portal hypertension, ascites, hepatic encephalopathy, and increased risk of hepatocellular carcinoma. 2. The diagnosis of liver cirrhosis is often based on clinical features, laboratory tests showing liver dysfunction, imaging studies like ultrasound or CT scans revealing nodular liver surface and altered architecture, and sometimes a liver biopsy confirming histological findings of fibrosis and nodular regeneration, particularly when the etiology is uncertain. 3. Ascites, the accumulation of fluid in the abdominal cavity, is a common complication of liver cirrhosis and results from portal hypertension and hypoalbuminemia, often diagnosed through physical examination, ultrasound confirming fluid presence, and analysis of acidic fluid regarding cell count and albumin concentration to rule out spontaneous bacterial peritonitis and malignant causes. 4. In liver cirrhosis, portal hypertension arises due to increased resistance to portal blood flow through the fibrotic liver, manifesting clinically as splenomegaly, variceal hemorrhage, ascites, and caput medusae, diagnosed through clinical examination, endoscopic findings of varices, and imaging modalities showing dilated portal system vessels. 5. Hepatic encephalopathy is a neuropsychiatric syndrome associated with liver cirrhosis, characterized by a spectrum from subtle cognitive dysfunction to coma, predominantly caused by elevated systemic ammonia levels due to impaired hepatic detoxification, and is often reversible with medical treatment and dietary protein modification. 6. Liver cirrhosis significantly alters pharmacokinetics and pharmacodynamics, resulting in enhanced drug adverse effects or reduced efficacy, necessitating careful drug choice and dosing due to compromised hepatic metabolism and altered plasma protein binding capabilities, requiring particular caution with drugs such as NSAIDs, sedatives, and anticoagulants. 7. Jaundice in liver cirrhosis results from the liver's inability to adequately conjugate and excrete bilirubin due to liver cell dysfunction, leading to elevated levels of unconjugated bilirubin, presenting with yellowish skin and scleral discoloration, dark-colored urine, and pale stools, serving as a marker of advanced liver disease. 8. Variceal hemorrhage is a life-threatening complication of liver cirrhosis caused by rupture of esophageal or gastric varices, a consequence of portal hypertension, presenting with hematemesis or melena, requiring urgent endoscopic assessment and possible intervention alongside pharmacological measures such as vasopressin analogs and prophylactic measures in high-risk patients. 9. Liver cirrhosis increases the risk of hepatorenal syndrome, a functional renal failure associated with portal hypertension and circulatory dysfunction, characterized by marked vasoconstriction of renal vessels leading to reduced glomerular filtration rate, and treated with volume expansion, vasoconstrictors, and ultimately bridging to liver transplantation. 10. Ultrasound elastography is a non-invasive imaging technique used to assess liver stiffness and fibrosis severity in liver cirrhosis, providing a quantitative measure correlated with histopathological fibrosis stage, assisting in monitoring disease progression and guiding clinical decision-making regarding cirrhosis management without the need for repeat liver biopsies. Spider angiomas, small, dilated blood vessels with a central red dot, frequently occur in liver cirrhosis due to hyperestrogenism from impaired estrogen metabolism, serving as a clinical hallmark observed on the upper body, often found alongside palmar erythema, both of which may signify advanced liver disease. 12. Serum to ascites albumin gradient, SAAG, is a diagnostic tool differentiating causes of ascites in patients with liver cirrhosis. A gradient greater than or equal to 1.1 grams per deciliter indicates portal hypertension-related ascites, helping to exclude non-cirrhotic causes such as peritoneal carcinomatosis or tuberculosis. 13. Nutritional deficits are prevalent in liver cirrhosis due to malabsorption, altered metabolism, and poor dietary intake, necessitating nutritional assessment and intervention focusing on ensuring adequate calorie intake, avoiding protein-energy malnutrition, and supplementing vitamins and minerals like zinc and vitamin D to improve clinical outcomes. 14. Thrombocytopenia in liver cirrhosis can stem from splenic sequestration of platelets secondary to portal hypertension or decreased thrombopoietin production by the liver, contributing to increased bleeding risk, and necessitating caution with invasive procedures and potential platelet transfusion prior to surgery. 15. The Child-Pugh score is an assessment tool used to evaluate the prognosis of chronic liver disease, incorporating clinical and laboratory parameters including bilirubin, albumin, prothrombin time, ascites, and hepatic encephalopathy, categorizing cirrhosis severity into classes A, B, or C, which helps guide therapeutic strategies and predict perioperative risk. 16. Alcoholic cirrhosis results from prolonged heavy alcohol intake leading to liver inflammation and scarring, and is often accompanied by steatosis and alcoholic hepatitis, requiring absolute abstinence from alcohol as the primary treatment, which can stabilize or ameliorate liver damage and improve overall prognosis. 17. Liver transplantation is a definitive treatment for end-stage liver cirrhosis, indicated when medical management fails or life-threatening complications ensue, involving replacing the diseased liver with a healthy donor liver, a procedure with careful recipient selection based on criteria such as MELD score predicting post-transplant survival. 18. Metabolic and physiological alterations in liver cirrhosis cause muscle wasting, known as sarcopenia, due to factors like systemic inflammation, hormonal imbalances, and altered amino acid catabolism, necessitating focused nutritional and physical rehabilitation strategies to improve patient mobility, quality of life, and survival outcomes. 19. Hepatopulmonary syndrome is a vascular complication of liver cirrhosis, characterized by hypoxemia due to intrapulmonary vascular dilation and shunting, presenting with dyspnea and platypnea orthodeoxia, requiring diagnosis through contrast-enhanced echocardiography and supplemental oxygen, with definitive treatment through liver transplantation. 20. The MELD, Model for End-Stage Liver Disease, score is an objective prognostic tool used to prioritize liver transplantation candidates based on a formula incorporating bilirubin, INR, and creatinine levels to predict 3-month mortality risk in cirrhotic patients, influencing the allocation of donor livers in liver transplant programs. 21. Non-alcoholic steatohepatitis, NASH, related cirrhosis is increasingly recognized due to the global rise of obesity and metabolic syndrome, presenting initially with fatty liver and progressing to inflammation and fibrosis, necessitating lifestyle modifications, with emerging pharmacological therapies targeting metabolic pathways in ongoing research phases. 22. Portal hypertensive gastropathy is a condition associated with liver cirrhosis, resulting in mucosal changes in the stomach and stomach bleeding due to portal hypertension, identified through endoscopy as mosaic-like patterns and treated with beta blockers to reduce portal pressure and prevent recurrent bleeding. 23. Biliary cirrhosis results from chronic injury and destruction of bile ducts, seen in conditions like primary biliary cholangitis, with subsequent fibrosis and cirrhosis development, presenting with cholestatic jaundice, pruritus, and elevated alkaline phosphatase levels, and treated with ursodeoxycholic acid to slow disease progression. 24. Autoimmune hepatitis can progress to liver cirrhosis if untreated, characterized by necroinflammatory liver damage, presence of autoantibodies, and elevated immunoglobulin G, necessitating immunosuppressive therapy as treatment, typically with corticosteroids and azathioprine to achieve remission and prevent cirrhotic progression. 25. Hepatorenal syndrome type 1 is a rapidly progressive form of renal failure seen in patients with advanced liver cirrhosis, associated with marked renal hypoperfusion and poor prognosis, necessitating urgent supportive measures such as albumin infusion and vasoconstrictors while awaiting liver transplantation as the definitive treatment. 26. Hyperestrogenemia in liver cirrhosis, due to impaired hepatic metabolism leading to elevated estrogen levels, causes clinical signs like gynecomastia, testicular atrophy, and red palms, and may contribute to vascular changes in coagulopathy, necessitating management of underlying liver dysfunction to alleviate these hormonal imbalances. 27. Coagulopathy in liver cirrhosis results from impaired liver synthesis of clotting factors and thrombocytopenia, leading to increased bleeding risks, requiring careful monitoring of coagulation parameters and cautious use of anticoagulants, as well as possible administration of clotting factor concentrates or platelet transfusions in bleeding episodes. 28. Portal vein thrombosis in liver cirrhosis can worsen portal hypertension and is often asymptomatic or presents with abdominal pain and gastrointestinal bleeding, requiring anticoagulation therapy balancing bleeding risks, and possibly interventional procedures like thrombectomy or shunt placement in refractory cases. 29. In liver cirrhosis, small intestinal bacterial overgrowth can occur due to altered gut motility and bile salt deficiency, contributing to further liver damage through bacterial translocation and endotoxemia, managed with a combination of antibiotics, probiotics, and dietary changes to restore balanced gut flora and reduce liver insults. 30. In advanced liver cirrhosis, patients may develop hepatopulmonary syndrome characterized by pulmonary vasodilation leading to hypoxemia and dyspnea, with a diagnosis supported by arterial blood gas analysis and contrast-enhanced echocardiography, managed with oxygen therapy and considering liver transplantation as a definitive cure. 31. Spontaneous bacterial peritonitis, SBP, is a severe and often recurrent infection of acidic fluid in patients with liver cirrhosis, frequently caused by gram-negative bacteria, diagnosed through acidic fluid analysis showing polymorphonuclear leukocytes count greater than 250 cells per cubic millimeter and treated urgently with antibiotics and albumin infusions. 32. Hyperdynamic circulation is a feature of advanced liver cirrhosis, characterized by increased cardiac output, decreased systemic vascular resistance, and compensatory mechanisms involving renin-angiotensin and sympathetic nervous systems, contributing to complications like variceal bleeding and requiring beta blockers for hemodynamic stabilization. 3. Patients with liver cirrhosis may develop a compensatory gastric ulcer due to altered gastric mucosal protection and increased portal pressure affecting gastric blood flow, necessitating regular endoscopic evaluation and preventive measures like proton pump inhibitors or treating Helicobacter pylori infection if present. 34. Hepatic hydrothorax in liver cirrhosis is the accumulation of pleural fluid typically on the right side due to transdiaphragmatic migration of acidic fluid in the presence of diaphragmatic defects, leading to respiratory distress and managed through therapeutic thoracentesis, dietary sodium restriction, and diuretics, with liver transplantation as curative. 35. Changes in dermal collagen composition and metabolism may occur in liver cirrhosis due to alterations in circulating cytokines and growth factors, leading to complications like Dupuytren's contracture, which is recognized by palmar fascia thickening and flexion contractures of fingers, managed conservatively or surgically if functional impairment arises. 36. Liver cirrhosis patients have an increased risk of osteopenia and osteoporosis due to malabsorption of fat-soluble vitamins, specifically vitamin D, and alterations in bone metabolism, necessitating regular bone density screening and calcium and vitamin D supplementation to prevent fractures and maintain bone health. 37. Cutaneous manifestations such as leukonychia, due to hypoalbuminemia, and Terry's nails, characterized by proximal nail whitening, are observed in liver cirrhosis, serving as non-invasive clinical indicators of chronic liver disease severity and necessitating management of underlying liver dysfunction for improvement. 38. Increased levels of cytokines and oxidative stress markers in liver cirrhosis contribute to systemic inflammation, and these are linked to disease progression and suppression of the immune system, which underlines the therapeutic focus on antioxidants and immunomodulatory strategies alongside traditional cirrhosis management. 39. Cholestasis in liver cirrhosis results from impaired bile flow due to bile duct obstruction or failure of bile excretion from hepatocytes, clinically presenting with jaundice, pruritus, and pale stools, and requires addressing the cirrhotic cause, with interventions like ursodeoxycholic acid or stent placement in biliary obstructions. 40. Hepatic artery buffer response, important for maintaining liver perfusion in cirrhosis, is a regulatory mechanism where hepatic artery flow increases to compensate for the reduction in portal flow, but becomes dysregulated in advanced cirrhosis, contributing to further hepatic hypoperfusion and necessitating medical management to optimize circulation. 41. Sepsis-induced acute on chronic liver failure is a condition where liver cirrhosis is exacerbated by systemic inflammation and infection, presenting with hepatic decompensation and multi-organ failure, underscoring the need for rapid identification and aggressive treatment of infections alongside supportive care measures. 42. Splenomegaly in patients with liver cirrhosis develops due to portal hypertension, leading to increased splenic venous pressure and resultant hyperplasia, often resulting in hypersplenism and cytopenias, and may require interventions like splenic embolization or partial splenectomy in severe symptomatic cases. 43. Hepatic stellate cells play a crucial role in cirrhosis pathophysiology, as they transform from quiescent vitamin A fat-storing cells into activated myofibroblasts, producing excessive extracellular matrix proteins leading to fibrosis, which highlights them as therapeutic targets for antifibrotic agents to halt or reverse liver cirrhosis progression. 44. Endoscopic band ligation is a treatment modality for esophageal varices in liver cirrhosis, performed to prevent variceal hemorrhage by placing rubber bands to induce thrombosis and fibrosis of variceal veins, effectively reducing variceal bleeding risk and often complemented by beta-blocker therapy for long-term management. 45. Advanced liver cirrhosis impairs hormonal metabolism, leading to endocrine dysfunctions such as hypogonadism, insulin resistance, and feminization in men, necessitating multidisciplinary management including lifestyle modifications and hormonal therapies to mitigate reproductive and metabolic repercussions on patient health. 46. Lipopolysaccharide, LPS, endotoxin from gut-derived bacteria can exacerbate cirrhosis by enhancing systemic inflammation and hepatocyte injury, implicating the gut-liver axis as a target for therapeutic interventions such as probiotic therapy, antibiotics, and nutritional management to restore intestinal barrier function and reduce systemic endotoxemia. #47. Hepatic coagulopathy management in cirrhosis may involve recombinant factor VIIA in cases of significant bleeding, synthesizing coagulative deficiencies in the face of resistant bleeding, highlighting the complexity of balancing hemostasis with thrombosis risk, requiring individualized treatment strategies based on patient bleeding profiles. #48. Liver cirrhosis patients' dysregulated hormonal synthesis leads to mineralocorticoid excess with clinical features like edema, contributing to ascites and complicating diuretic therapy. Although reflecting reduced aldosterone metabolism, careful adjustment of diuretics and monitoring of electrolyte balance remains crucial in management. #49. Anemia in liver cirrhosis arises from multifactorial causes including hypersplenism, gastrointestinal bleeding, and anemia of chronic disease, necessitating diagnostic evaluation to direct management options such as transfusions, iron supplementation, or addressing underlying causes like gastric ulcers or variceal bleeding. #50. Rifaximin is an orally administered, gut-specific antibiotic used in the treatment of recurrent episodes of hepatic encephalopathy and liver cirrhosis. Acting by altering gut flora to reduce ammonia production, it complements lactulose therapy and has a favorable side effect profile due to minimal systemic absorption. #1. Pancreatic cancer often exhibits late-stage symptoms due to its retroperitoneal location, which allows tumors to grow significantly before inducing noticeable symptoms such as jaundice, weight loss, or back pain, making early detection challenging and stressing the importance of vigilant monitoring of individuals with high risk factors like chronic pancreatitis or family history of pancreatic diseases. #2. The survival rate for pancreatic cancer remains dismally low, with a 5-year survival rate of around 10%, a stark reflection of the aggressive nature of its pathophysiology, as ductal adenocarcinoma commonly exhibits rapid progression and metastasis, often involving the liver and lungs at the time of diagnosis. #3. Diagnosis of pancreatic cancer commonly involves cross-sectional imaging techniques such as a contrast-enhanced CT or MRI scans, which help identify the extent of the tumor and any metastasis, in conjunction with endoscopic ultrasound (EUS), that provides detailed imaging and allows for fine needle aspiration biopsies to obtain tissue samples. #4. The etiology of pancreatic cancer is multifactorial, with known risk factors including age, smoking, obesity, hereditary syndromes like BRCA1 and BRCA2 gene mutations, diabetes, and dietary factors, while chronic inflammation of the pancreas is also implicated in the development and progression of neoplastic changes in pancreatic tissue. #5. Surgical resection remains the cornerstone of curative therapy for pancreatic cancer, but it is only feasible in approximately 20% of patients due to late-stage presentation, and it usually involves a Whipple procedure, distal pancreatectomy, or total pancreatectomy, depending on the tumor's location and involvement of surrounding structures. #6. The pathophysiology of pancreatic cancer at the molecular level often involves alterations in oncogenes like KRAS and tumor suppressor genes such as p53 and SMAD4, which contribute to deregulated cell growth, resistance to apoptosis, angiogenesis, and metastatic dissemination of cancer cells. #7. Clinical staging of pancreatic cancer, crucial in determining treatment options and prognosis, relies on the TNM system where T describes the size and local extent of the tumor, N for regional lymph node involvement, and M indicates the presence or absence of distant metastasis. 8. Chemotherapy regimens in pancreatic cancer, such as the combination of FOLFIRINOX or gemcitabine with nab-paclitaxel, are employed in cases where surgical options are not viable or as neoadjuvant or adjuvant treatment, with ongoing investigations into targeted therapies and immunotherapies aiming to improve efficacy and survival outcomes. Nine. Palliative care plays a significant role in managing pancreatic cancer due to the high rate of incurable disease, focusing on alleviating symptoms such as pain and jaundice, typically employing interventions like nerve blocks, biliary stenting, or radiation therapy to improve quality of life. 10. The role of biomarkers in pancreatic cancer is evolving, with CA19-9 being the most widely used serum marker for monitoring disease progression in response to therapy, although it has limitations in sensitivity and specificity, leading to continued research into identifying more reliable molecular markers for early detection and personalized treatment strategies. 11. Pancreatic cancer metastasis frequently involves the liver and peritoneum due to hematogenous spread and direct invasion, severely impacting prognosis and treatment options, highlighting the importance of comprehensive staging investigations at diagnosis to guide therapeutic decisions and manage possible complications. 12. The role of genetic counseling is increasingly significant in pancreatic cancer, especially for individuals with a family history suggestive of hereditary cancer syndromes, as mutations like BRCA1/2 and Lynch syndrome can dictate screening strategies, inform treatment plans, and prompt at-risk family members to undergo appropriate surveillance. 13. Recent advancements in immunotherapy for pancreatic cancer focus on overcoming the tumor's immunosuppressive microenvironment, with clinical trials evaluating checkpoint inhibitors, cancer vaccines, and adoptive cell therapies, although the unique biology of pancreatic tumors presents ongoing challenges in achieving significant therapeutic breakthroughs. 14. The onset of new-onset diabetes, particularly in older adults without obesity, has been associated with the early stages of pancreatic cancer, serving as a potential clue for early detection, given that up to 85% of patients exhibit glucose metabolism disorders correlating with tumor-induced insulin resistance or direct islet cell damage. 15. Although smoking is a modifiable risk factor for pancreatic cancer, cessation remains crucial as tobacco use nearly doubles the risk of developing the disease, potentially due to carcinogenic compounds inducing chronic pancreatic inflammation leading to genetic alterations implicated in carcinogenesis. 16. Cachexia is a common complication of pancreatic cancer, characterized by severe weight loss and muscle wasting, impacting patients' overall health status in response to treatment, often necessitating nutritional interventions and metabolic support to manage the multifaceted syndrome caused by tumor and host-derived factors. 17. In the context of pancreatic cancer, endoscopic retrograde cholangiopancreatography, ERCP, serves a dual role in both diagnostic evaluation and therapeutic intervention, particularly in cases of obstructive jaundice, where it can facilitate stent placement to relieve biliary obstruction and collect cytological samples through brushings or duct biopsies. 18. The role of physical activity in pancreatic cancer prevention is an area of active research, with evidence suggesting that regular exercise may reduce risk through mechanisms involving maintenance of healthy body weight, reduction of systemic inflammation, and improvement of insulin sensitivity, underscoring lifestyle modifications as a potential preventive strategy. 19. Neuropathic pain associated with pancreatic cancer is often due to the tumor's infiltration into celiac plexus or other nerve structures, necessitating a multidisciplinary approach including pharmacologic analgesics, nerve blocks, and psychosocial support to effectively manage the complexity of pain profiles seen in affected patients. 20. The interplay between chronic pancreatitis and pancreatic cancer has been a focus of study, as long-standing inflammation results in fibrotic changes and dysplasia, potentially culminating in neoplastic transformation, emphasizing the need for vigilant monitoring and appropriate management strategies in patients with recurrent inflammatory episodes. 21. Recent studies emphasize the importance of identifying precursor lesions such as intraductal papillary mucinous neoplasms, IPMNs, and mucinous cystic neoplasms, MCNs, in the context of pancreatic cancer risk assessment, as these lesions carry a variable risk of malignant transformation and may warrant surgical intervention based on size, presence of solid components, or ductal dilation. 22. Magnetic resonance cholangiopancreatography, MRCP, is a non-invasive imaging modality particularly useful in delineating pancreatic ductal anatomy and identifying lesions or obstructions, and in certain scenarios, it offers superior soft tissue contrast compared to CT, aiding in the diagnosis and staging of pancreatic cancer. 23. The concept of tumor microenvironment is crucial in understanding pancreatic cancer biology, as stromal components like cancer-associated fibroblasts and immune cells contribute to desmoplastic reaction, chemoresistance, and immunosuppression, highlighting potential therapeutic targets aimed at disrupting these supportive networks to inhibit tumor progression. 24. Prognostication in pancreatic cancer relies not only on traditional staging but also on factors such as tumor grade, presence of comorbidities, and molecular profiling, with advances in genomics offering potential insights into individualized risk assessment and tailored therapeutic strategies to improve outcomes. 25. The impact of gallstone disease on pancreatic cancer risk has been observed, wherein long-standing obstruction or inflammation may serve as a promotional factor in the carcinogenic pathway, necessitating prompt management of biliary pathology to potentially mitigate associated risks. 26. Perineural invasion, commonly observed in pancreatic cancer, refers to the propensity of tumor cells to invade surrounding nerve tissues, contributing to pain and disease progression, and represents both a pathologic hallmark of aggressiveness and a challenge in achieving complete surgical resection due to its pervasive nature. 27. In assessing resectability of pancreatic tumors, the involvement of critical vascular structures such as the superior mesenteric artery, celiac axis, or portal vein plays a determinant role, with locally advanced tumors often deemed unresectable unless preoperative therapies can achieve sufficient downstaging to enable surgical intervention. 28. Diabetes mediation and pancreatic cancer share a complicated relationship where some anti-diabetic drugs, particularly metformin, have been investigated for potential protective effects against cancer incidence and progression, while the exact pathways and clinical implications continue to undergo research. 29. The presence of depressed mood and early mental health disturbances have been noted in individuals later diagnosed with pancreatic cancer, which may be attributed to perineoplastic phenomena or tumor-related cytokine release, warranting further exploration into the psychoneuroimmunological aspects of cancer diagnosis. 30. While enteral nutrition is preferred in maintaining nutritional status in pancreatic cancer patients due to its preservation of gut mucosal integrity and function, parenteral nutrition may be necessitated in cases of severe malnutrition or when gastrointestinal function is compromised, highlighting the importance of a tailored approach to nutritional support. 31. A considerable amount of research continues to focus on the role of vitamin D and its receptor pathways in pancreatic cancer, as epidemiological studies suggest an inverse relationship between adequate vitamin D levels and cancer risk, although clinical trials are needed to elucidate therapeutic efficacy in cancer prevention or treatment. 32. The phenomenon of oncogenic KRAS mutations being present in over 90% of pancreatic ductal adenocarcinomas underscores the challenge and urgency in developing targeted therapies against this mutation, as current strategies aim to interfere with downstream signaling pathways or the tumor's metabolic reprogramming influenced by KRAS activity. 3.3. The interplay between gut microbiota and pancreatic cancer reveals complex interactions where dysbiosis could contribute to systemic inflammation and modulate tumor microenvironment dynamics, suggesting that therapeutic modulation of the gut flora may emerge as an adjunct measure in comprehensive cancer management. 34. The role of alcohol consumption in pancreatic cancer remains nuanced, with chronic heavy consumption contributing to pancreatitis and subsequent cancer risk, whereas moderate consumption lacks consistent evidence of similar associations. Thus, moderation remains advised within broader lifestyle considerations to mitigate overall cancer risk. 35. As the field examines the role of oxidative stress in pancreatic cancer pathogenesis, antioxidants and natural compounds are being explored for their potential protective effects, though clinical efficacy remains to be established, highlighting the need for rigorous trials to assess their role in prevention or adjunctive therapy. 36. Pancreatic neuroendocrine tumors, PNETs, although distinct from exocrine pancreatic ductal adenocarcinomas, present varied biological behavior and treatment approaches, often involving surgical resection, somatostatin analogs, and targeted therapies such as mTOR inhibitors, underscoring the diversity within pancreatic neoplasms. 37. Neuroendocrine-like differentiation in pancreatic adenocarcinoma can occur, posing diagnostic challenges and influencing prognosis, as tumors with mixed neuroendocrine and adenocarcinomatous features may exhibit variable responses to conventional chemotherapeutic regimens or targeted treatments. 38. Advances in precision medicine enhance the potential for liquid biopsy techniques, utilizing circulating tumor DNA and exosomes to provide non-invasive diagnostic and monitoring solutions in pancreatic cancer, though technical and analytical challenges persist in translating these modalities into routine clinical practice. 39. Vascular endothelial growth factor, VEGF, plays a critical role in angiogenesis within pancreatic tumors, fostering a pro-tumorigenic environment, yet anti-VEGF therapies have shown limited success, prompting further investigation into combination regimens or alternative angiogenic pathways as therapeutic targets. 40. The presence of diabetes mellitus may alter treatment paradigms in pancreatic cancer, affecting chemotherapy tolerance and metabolic management, thus requiring a comprehensive and collaborative approach to care that addresses oncologic and glycemic control simultaneously to optimize outcomes. 41. Environmental and occupational exposures, such as to certain hazardous chemicals or pesticides, have been implicated as potential risk factors for pancreatic cancer, emphasizing preventive measures and regulatory policies to reduce exposure and associated carcinogenic risks in susceptible populations. 42. Whilst pancreatic cancer surgery remains complex, advances in perioperative care and surgical techniques, including minimally invasive approaches, have contributed to improved surgical outcomes and reduced recovery times, driving ongoing innovation in the field of oncologic surgery. 43. Achieving a balance between curative intent and quality of life remains paramount in the treatment of pancreatic cancer, as aggressive interventions must be carefully weighed against potential benefits and impacts on patient well-being, underscoring the necessity for patient-centered decision-making in oncologic care plans. 44. Atypical presentations of pancreatic cancer, such as migratory thrombophlebitis or Trousseau's syndrome, reflect the tumor's paraneoplastic effects and hypercoagulable state, necessitating vigilant clinical assessment and anticoagulative measures to mitigate thrombosis risk in affected individuals. #45. Surgical margin status, as assessed post-resection, plays a critical role in determining prognosis for pancreatic cancer, as negative margins, R0 resection, are associated with improved survival outcomes, while positive microscopic or macroscopic margins, R1, R2, warrant consideration of additional adjuvant therapies. #46. The role of aspirin and non-steroidal anti-inflammatory drugs, NSAIDs, in pancreatic cancer risk reduction is under investigation, with some data suggesting modest risk reduction potential, but further research is needed to substantiate safety, efficacy, and appropriate use within standard prevention protocols. #47. Autophagy, a cellular degradation and recycling pathway, has dual roles in pancreatic cancer, where it may support tumor cell survival under stress conditions yet also contribute to cell death, positioning it as a target for modulation in novel therapeutic strategies aimed at disrupting cancer cell homeostasis. #48. Endoscopic ultrasound-guided biopsies are highly effective in obtaining tissue samples from pancreatic lesions, particularly due to their high sensitivity and specificity for malignancy, contributing significantly to diagnostic accuracy and facilitating timely therapeutic decision-making processes. #49. Serum amyloid, a protein, and its role in systemic inflammation are being explored within the context of pancreatic cancer as potential diagnostic or prognostic biomarkers, given their association with tumor-induced inflammatory responses, although clinical validation is necessary to support their use in clinical settings. #50. The emerging field of pharmacogenomics in pancreatic cancer seeks to tailor therapeutic regimens based on individual genetic and molecular profiles, optimizing treatment efficacy and minimizing adverse effects, while enhancing personalized medicine approaches that align with the broader shift towards precision oncology. #1. Colon cancer, also known as colorectal cancer, is a form of malignancy that develops from the epithelial cells lining the colon or rectum. It often begins as benign polyps that can become cancerous over time, emphasizing the importance of early detection and intervention through routine screenings such as colonoscopies. #2. The pathophysiology of colon cancer typically involves a series of genetic mutations, including those in the APC, KRAS, and P53 genes, which disrupt normal cell growth and regulatory mechanisms, facilitating uncontrolled cell division and tumor formation. #3. Risk factors for colon cancer include age over 50, a family history of colorectal cancer, certain inherited syndromes such as Lynch syndrome, a diet high in red and processed meats, obesity, physical inactivity, and smoking, which collectively highlight the multifactorial nature of the disease. #4. Adenomatous polyps, especially those that are larger than 1 cm, possess a higher risk of malignancy due to their glandular origin, making regular monitoring crucial for individuals with these types of polyps to prevent progression to colon cancer. #5. Symptoms of colon cancer can vary but often include changes in bowel habits like diarrhea or constipation, stool consistency changes, rectal bleeding or blood in the stool, persistent abdominal discomfort, weakness or fatigue, and unexplained weight loss, necessitating medical evaluation for such presentations. #6. Diagnosis of colon cancer is typically confirmed through a combination of colonoscopy, which allows direct visualization and biopsy of suspicious lesions, and imaging techniques like CT scans or MRI to evaluate the extent of the disease and potential metastasis. 7. The staging of colon cancer, ranging from stage 1 to IV, is vital for treatment planning and is based on the extent of tumor invasion into the colon wall, involvement of regional lymph nodes, and the presence of distant metastasis, with more advanced stages requiring more aggressive treatment. 8. Surgical resection remains the primary treatment for localized colon cancer, aiming to completely remove the tumor and surrounding tissues. The surgical approach may include partial colectomy, segmental resection, or more extensive procedures depending on tumor location and stage. 9. Adjuvant chemotherapy, often involving drugs like 5-fluorouracil, leucovorin, and oxaliplatin, is commonly used post-surgery in cases of stage 3 and some stage 2 colon cancer to eradicate microscopic residual cancer cells and reduce recurrence risk. 10. Radiation therapy is not routinely used for colon cancer but is more commonly part of the treatment for rectal cancer, where it helps reduce the size of the tumor before surgery and improve local control, especially in higher stage disease. 11. Targeted therapies, such as bevacizumab, which inhibits angiogenesis, and cetuximab and panitumumab, which target the epidermal growth factor receptor, EGFR, have expanded treatment options for metastatic colon cancer and are commonly used alongside traditional chemotherapy regimens. Immunotherapy, including drugs like pembrolizumab and nivolumab, has shown promise in the treatment of mismatch repair deficient or microsatellite instability high metastatic colon cancers, capitalizing on the concept of harnessing the body's immune system for tumor eradication. 13. The role of genetic testing in colon cancer, particularly looking for mutations such as those in the Lynch syndrome-associated mismatch repair genes, is crucial for identifying hereditary cancer syndromes and informing both treatment and screening strategies for patients and their families. 14. Regular colon cancer screening is recommended to begin at age 45 for average-risk individuals, using methods such as fecal occult blood tests, stool DNA testing, sigmoidoscopy, or colonoscopy, which are effective in reducing mortality by detecting precancerous polyps and early-stage cancers. 15. Lifestyle modifications, including a high-fiber diet rich in fruits, vegetables, and whole grains, regular physical activity, maintaining a healthy weight, and minimizing alcohol consumption and tobacco use, play a significant role in the prevention of colon cancer. 16. The recurrence of colon cancer post-treatment is a major concern, with follow-up protocols typically including regular surveillance colonoscopies, periodic imaging, and carcinoembryonic antigen (C) testing to monitor for disease return and ensure prompt intervention if needed. 17. The prognosis of colon cancer is highly stage-dependent, with localized disease, stage 1, having a 5-year survival rate exceeding 90%, while distant metastatic disease, stage 4, has a significantly reduced survival rate, underscoring the importance of early detection. 18. Palliative care in advanced colon cancer focuses on symptom management, such as pain control and addressing nutritional issues, to enhance the quality of life for patients rather than curing the disease, making it an integral part of comprehensive cancer care. 19. Research into the molecular and genetic underpinnings of colon cancer continues to be a vibrant field, with studies exploring novel biomarkers for early detection and new molecular targets for treatment, offering hope for more personalized and effective management strategies in the future. 20. The mucinous subtype of colon cancer, characterized by abundant extracellular mucin production, presents unique pathological features and is often associated with a poorer prognosis compared to the more common adenocarcinoma subtype, demanding specialized treatment considerations. 21. 21. Colon cancer can metastasize to distant organs, with the liver and lungs being the most common sites, and managing such metastatic spread often involves systemic therapies and, in select cases, surgical resection or radiofrequency ablation of metastasis to prolong survival. 22. Colon cancer incidence shows considerable geographic and ethnic disparities, with higher rates in developed countries, possibly due to lifestyle factors and dietary patterns, although ongoing research is needed to unravel the complex interplay of genetics and environment in these trends. 23. Biomarker testing in colon cancer, such as for mutations in the KRAS, NRAS, and BRAF genes, guides the use of targeted therapies and provides important prognostic information, helping to tailor treatment plans for optimal patient outcomes. 24. Neoadjuvant chemotherapy or chemoradiation therapy before surgical resection has gained traction in advanced rectal cancer treatment, aiming to downstage the tumor and increase the likelihood of complete resection, thereby improving long-term survival rates. 25. Colon cancer in younger adults, while less common than in older populations, is on the rise, warranting increased awareness and consideration of hereditary syndromes, as well as lower screening age guidelines, to address this concerning trend effectively. 26. BRAF mutations in colon cancer are associated with a distinct clinical profile, often demonstrating more aggressive behavior and a poor response to conventional therapies, calling for innovative therapeutic approaches and clinical trials to improve outcomes for affected patients. 27. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, significantly increase the risk of developing colon cancer due to chronic inflammation and dysplasia, necessitating vigilant surveillance and perhaps earlier intervention in these at-risk populations. 28. Genetic counseling is an essential component for families with Lynch syndrome or familial adenomatous polyposis, providing information about cancer risks, the importance of surveillance, and preventive options, including prophylactic surgery, for mutation carriers. 29. The gut microbiome, a complex community of microorganisms residing in the colon, is increasingly recognized for its role in colon cancer, with dysbiosis and specific bacterial species being implicated in carcinogenesis, paving the way for innovative microbiome-targeted therapies. 30. Identifying circulating tumor DNA, ctDNA, in the blood offers a promising non-invasive method for monitoring colon cancer recurrence and treatment response, potentially providing real-time insights into tumor dynamics and guiding personalized treatment adjustments. 31. The MSI, microsatellite instability, testing status of colon cancer is a critical factor that impacts treatment decisions, as MSI-high tumors are more likely to respond to immunotherapy, offering a tailored approach that capitalizes on the tumor's unique molecular phenotype. 32. Advances in laparoscopic and robotic surgery have refined the surgical treatment of colon cancer, offering the benefits of minimally invasive techniques such as shorter recovery times, reduced postoperative pain, and smaller incisions, without compromising oncological outcomes. 3.3. The concept of field cancerization in colon cancer suggests that genetic and epigenetic alterations may occur over a large area of the colon epithelium, potentially leading to multiple primary cancers or recurrences, highlighting the need for thorough surveillance and intervention strategies. 34. Tumor budding, a histopathological feature characterized by isolated cells or small clusters at the invasive front of colon cancer, is emerging as a robust prognostic marker associated with poor clinical outcomes, and it may eventually guide therapeutic decisions in the clinical setting. 35. Tertiary lymphoid structures within the tumor microenvironment of colon cancer are increasingly recognized for their role in mounting anti-tumor immune responses, and their presence correlates with improved survival, representing an area of intense research interest in cancer immunology. 36. Colon cancer prevention may involve the use of chemopreventive agents such as aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, which have been shown to reduce the risk of adenoma formation and colorectal cancer, although potential side effects must be carefully weighed. 37. Meditation and other forms of stress reduction may play a supportive role in colon cancer care, potentially influencing biomarkers of inflammation and immune function, although more research is required to solidify the evidence base regarding their impact on disease outcomes. 38. Polygenic risk scores, which combine the effects of multiple genetic risk variants, are under development to better predict colon cancer risk in individuals, facilitating personalized screening recommendations and potentially improving early detection rates for high-risk populations. 39. Aromatase inhibitors show promise as a potential treatment for a subset of colon cancers that express estrogen receptors, highlighting the ongoing exploration of hormone modulation as a novel therapeutic avenue in colorectal carcinogenesis. 40. The Warburg effect, characterized by increased glycolysis and lactate production even under normoxic conditions, is a key metabolic feature of colon cancer cells, and targeting this metabolic reprogramming offers a potential strategy for selective cancer therapy. 41. Serrated polyps, which include sessile serrated lesions and traditional serrated adenoma, have distinct molecular and histological features and are an important precursor to colon cancer, underscoring the need for their accurate identification and removal during colonoscopy. 42. The PI3K/AKT/mTOR signaling pathway is frequently dysregulated in colon cancer, contributing to tumor growth and survival, and it represents an attractive target for therapeutic intervention, although drug resistance remains a significant challenge in clinical applications. 43. Anti-angiogenic strategies in colon cancer focus on inhibiting the formation of new blood vessels necessary for tumor growth and metastasis, with agents like bevacizumab demonstrating efficacy in improving survival when combined with chemotherapy in advanced stage disease. 44. In the context of colon cancer, the CpG island methylator phenotype, CIMP, represents a subset with distinct clinical and pathological features, including silencing of tumor suppressor genes through hypermethylation, and has implications for prognosis and treatment responses. 45. Physical exercise is noted to be beneficial for colon cancer survivors, assisting in recovery, reducing fatigue, and potentially lowering recurrence risk through mechanisms involving improved insulin sensitivity, reduction of inflammatory markers, and modulation of metabolic pathways. 46. Research into exosomal communication in colon cancer suggests that these small extracellular vesicles can mediate intercellular transfer of molecules such as proteins, RNAs, and microRNAs, influencing tumor progression and metastasis, and opening avenues for targeted therapeutic manipulation. 47. The involvement of cancer-associated fibroblasts in the desmoplastic response within the tumor microenvironment of colon cancer highlights their role in promoting invasion and resistance to therapy, thus representing a potential target for novel anti-stromal therapeutic approaches. 48. Understanding the interplay between chronic inflammation, often driven by cytokines and inflammatory pathways like NF-κB, and colon carcinogenesis provides insights into potential preventive and therapeutic strategies aiming to modulate the inflammatory milieu in colorectal cancer. 49. The development of inhibitors targeting mutant forms of the APC protein, a tumor suppressor frequently altered in colon cancer, remains a significant research focus, as restoring or compensating for lost APC function could curb abnormal cell proliferation and reduce cancer progression. 50. Progress in organoid technology allows the cultivation of patient-derived colon cancer cells in three-dimensional cultures, offering powerful platforms for personalized drug screening, understanding tumor biology, and advancing precision medicine endeavors in colorectal cancer research. 1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. 2. Understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. 3. The diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. 4. Medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. 5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. 7. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. 8. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. 9. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. 11. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. 12. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. Factors contribute to individuals' susceptibility to ischemic heart disease, with polygenic risk scores and aiding in risk strategy. and personalized prevention to genetic profile. The phenomenon of artery spasm, where vasoconstriction leads underscore identifying and managing stress, cold exposure, constrictive drugs in these. Ischemic heart disease affects individuals with like diabetes mellitus, accelerates atherosclerosis through mechanisms such as oxidative stress, rigorous glycemic heart rate variability. This provides insights into dysfunction in ischemia, where reduced sympathetic predominance and heightened risk for cardiovascular. 7. Advances in such as stem cell promise for repairing the heart by regenerative tissue and improving post-myocardial and 18. The role in ischemic heart disease, with condition and anxiety linked muscular risk through physiological mechanism hypercortisolemia. 19. Anemia, an of homocysteine, full risk factor for disease, emphasizing dietary intervention with folic acid for cardiovascular. 20. Cardioprotective fatty acids in ischemia attributed to their antioxidants, which help reduce and improve and lower triglycerides. Remote ischemic repetitive episodes confer organ protect injury, representative intervention with ability in ischemic. 2. The use of pressure monitoring in ischemics provides valuable insights into nocturnal blood pressure variability, cardiovascular antihypertensive therapy. Pulmonary hypercapillary ischemic heart and right ventricular function exacerbating heart, necessitating management of both cardiac components. 24. Of hibernating myocardial contract reversibly impaired ischemia, revascularization function and optimize. 25. Cardiac programs, exercise, nutrition, and psychological sense recovery and ischemic heart disease, reducing recurrent cardio events. 26. Glycocalyx lining blood vessels, crucial role in maintaining, and its disruption disease contributes to stenosis and endothelium. 27. Myocardial stunning and post-ischemic of myocardial tissue, despite restored blood flow, and careful differential reversible myocardial ischemic heart disease case. 28. The explores the